Hi everyone, very good evening guys and welcome to the Microbiology LRR for the upcoming INI-CET of course. So I believe all of you have already revised the pathology LRR and now we have a single one-shot session for microbio in a similar fashion, and I don't know what the coincidence is, but we are still on approximately 120 slides, which gives us the same target of 30 slides per hour, which we had in pathology. And if before this question arises, I believe that question shouldn't, that the PDF will be shared both on the app as well as on Telegram after the live session is done. I will be sharing both annotated and unannotated PDF after this session so that you can do an active recall later on, because I think that is pretty much essential for microbiology as well. Now coming to what should you be doing in the last week after this, because we are approaching the same, right? So this goes as your one-stop solution. You have to revise this PDF. There's no two thoughts about it. Apart from that, if you've been referring to any notes of yours, be it rapid revision, main videos or any platform, the best way to revise microbiology is go through all the images that are there, because that gives you a kind of a mini revision of the entire microbiology syllabus. Just keep going through all photos, especially of bacteriology, and same goes on for culture media. If you open the rapid revision videos, there is a summary of the culture media of bacteriology. If you revise those 3 to 4 slides, which covers almost the entire bacteria in a very limited, less than a 15-minute duration. So that is what you should be must to do things in the last 1 week. But we'll talk more about it. Let's get going with today's session. And yes, if you ask me, is this the only thing that will get you all 100% questions? I don't vouch for such unrealistic strike rates, because 1, 2, 3, 4 hour session can never replace a 20, 30, 40 hour syllabus. But we will try our best that we do whatever we can, and of course with fingers crossed that it helps us in the exam. So you would expect most of it to be general, in that order: general micro, then fungus, then bacteria. So the first 1 hour, that is the first 30 slides that we will clock in, will be general micro and mycology, like always. After that, this time again, because we are focusing more on integration, we are not going bacteria, virus, parasite in that order. I have grouped it under diseases. So we will be going ahead with everything that causes food poisoning, be it bacteria, virus, parasite. Then everything that causes meningitis. Then in the end, we will take up whatever miscellaneous things are left, for example, hepatitis, HIV, and etc. that you wanted me to discuss. Okay, so now just have faith that we have a plan and we will do well. Like we did well in pathology, we will sail through this as well. Your homework remains the same. Remind me after every 1 hour that it's over, so that I know that I'm at a right pace and I've finished 30 slides. Yes, let's get going. Question number 1 is exactly where I left the pathology LRR. So this is a kind of a continuation that we've tried to create. You've got these scientists, you remembered their name, excellent. Even if you don't, the question that came in 2025 exam was based on the year in which they gave or they got the Nobel Prize. And what did they get it for? We all know it was the T regulatory cells, the last thing that I taught you in the previous LRR, and that is going to be by the FOXP3 gene. If you remember T regulatory cells, I'm not asking you, I know you've revised it. They are actually CD4 T cells. They are going to have something extra, that is CD25, and they have the FOXP3 gene. If FOXP3 gene stops working, then what is the syndrome that I taught you? It is the IPEX syndrome. I think we already know this. Answer is clear. What about the other? If FOX L2 gene mutation, we had studied L2 for ladies, and which lady tumor, which ovarian tumor, this is mutated in granulosa cell tumor. Keep telling me the other options. What about the policeman? Very simple. If the P53 policeman is mutated, what is the syndrome running in families? It is the Lee-Fraumeni syndrome. How do I identify Lee-Fraumeni syndrome? By looking at family having BB tumors. Not writing it, because whatever B tumors you can think of in the body will come over here. Like you have blood cancer, bone cancer, breast cancer, brain cancer. If these are the ones running in the family, you're like, okay, that's Lee-Fraumeni syndrome happening in the family. Blood, bone, brain, breast. What about this? This is a very INI-CET vibe question. AIRE gene, for those who are not aware, main videos mein hai. It is autoimmune regulator gene. If autoimmune regulator gene is mutated, the patient will be having autoimmune polyendocrinopathy. So in simple words, if AIRE gene is not working, patient will have AIPE, polyendocrinopathy. And I think this is just one way of how we could revise so many things. Nobel Prize was given by T regulatory cells, so FOXP3 gene. This is just a continuation. Now I start with the real chapter. This is the first thing. I know you are very much expecting questions always on light microscope, but I think it's INI, they will focus on some other tougher microscope. So they asked you which microscope is going to assess quantitatively the chemical constituents of cells. So it's kind of interfering. How many lipids, chemical, how much lipids does a cell have, how much protein does a cell have. So it's trying to concentrate more on the constituents, which means it is interfering, and that is very good. Interference microscope, that's the only question possible for interference. So I can learn it as interfering. It is interfering with the constitution of the cells. What other questions can I get? I'm very used to getting a usual. Which microscope is this? I'm not even going to ask you. This is a light microscope. And the most two questions which I have seen so many times across any exam, again not asking you in a light microscope. Question number 1 will be, where is the condenser present? The condenser is present where in relation to the stage it is present? Below the stage. Question 1 we know. Question 2 also we know. What is the maximum magnification of a light microscope? It is 1000x. These are very, I don't expect these in INI. These are very simple questions. I mean, if they come, you'll get a mark for free, and that's obviously there. What about the other options? What is this? A dark field microscope. Tell me that one use on that truck driver where you will get, and that is going to be the spirochetes in dark field microscope. Which kind? Why is it dark? Which kind of light is taking place or is being used? Reflected light is being used, and you are going to help it. It will help you see the spiral organisms, syphilis, spirochetes, whatever you want to call it. Okay, now what if I have the same 4 options but I change the question? I hope the question is visible to you. Which microscope will you be utilizing over here? Which microscope technique is going to be utilized if you want to generate a high contrast image of transparent viable bacteria? See, usually when I want to see a bacteria, I add some blue-green color or gram stain or something I add, but I'm saying over here I've kept it transparent. How can I look at something that is transparent? Because I am trying to create a contrast. Yes, if this would be, if I label this as question 2, then this is answer 2. That is a phase contrast microscope. So now I have a question, okay, how does phase contrast microscope look like? What have you done? Because now your question is that, ma'am, you've kept the bacteria totally transparent, not given it any color. Still you are able to see it because you have worked with light. I'm changing the contrast. If I switch off the light right now, you will not be able to see me. You will not be able to see anything on the screen. But if I switch on the light, you will be able to see. I'm trying to create a contrast over here, right? So same way what they have done, in a phase contrast microscope, you will see 2 things that they have added extra. Both will have some phase contrast word in it. They have added one annular phase plate, and they have added one more thing over here, which is known as a condenser annulus. See, not the condenser. Condenser to hey, below the stage, condenser is always there. They've added one more condenser annulus over here. These 2 things together, they have changed the phase of light. By changing the phase of light, I have added a contrast. Combine the words, change the phase of light, phase contrast microscope. It will help me in seeing transparent living bacteria very well. Okay, very good. Many of you were asking that where in pathology have I read that phase contrast microscope can be used for hairy cell leukemia. If you want to see hairy cells well, phase contrast microscope is what will help you a lot. I had not written that question. What if I would have said there are a lot of prisms and polarizers being used? What word that does that guide you towards prisms and polarizers in a microscope? Polarizing microscope. Where did I teach you in pathology polarizing microscope? Kuch photo yaad aa raha hai? Apple green birefringence on a polarizing microscope. That was for amyloid, na? Congo red. We have read that in the last class, so I'm not repeating it. The only thing that I want to now repeat is what we had studied, and I think it's time to study it in detail. All of the following describe fluorescent microscopy except, for those who remember, this is the picture of fluorescent microscope. All of the following will describe it except, this is only so that I could conduct the session a little faster. In the INI-CET exam, these kind of questions don't come. They give you options, and then they conduct things like 1 and 2 2 are correct, 1, 2, 3 are correct, 2, 3, 4 are correct. So that's just to waste your time. But otherwise, essentially the topics shall be the same. Now, what is there? Which kind of light is used? Very good, it is ultraviolet light. What is that special mirror that is used? That is going to be a dichroic mirror. What is the principle of a fluorescent microscope? They say that a shorter wavelength of light is converted into a longer wavelength of light. Repeating, shorter wavelength to longer wavelength. So can I say the light wavelength is going to be re-emitted at a different wavelength? That is also correct. The only incorrect statement over here is heavy metals. I'm not applying any heavy metals in fluorescent microscope. Where can I apply heavy metals? Now tell me that. Understood? Fluorescent. Why did I now say that I taught you last class also? Because in the last class we studied two things, na? Direct immunofluorescence, indirect immunofluorescence. Direct immunofluorescence was for antigen detection, indirect immunofluorescence was for antibody detection. Do you remember all these things from the last class? So today we finished that fluorescent microscope. It uses UV light, it uses dichroic mirror, it changes the wavelength of light. Heavy metals, excellent. If at all I have to use heavy metals, that will be used in an electron microscope. This is how it looks like. It looks exactly as if, something like a spaceship. It is all enclosed. And why is that so? Why is an electron microscopy enclosed from all places? Because electrons will only travel in vacuum. Now you can't make electron travel like this in the air. So that is why I have kept this. This is electron microscope. Amazing. What I'm not writing is what I've written in the last class. Very recently I wrote it in Pathology LRR. What is the fixative for an electron microscope? I'm not even asking you, saving on time. For light microscope, we had studied it was 10% neutral buffered formalin. For electron microscope, you guys had told me, ma'am, it is 2 to 2.5% glutaraldehyde. All fixatives we have done. So let's save our energy and let's move on to a question that came 2 years ago, if I remember correctly, in INI-CET. A lot of PYQs in the first 1 hour. Pathology mein first 1 hour was tougher. Micro mein it's ulta. If I keep the first 1 hour tough, all of you will run away. So the first 1 hour is very easy. Life gets tougher in the second half. Now starting with this, you had to match the following. Let's start Neisseria. Neisseria having locomotion. Neisseria is a cocci. Cocci are small bacteria, ma'am. They don't move, but Neisseria is an exception. Neisseria moves because of a pili. If they don't write pili, they will write the other name, and that is fimbriae. Usually if you go to the basic anatomy, fimbria or pili are for attachment, when two bacteria want to attach with each other, but there is an exception. This was the INI-CET question. Type 4 pili is used for movement by which two bacteria? One is Neisseria, the other is Pseudomonas. Please, PYQ hai. You should not be taking more than a split second to solve PYQs, and that is a must, bare minimum necessity, right? So which are the two bacteria which have type 4 pili which help in movement, which is a rare thing? Neisseria and Pseudomonas. Let's move forward. Belantidium coli, we will never forget it with celi, so that also seems fine. Who's forgetting Trichomonas vaginalis and the strawberry cervix? So that, remember that story of the fashionable South Delhi girl liking strawberries, exotic fruits? I will be talking about this eventually, but can you recall that the Trichomonas had how many flagella? And if you remember that 4 that fringe cut anteriorly and then 1 long ponytail posteriorly, that is how we had studied her fashionable haircut. So 4 anterior flagella plus 1 posterior flagella, total how many flagella? A total of 5. Very good. Strawberry cervix, we know that. Coming to the last, Toxoplasma gondii, I don't know any motility, it does not have any. And if you remember, how can I go ahead without writing or making a cat? Because in some time Toxoplasma gondii, what is the definitive host of it? It is the cat, and I will talk about it. So this was simple. Let's add on some more motilities, do one more question. These 2 questions you will see in every session of mine, because that's the best way of revising every motility that you have. 1 out of these will come in some form or the other in the exam. Another type of motility that you had to match. This question was not there. I've added few more motilities over here. Let's try and solve the ones that I know, because when it is match the following, you don't have to know all of the options. Even if you know 2 or 3, you'll figure a way out. So let me start. I can never go wrong with falling leaf motility. Girta hua leaf has to be our Dadaji Giardia lamblia. I can never go wrong with the differential motility, because that has been asked so many times. Listeria. Listeria has what kind of, remember that drunk friend of all ours? rung friend falling here and there, tumbling. But why differential? Differential because it is different at different temperatures. It can tumble at a low temperature of 20 to 25 degrees, but it cannot tumble at a high temperature of 37. How did we learn? You can afford to get drunk in your 20s because the liver is with you. You cannot afford to get drunk at 30s because the metabolism is not with you. So that is just listeria. So can I say it shows you both tumbling and differential motility? Yes. आगे चलते हैं. What is this corkscrew? Which is that bacteria which looks like a screw and moves like a screw, and the patient is also pretty much screwed because that truck driver story over there. So that is the corkscrew motility. The same with treponema, or what you call as syphilis. It looks like a screw, it moves like a screw, the patient is also screwed. I mean, sorry for my words, but just for learning. Bacha kya? Rotatory motility. Maybe you've read this in detail, maybe you've not. But do you know rotatory motility is shown by Balantidium coli? While all of you study that, oh, coli is cilia and it has cilia, but how does it move because of that cilia? It goes gol, it goes round and round. That is a rotatory motility. Okay with everyone? This is just one, but one very fancy motility without which, if I go forward, I won't be able to sleep at night, that I didn't teach them completely. And this is the motility where you see these concentric circles. So you know that I'm very confident it is the swarming motility. A quick 30-second revision of all the bacteria that can show me swarming motility. We all remember PVCs, and the first one is always the thing that comes to my mind first when I see this swarming motility, and that is going to be Proteus. What else? Complete this and then I'll tell you one question of each one of these. P say Proteus will show you this motility. Which Vibrio, and please don't mark Vibrio cholera, because I hope you remember Vibrio cholera, that rice water stools, I will be making star in front of it because it shows me a darting, shooting star, very quick shooting star motility. So Vibrio cholera cannot show me swarming. The other Vibrios are showing me swarming. Parahemolyticus, Alginolyticus. Then C for Clostridium tetani. Tetanus ka question kahin na kahin aayega, and I have it in my LRR here. And S for Serratia. Can you tell me one question on each one of them? If I start with Serratia, and we are not going to study these anywhere ahead, so finish them here. Serratia produces what color pigment? Serratia always produces a red color pigment. So anything, like imagine someone having pneumonia because of Serratia. What will be the color of the sputum? The sputum will become red in color. Everything regarding Serratia is red in color. Talking about Clostridium tetani, I have nothing to ask you. You know tetanus. I'll have questions on it. Vibrio, Parahemolyticus and Alginolyticus. Parahemolyticus is going to, after eating what? Some kind of seafood, some kind of prawns, some seafood history, and because of that food poisoning has occurred. That is Parahemolyticus. And coming to Proteus, in a while you will be talking about, you'll have a surgery LRR also. And in that you will be discussing what? You will be discussing this calculus, the classical staghorn calculus that we have. And that is going to be caused by Proteus. What is the composition of this staghorn calculus? It is a triple phosphate. All this Proteus makes. One more question, Proteus khatam karke jao. Clinically staghorn calculus, clinically that triple phosphate staghorn calculus. But what is this? Which phenomena of Proteus? I can see one swarming happening here. Ek swarming yahan pe ho raha hai, do swarming ho raha hai, apna swarming. Imagine this is Proteus number 1, this is Proteus number 2. This is from patient number 1, this is from patient number 2. Apna Proteus, apna swarming, and in between they make a line of demarcation. Are they the same Proteus? Is 1 equal to 2? Or is 1 different from 2? Excellent. All of you called it. Dine's phenomena. Dine's phenomena just tells me that, and the fact is that they only have one picture. Unless they give you hand-drawn picture and try to give you something else, that's a separate story. But if they pick it up from Google or from their previous bank, this is the only picture that they've got of Dine's phenomena. So over here you can see there is a line of demarcation. There is a border created. This means they are totally different. So remember, the different stains in Dine's phenomena will show you a demarcation line. Is that okay? So I think I've covered PVC's one question, and I'll talk more about it. Meanwhile, some of you were being very smart, and I'm so proud of you that you told me, ma'am, Clostridium tetani shows you drumstick appearance, which is great. Let's move forward. All these swarmings and so much done, let's move on to something different now. During the microscopic examination of a sample of a patient having tetanus, because you were talking about tetanus right now, there is some staining method that has been used for visualizing spores. Usually my focus is always on grand stain, Zn stain. हम वो miscellaneous वाले भूल जाते हैं. So I've got all miscellaneous stains in one options, and we'll do them one by one. What did you mark? Most of you, okay, some of you said A, most of you said B. I'll go with the majority over here. First, let me tell you spores. When I'm talking about spores, why did I select malachite green? Because the name for the spores is going to be the Schaffer stain or the Ashby stain. And in that, what we have is malachite green. I mean, you have to learn the name. Spores is going to be Schaffer stain or Ashby stain. But did I have to learn this in so much of detail called malachite green? If you remember, socho that you forgot this in the exam, you could have still attempted it. Silver stain, no, silver goes more in favor of that. What is that bacteria in the stomach? The Warden starry silver stain for H. pylori. So I would have said that I don't think silver is here for spores. That doesn't make sense. Then crystal violet. Crystal violet, I don't read here much, but if I ask you 4-5 days, go back to pathology, think of some bodies in an anemia which I taught you towards the end, which was stained by crystal violet. Do you remember G6PD deficiency anemia? Do you remember the Heinz bodies which were stained with crystal violet? I don't study crystal violet too much in bacteriology or over here, तो ये भी spores के लिए नहीं लग रहा. What am I left with? Leafson and Rue stain. Always remember, Leafson is for locomotion. Locomotion से क्या होता है? कौन कराता है? Who causes locomotion? Flagella. So Leafson and Rue stain, these are very INI-CET वाले rare वाले stains. They are there even in your rapid revision, but we don't pay much attention to it, right? So now locomotion के लिए Leafson and Rue stain for flagella. What am I left by ruling out? Spores. Spores के लिए Schaffer-Fulton stain or Schaffer-Ashby stain. We use malachite green. I have not gone into too much of detail, but अगर ऐसा कुछ बनाते, एक growth chart curve बनाए, which is a very neat PG-ish question, but where does spore formation occur? In which phase of the growth curve does spore formation occur? Can I say in the stationary phase the spore formation occurs? So a quick recap, what are the phases of the bacterial growth curve? It's not a very INI question, just doing it for completion, that what if they complete, they want to give you a neat PG question. What are the stages? First is the lag stage where the number is not increasing. Then the bacteria starts dividing. So if it's dividing, then the number will increase. That is the log phase. Then comes the stationary phase, and it is in this stationary phase that the spore formation will occur, and finally the bacteria will start dying. So that is going to be the death wala phase. We will talk about this more when we go to the NEET PG FMG LRRs, because those are where such questions come more. Anyway, this is done. Let's move on. How can I not revise my usual wale stains? Doesn't mean I forget my basics. Let's spend one minute on all of these usual stains, because you never know what gets your question out here. So you have something to do with gram staining, and I always give you the same two bacteria. Staphylococcus aureus, which I hope you remember is gram positive cocci, and E. coli, which I hope you remember is gram negative bacilli. Now they are saying primary stain added, mordant added, decolorizer has been added. Guys, read carefully before you attempt. Doesn't mean कि पिछले वाले में I have the same question every time, and every time I change the answer. Every time I change the language so that you get multiple variations of the questions. This is not the same question I taught you in the last class. What is the timing? The timing of decolorizer was not monitored and has been prolonged. What is the expected result of this faulty gram stain? And now most of you initially said, acha 1, 2, 3, is stage tak aate aate, maybe I want to say both organisms appear purple, but the correct answer is that both organisms will become colorless. Listen to me carefully. This is the gram stain, usual wala pad lo. How do you study gram stain? We study by come, in and stain. We know that. Quickly revise what all you are adding. First thing that I add is going to be crystal violet. That is why everything becomes violet. That is why everything becomes purplish violet. After that I add the mordant. The mordant is iodine. So they said primary stain added, then they said mordant has been added, then they said decolorizer has been added, and decolorizer is always alcohol acetone. Okay, after that I add the secondary stain, and that is saffron in red. What are the expected results? Starting mein when you added violet, ma'am, everything over here is going to become violet because ek hi cheez add kara na, violet. Then you add iodine. Iodine is like a hammer, a fixer, a mordant. It will make it further violet, further purple. Then you added decolorizer. Gram positive always remains purple. Why? It doesn't give away the color, because I will tell you in a while, gram positive has a lot of peptidoglycan. Tabhi it always says I will hold on to the purple color. But gram negative says I don't have peptidoglycan, I will give it away. But I said decolorizer thoda zyada der ke liye lagaya. You prolonged the decolorizer. After a certain while, if you keep adding this for many minutes, even this purple color will end up getting vanished, because at the end of the day it's alcohol. So both of them will end up becoming colorless. That's why they called it a faulty gram stain. But ideally, if you've monitored it, positive purple ही रहता है, gram negative becomes colorless. That is why to the gram negative I then give a color called saffron and red. Did that make sense? Because every time I give you the same question starts similarly, I change the last line always, because at each moment the question can change. In the last LRR I said only the primary stain and mordant have been added. What will be the color? So at the end of these two, both of them will be what? Then the answer would have been both of them become purple purple. यहाँ तक हो गया. Now I just want to quickly revise. You said gram positive always keeps the purple color. Why does it keep the purple color? What does it have in too much? It has a lot of peptidoglycan. Jaldi se tell me, if I get a question how to differentiate positive and negative cell wall of a bacteria, when is it gram positive, when is it gram negative? You will say number one, I will look at the peptidoglycan. If the peptidoglycan is too much, it is gram positive. If the peptidoglycan is बहुत छोटा सा पतला सा very minimalistic, then it's going to be gram negative. This is okay. Coming to the next, I also look at teichoic acid. Teichoic acid will be seen in a gram positive cell wall. It will not be seen in a gram negative cell wall. What is teichoic acid? I had learnt it. It is for ticna. Ticna basically means it is for attachment whenever the bacteria wants to attach. So that is also for gram positive. What next is going to be the pentapeptide, because now the next photo will come to you. They will give you this picture where they will label nam nag nam nag nam nag. ऐसे alternate चलता है ना. Even in gram positive nam nag nam nag, even in gram negative nam nag nam nag, ऐसे ही चलता है. But then how do I differentiate? Is anything connecting the nams? Over here I don't see anything connecting, but over here can I see 5 dots connecting the nams? If the nam and nam are connected by 5 dots, pentapeptide, that is gram positive. We all know it. Perfect. So gram positive में क्या क्या देखेंगे? We will look at peptidoglycan, we will look at the pentapeptide, we will look at the teichoic acid. So then everything is with gram positive. What is with gram negative? उसके पास peptidoglycan भी नहीं, penta भी नहीं, teichoic acid भी नहीं. What does it have? Very good. It has lipopolysaccharide. That's PYQ INI-CET. Revise with me. That will finish off cell wall entirely for you. It's not a rapid, मतलब पूरा ही हो जाएगा खत्म topic. When I say gram negative, it is lipopolysaccharide. So what are the 3 regions? You learn it as OPA, or you just put your common sense. O से तो O antigen. Then it has to be lipo and polysaccharide, right? So P से क्या होगा? The polysaccharide part. Lipo कहाँ गया? The A is actually lipid A. So repeat with me. What is OPA? Number 1, O antigen. O antigen is the same antigen you are using for which test? Typhoid का कौन सा test होता है? I will write in a while. Vidal test. Vidal test में you are testing for O antigen, right? So that O antigen is coming from here. So O antigen होगा, then there is polysaccharide, then there is lipid A, and all of this is done. I think the first twist in the story everyone understood. Agla question is also, don't be overconfident, read carefully, because these two being very primitive, I added twists in their MCQs. During the Zn stain, which of the following statement will match with the concept of heating the slide after adding carbonyl fusion? So you know that mnemonic, class has asked mnemonic, वो सब पता है. Attempt the question which I have given over here. A, B, C, D, a quick answer, then we get going. Okay, so everyone has become a little cautious. Now you started reading carefully. The questions are not falling, answers are not falling the way they were earlier. So there's a good confusion between B and C, because all that you know is heating क्या होता है. Because ma'am, you taught us that in this, when you say class has asked mnemonic, तो C तो सबसे पहले you had added carbonyl fusion, and the next thing that you were doing for the mordant is actually heat. Heat is what kind of a mordant? If you were just too much in a hurry, you would have marked B. Is heat a chemical? I mean, put your common sense into it. Is heating a chemical? No, heating is a physical method. कोई chemical थोड़ी होता है. It's not some alcohol or iodine or something. हाँ. In the previous wala, if you would have asked me, iodine is what? Iodine is a chemical. I should have called it a chemical mordant. But over here, heat is what? Heat is of course it's a physical mordant. So what should be your correct answer? It is going to melt the mycolic acid, acting as a physical mordant. More than anything, it was just about being very patient, common sense अपना apply करो, and just attempt on the basis of that. Of course, after that we are adding a decolorizer, which is acid alcohol. Most commonly we use sulfuric acid. For TB, how much sulfuric acid we use? 20 to 25%. And then for the background, what is that blue color stain we use? That is methylene blue. So class has asked mnemonic mein finally, what is the color of the organism? The organism comes red in color. What is the color of the background? It is going to be methylene blue. So that is blue in color. I hope this is okay with everyone and you did not fall for, some of you did fall for that trap के जहाँ mordant मिला mark करो आगे बढ़ो. below. You can't be that casual while attempting questions. I know right now it's an LRR, you are a little casual in comparison to your exam, but of course in your exam now you'll open your eyes and you'll see it properly. There's one more question which I think we have attempted earlier in our Q bank also. Which organism listed below are capable of being stained with acid fast? Acid fast is the same Zn stain that we are talking about. And here, of course, you will tell me that you got typical INI question from the Q bank I have taken. So this is a multiple choice question. Over here, everything other than 1, 2, 4, 5 is what most of you are marking. So how do you learn all the Zn stain positive things? My nose is cold and hot. Pehle to ye mnemonic bana kaise? Why are you saying cold and hot? Because in the Zn stain, are you heating? I am heating, yes. But if I don't heat it, if this step is missed, what kind of a Zn stain would I call it then? A cold Zn stain or a Quignon stain, right? And where do I use a cold Zn stain or a Quignon stain for? The cold Zn Quignon stain for coccidian parasite. So repeat, coccidian parasite ke liye cold Zn stain, other name Quignon stain, and also known as the Gabbett stain. What are the coccidian parasites? In roughly half an hour we'll come to them. Lot of clinical questions. The Spora brothers, Isospora, Cyclospora, and our Nita Ambani mnemonic, if you remember, Cryptosporidium, all of these are coccidian parasites. Apart from that, for every mycobacteria that you have ever heard of, TB, leprosy, etc., etc., my nose, that is Nocardia and Legionella. My nose is done, cold is done, bacha kya hot, hooklets of hydated, that hydated cyst. And next you will tell me, other than hooklets, T se kaun sa? Tinea saginata or Tinea solium, which one of them is acid fast? Always remember it is Tinea, Tina, हो से तो हुकलेट हो गया. टी से क्या है? टीनिया कौन सा वाला? टीनिया साजिनाटा is going to be Zn stain positive. Now I have another INI type of question. You were saying that heat is the physical mordant. But in cold Zn stain, you have removed the heat. Then what is the mordant in that case? Now that's another maybe assertion reason, maybe a very logical question. Who na logical hai na ki mordant to add hi nahi kara. It's a cold Zn stain. Then who is acting as the mordant? In this situation, I will increase the level of what is carbol fusion. Kya hota hai? Phenol hai na? It's carbol is a phenol. I will increase the concentration of phenol. Can I say in that case, I am actually using what kind of a mordant? A physical mordant or a chemical mordant? If I'm using phenol or carbol, I'm basically using a chemical mordant in that case. So now एक line में अगर decide करना हो, for Zn stain we use a physical mordant which is heat. But if I'm doing cold Zn stain, then I'm using a chemical mordant which is going to be carbol fusion. हुआ थोड़ा गया concept in your mind. I hope it's clear, you won't make those errors and I can move forward to an image based question. These days they like to give that there's a question which is theory but the options are image based. They say which of the following image best describes a high frequency recombinant HFR male bacteria? ABCD. A quick answer on that, jaldi bata do, because not much for us to discuss here, just definitions and we move forward. Okay, most of you are saying D and C. Okay, C, majority. My vote will always be for majority of you. Hoping that you are right. Let's start. Most of them, the green color, because it's present in all, that's the DNA that every bacteria has. I mean, every bacteria has a DNA, which also tells you what is the DNA of every bacteria. It is always round, circular DNA hota hai for every bacteria. Now, the bacteria which have the fertility plasmid, they are known as F+. The bacteria that don't have a fertility plasmid, they are known as F-. This is simple. I don't think they will ever ask you questions. They will say if this fertility plasmid and the DNA end up fusing, तो ये बना ना high frequency recombinant where the fertility and the DNA have fused. If they have fused, it is recombinant. If they separate, now after the fusion, if they end up separating, so देखो green color वाला DNA separate, but when the fertility plasmid separated, it took a little bit of a DNA with it. Little bit DNA took, and now what is this called? This is called F prime. When they say F prime, it is the same fertility plasmid plus some chromosome or DNA part that it has taken away from it. How did we learn it? That first they were in a relationship, then they decided no, it's not working out between us, so we need to break up. When they decided to break up, then the fertility plasmid said, I will not give away all the iPhone and gifts that I've received. So it says, I will take a little bit of the DNA, I will take the gift that I got, and I won't be returning it. So this fertility plasmid is now known as the F prime. बस HFR पूछा तो option C आंसर है. If they would have asked me mark F prime, I would have marked D as an answer. That is, many of you were confused. I hope you're not confused now. तो ये जो है ये fertility plasmid, if this has to, let's imagine this is a male having a fertility plasmid, this is a female not having a fertility plasmid. If male wants to transfer it to female, तो क्या होगा? Contact से मैम transfer हो सकता है. What is this process known as? This process is known as conjugation. Conjugation happens through what? What is this attachment? Flagella makes an attachment or Fimbria pili? It is obviously Fimbria or pili which is going to make an attachment, which brings me to the first slide that I did today. Fimbria or pili is always for attaching to bacteria, except for type 4 pili, which I've already written. That is for motility. Which are the two bacteria which use type 4 pili for movement? Number 1, repeat, Neisseria. Number 2, Pseudomonas. We are done with questions. Very good. Agla question, very, very obvious. I know you're looking for an option. You're not finding that option. So now search for the next best option that you can find based on what you want to mark. What is the ideal agent? I can see a scope. कोई scope का photo होगा, bronchoscope, laryngoscope, some of the other scope will be there. Whenever they say scopes, the first thing that comes to my mind is Sidex, glutaraldehyde. Glutaraldehyde options में नहीं है. So many of you are writing isopropyl alcohol, नहीं. Ethylene oxide, कुछ और क्या क्या ढूंढ रहे थे? You were thinking मैम scopes के लिए Sidex. Sidex is glutaraldehyde. I don't find glutaraldehyde, but I find something else, that is O-thalaldehyde. Please note, glutaraldehyde that you have read is Sidex. It is readily available in the market, but it is not a ready to use solution. Whenever we get Sidex ka bottle, there is another thing which we need to activate this Sidex by mixing it with some chemical, and then it can be used. But for all practical purposes, Sidex is used for all the scopes. Do you know what is better than glutaraldehyde? Is O-thalaldehyde. It is better because it does not need any activation. It is, can I write RTU, समझ जाओगे बाद में. It is a ready to use solution. So some aldehyde has to be used. Glutaraldehyde and O-thalaldehyde में से, if both would have been there in the options, what would have been better? What is convenient to use? Pick up a bottle, use it. Ready to use wala is convenient. So O-thalaldehyde would have been better. If O-thalaldehyde is not there, then for all the scopes, I will use glutaraldehyde or Sidex. Is it for all the scopes or is there an exception? Ma'am, except for arthroscope and ureteroscope, these are age-old questions. We are using plasma sterilization. What is plasma sterilization? That is exactly the next question that I'm coming to. The following machine, this is the machine, और कुछ भी नहीं लिखा होगा. They will just give you this white color dabba. Now this is for you to know that what is in sterilization, disinfection, this white color dabba. It is a machine which is known as Stirad, and that machine is for plasma sterilization. So my question is, what is plasma? How are you making this plasma? Plasma is not the blood wala plasma, we know this. Plasma is something like fourth state of matter. We are trying to do some scientific experiment. We are making plasma. Plasma is made from what? It is made from hydrogen peroxide, that is H2O2, in the presence of some UV photons. So what I do in this machine, I take H2O2, uske upar what do I strike? I strike some UV photons, and then what is generated? It is plasma that is generated. All of this is in a white color dabba because I have maintained vacuum. I have maintained a very low temperature, and this plasma sterilization, this plasma will now be used to clean arthroscopes and ureteroscopes. Very good. So a quick recap, all scopes के लिए I use Sidex. Sidex is glutaraldehyde, but glutaraldehyde का भी better version is O-thalaldehyde, except arthroscopes and ureteroscopes where I use the plasma sterilization. And for our own doctors का stethoscope, that is not endoscope, bronchoscope, ये तो body के अंदर जा रहे हैं. These are different. Stethoscope is something just placed on the chest or the skin contact. So for all these stethoscopes, what we prefer is isopropyl alcohol. Very good. What is this written over here? एक ये बचा. Ethylene oxide क्या होता है? It's a gas. Which kind of sterilization is ethylene oxide? ETO लिखा होगा. Ethylene oxide. It is a gas sterilization which is used for ventilator kind of machines. That is why it's not present in every hospital, in every unit department, because it is used for cleaning the cardiopulmonary machines. Cardiopulmonary. I hope you'll get these short forms. Okay, perfect. We'll have more questions on it, but abhi ke liye let us move forward and let me ask you the controls, because without controls, there is nothing in a laboratory that can be complete. Either it comes as a one-liner, or they'll make you an intern, or they'll give you match the following. कुछ तो control पे आएगा. So you match the following, that completes the table. When I start with hot air oven, by the way, I've also got you a picture of a hot air oven, so keep telling me the temperatures, keep revising maximally that we can. So hot air oven ke liye, what is the control that we use? We use Bacillus subtilis or Bacillus atrophius. Keep telling me the temperature for a hot air oven, 160 degree for 2 hours. That is okay. Also tell me, what will you keep inside a hot air oven? You can keep anything made up of glass, like a flask or a test tube, anything glassware. How do you close glass? You already close it with cotton swabs. So anything that is glass, anything that is cotton swabs. And remember that song that we did, oily, greasy, dusty, liquidy. So all these things, let's say I say you want to clean liquid paraffin. Okay ma'am, anything oily, greasy, liquidy, dusty, ye sab to liquid paraffin. If I say there is a greasing material and you want to clean it, so greasy ke liye hot air oven. I say there is a dusting powder, dusty, so dusting powder is going to be hot air oven. So oily, greasy, liquidy, dusty, in sab ke liye hot air oven. I think I'm done. Coming to what we just now studied, plasma sterilization. I know what is plasma sterilization, वो sterad वाला white वाला डब्बा for the arthroscope and ureteroscope. So for plasma sterilization, what is going to be the control? It is Bacillus stereothermophilus. Is this Bacillus stereothermophilus also a control for something else? It is also a control for autoclave. So Bacillus stereothermophilus is a control for two things, for plasma sterilization and for autoclave. उसका भी temperature बता दो. Autoclave का तो 121, 15, 15. Let's not waste time on this. We know it, 121 degree, 15 minute, 15 psi, that is the pressure. It's like a pressure cooker. So there's going to be a whistle on top of it, just like a pressure cooker. Just imagine a long pressure cooker of your kitchen has been put in a lab. It's giving that whistle by cooking food. So yes, what is the food that you have kept inside it? It is kept in all OTs. So all the OT apparatus, they will say the instruments, surgical instruments, OT mein all the aprons that we wear, everything that the healthcare professionals wear in the OT, use in the OT, all of that is cleaned over here. So we also use sutures. All the sutures are kept inside and cleaned it. All the culture media in the microbiome lab are kept inside and cleaned it, but they will ask you exceptions. All sutures except catgut. Catgut ko you cannot keep at 121 degree, it will get spoiled. So basically I don't heat it. And what about media? All media, blood agar, chocolate agar are kept in this except LJ and LSS. We will write it in a while. LJ to sabko pata hi hai, TB के लिए. LSS is Loeffler serum slope, that is for diphtheria. All this is coming up shortly. LG and LSS, if I have space, I will write, is done by what? It is done by inspissation. Why am I not doing LG, LSS cleaning in autoclave? Because 121 degrees, these contain egg. Anything that contains egg and I heat it to 121, it will become anda fry. Basically the egg will get spoiled, these media will get spoiled, and I don't want to spoil them. That is why I use inspissation for them. Many of you typed omelette, very good. Coming back, we've gone like, this is like a Viva, I'm acting like that Viva examiner ke ek se dusra, you were going to multiple options. But coming back, for hot air oven, what was the control? Bacillus subtilis or atrophius. For plasma sterilization and autoclave, what is the control? Stereothermophilus. What is membrane filtration? Filter to chota sa filter hota hai. What is the size of a filter? That is also a previous year NEET PG question. Filter is 0.22 micron. So think of chota sa, small little bacteria, and the small little bacteria, let's use a different color code. Small little bacteria is Serratia. Did I just tell you Serratia red color pigment banata hai? Serratia is small, so it is used for filtration. Finally, coming to ionizing radiation, and that is going to be Bacillus pumilis. That is Bacillus pumilis. Done. Have I missed out on one control? What is that? Ethylene oxide gas sterilization. So ethylene oxide ke liye number 5, ethylene oxide gas sterilization ke liye Bacillus globigi. They might write gas sterilization, they might write ethylene oxide. It both means the same. Sare controls have been got down to 1. Can I move ahead? Moving on to the next topic. These are 2 questions which are INI-CET, what can I say? They are finds of INI-CET, discoveries of INI-CET. They were first given in the AIMS exam, and from then we started teaching them. So now let's start with the cell wall given over here, and they are asking which likely or which set of organism is it most likely to belong to. So Aspergillus, Mycobacterium, Mycoplasma, Rhinosporidiosis. As soon as I look at this, I see manoproteins, glucans. This is not, see, agar usme peptidoglycan and all hota, I would have thought of bacterias. This is manoproteins and glucans, so definitely the bacterias are ruled out. It is fungus. Ab Aspergillus is a definitive fungus, and the answer over here. Even Rhinosporidium seaberry, for a long time it was considered as a fungus. Now is it considered as a fungus, or has it been reclassified into an aquatic protozoa? तो अब तो इसे fungus मानते ही नहीं. So this is also ruled out. I have only one answer, Aspergillus. In fact, today when you go to any lab and you want to do the test for aspergillosis, invasive aspergillosis या कोई भी aspergillosis, this is the test that we do. The name of the test has only been kept as galactomannan test. The name of the test is Aspergillus galactomannan test that we do. So they will always ask you, galactomannan test is done for which fungus? It is done for Aspergillus. Very good. Coming to the next, ये क्या लिखा है? Glucans. So that is also something to do with fungus, and that's the next question. A typical Ames find. Which of the following conditions cannot be diagnosed on beta 1,3-D? Abhi you said, ma'am, all fungus have beta 1,3-D glucan. All the fungus can be diagnosed. Which are the ones that cannot be diagnosed? That is Bangalore Medical College. Many of you were typing BMC. So which are the 3 fungus जिनमें beta 1,3-D glucan has no role in the testing? Blastomyces, which we will come to in a while, वो figure of 8 appearance. The most important question over here, which is mucormycosis, and also for cryptococcus. कुछ याद रहे, you remember Bangalore Medical College, you don't, I don't care. But you have to remember that all fungi will show positivity for beta 1,3-D glucan except mucormycosis. This is the single standalone most important thing that you have to know. Mucor में ultimately I realized that no test comes positive. Does the galactomannan test positive? No, galactomannan तो aspergillus का है, तो mucor में नहीं आता. Does beta 1,3-D glucan test come positive? No, ma'am, that also does not come. Mucor में nothing comes positive. That's a single best way of learning it. Let's move forward. I am expecting something to do with culture media because they've asked too much of that blood agar, chocolate agar, bacteria का तो बहुत हो चुका है. They might want to change the topic and ask you something to do with fungal culture media, and that is why I would give you questions on SDA in all of these tests that I've given this time. SDA, why is it used for dermatophytes, which is a fungus in clinical mycology? Basically they want to ask you क्या होता है, कौन सा pH है. So SDA, Subaurous dextrose agar, has an acidic pH of, जैसा दिख रहा है, looks like a 5 or a 6. So I keep the pH a little acidic. I keep it somewhere around 5.6. So it is an acidic pH. And does it have addition of things like cyclohexamide and gentamicin? Why have you added all this? Because what are you wanting to grow? I want to grow fungus. तो सबसे पहले I don't want to grow any bacteria. Put antibiotics, तो bacteria नहीं grow करना चाहिए. Also put some antifungal, and that's a very, something which students ask me that, ma'am, why would you want to add antifungals in SDA? You want to grow fungus and you are adding antifungals in SDA because let's say you've taken the sample from skin. Your skin has normal fungus also. Do you want normal fungus to grow? No. I want the disease wala fungus to grow. So I will add antifungal agents also so that the normal fungus does not grow. I will add antibiotics so that bacteria does not grow. And this is everything regarding SDA that you should be knowing. Number 1, I am adding a pH, acidic, 5.6. I have added antifungal agents. I have added antibacterial or basically antibiotics so that idhar udhar ki things don't go. The main fungus that I want, only that should grow. Perfect. But now that you've done one thing, you will have to do everything else. All the stains for fungus. A quick, I think this will not take more than 30 seconds. Black color wala to has to be silver. They will write it as GMS. Mind it, in the exam it will be written as GMS. Gomori methenamine silver stain. I'm not writing silver. Kya color dega? Black. Do we know it? Yes. Next stain is PAS. PAS kya color dega? Do we know it? PAS always gives a pink color. Yes. This is where I expect a question. What is the fluorescent stain? Fluorescent microscope pe fungus dekhna hai. What is the stain? It is calcoflower white. Abhi I did na fluorescent microscope with that UV light, dichroic mirror. Fluorescent stain kaun sa hai? Calcoflower white. Why is it that only the outline is becoming fluorescent? Because the outline has what in the cell wall of the fungus? The outline has chitin. So this means calcoflower white binds to the entire fungus, or calcoflower white binds only to the chitin. It binds to chitin. So yaad rakhna, calco, chitin, flower, fluorescent, khatam, calco, chitin, Flower, fluorescent, done. What is the culture media? Already done, SDA. From this culture media, if I take a little bit of this whitish growth and now I look at it under microscope, now which stain have I used? Lactophenol cotton blue. Can I say I took the culture growth and now I'm looking at the culture growth under microscope? तो culture का morphology देखने के लिए कौन सा stain? Culture का morphology excellent, that is going to be lactophenol cotton blue. The stains are not done. I am coming to some more stains which many of you are writing in the comments, but just wait for another 20 minutes. We will finish and we will come to it. तो पहले तो SDA खत्म हो गया. Yes, some others are left for fungus. Negative stain नहीं करा. Aspergillus का एक नया stain जो last INI में पूछा था वो नहीं करा. Because another 10 minutes all of that will be covered. But before that you will answer one part of this question, and this is the most cluttered slide that I have. From main videos which was 20 slides to rapid revision that was 10 slides, this has now come down to one slide because it's LRR, right? So एक slide में you will now realize I have fit in so much of information that covers half an hour of your rapid revision lecture. First question is, which is not a subcutaneous fungus? And obviously the answer is Candida. Candida तो HIV opportunistic वहाँ होता है. It is not subcutaneous. Candida will occur. Candida can of course oral thrush. Candida can be seen on pap smear तो cervix में. It's not subcutaneous. Are all of these subcutaneous then? Yes. How do we learn subcutaneous fungus? It is always learned as MRCS. Please note, I'm not talking about superficial. Superficial matlab skin. This is not skin. I'm saying below the skin. Subcutaneous, MRCS. Number one, Mycetoma. Mycetoma foot is what? It is Madurella. Madurella, Mycetoma, Madura foot. Same thing. The next one is what? It is rhinosporidiosis. Do you want to discuss rhinosporidiosis in exactly whatever best you can squeeze in over here? Rhinosporidiosis, rhino, nose में कुछ होगा. Can we see that I've made a small little strawberry also over here? Can we see the nose has that strawberry polyps? Okay, rhinosporidiosis. Why did they say sporidiosis? Because I can see those round sporangia. So rhino will remind me of rhino wala strawberry polyp in the nose, rhino. Then sporidiosis will remind me that okay, sporangia. Why do I always get a history of South India? I mean, examiner is wanting me to assume so many things. He's just written South India because it has a lot of water bodies around it. So basically this has a history of swimming or exposure to sea water, but he didn't write it directly. He said patient is from South India. Now that's your hint that you will have to assume that since he's from South India, he must be swimming, he must be exposed. So I'll make some little sea water around it. Do we have any culture media for it? SDA, blood agar, chocolate agar? No. It is a non-cultivable organism, which is done. So everything about rhinosporidium हो गया, mycetoma हो गया, rhinosporidium हो गया. What is this? Exophylla. Exophylla is the name of a fungus. What does exophylla cause? Exophylla causes chromoblastomycosis. I know when you read chromoblastomycosis, you're like, that's it. But that's the name of the disease. Fungus consai. And this is, this came in the FMG exam, which was again not expected at FMG, but it is very, very much expected at the INI-CET level. What are all the fungal organisms? And now this is where the slide gets cluttered. I've tried to fit in everything so that on the last day you're thinking that you're reading half a page, but you're actually reading 10 pages from rapid revision. All the organisms that have the word F wala sound in it, like Fonsacia. Fonsacia kuch bhi likha ho. Fonsacia pedrosi, Fonsacia compacta, some Fonsacia stuff. Or Exophylla, or Phylophora, or Cladophylophora. All these FFFF wala things I will think of. Chromoblastomycosis. What is the classical clinical history? It looks as if this person has these warty lesions. So what do I call it? Verrucous dermatitis. Verruca for what? How can we forget the copper penny bodies? Examiner will not write copper penny bodies. He will write the other names of copper penny bodies. Try not to look at it. I have written it for making a flashcard for you. Copper penny bodies के दूसरे नाम बता दो. 3 more names. Medullary muriform sclerotic. Repeat with me. Medullary muriform sclerotic. 3 bodies other than their names of copper penny. That is chromoblastomycosis. Obviously pair पे हो रहा है. So they will say that there will be a history of what? Walking without footwear. Barefoot walking का कुछ history होगा. So now that is why Exophylla was written. And what is the last organism that can be subcutaneous? It is sporotrichosis. So what is not subcutaneous? It is Candida. So you realize that with this you have almost finished everything. But ये Mycetoma Madura foot पे कैसे question आता है? That's another PYQ that I've got for all of you from your Q bank only. Here you have, and this is actually in the Q bank because it's a previous year question. A 45-year-old man with a chronic painless nodule on the foot. 99% cases Madura foot है ना, तो foot का ही history होगा. Along with that, there's enlargement and there is draining sinuses with some brown black grains in the exudate. As soon as they say microscopic examination shows hyphae. Hyphae तो मतलब fungus ना, because whenever they are talking about any Madura foot, Mycetoma, is it always a fungus that causes it? No. Remember, two things can cause this Madura foot situation. Ya to bacteria, ya fungus, because that will decide my treatment. Common sense. If it is a bacteria, I will go for antibiotics. If it is a fungus, I will go for antifungal agents. And recently the exam question was that what is the thing that you're going to go in for? And students had read in pharma and in surgery and in micro that, you know, for Mycetoma, for fungal, antifungal agents don't work. So we have to do amputation. But is amputation going to be the first thing that you do as soon as the patient comes to you? No. What is the first thing that you will do? At least try your luck. Try antifungal agents. Try surgical debridement. Try to karo. What if it works? If it does not work, then to I will be going in for amputation, and there's no doubt. So the question was option A, antifungal with surgical debridement. Option B, amputation. Everyone marked amputation. But as a clinician, you can't work that way. The first or the next line of management initially will be antifungal with surgical debridement. Kaam nahi kara to go for amputation. For bacteria, I will not write it as antibiotics that you'll use. यहाँ पे hyphae बोल दिया. Hyphae मतलब has to be fungus. What are you dealing with? I call it Mycetoma. Further, if I look at the options over here, Trichophyton rubrum तो out ही हो गया. I'm thinking only of Madurella, Mycetoma foot. तो इसमें से what is Nocardia? Nocardia तो is a bacteria, ma'am. Actinomyces and Nocardia ये तो bacteria है, तो ruled out. You had said that this has to be a fungus. Fungus में एक ही बचा, Madurella mycetomatus. And what color granules does it release? It releases that brownish, blackish granules which they have mentioned over here. So a very easy way of return, remembering actino लिखा हुआ तो think of bacteria, Mycetoma लिखा हुआ EF, so you will think of fungus. Here I had to think of fungus, and that's the final answer. But I have left something while coming here. I have finished, if you look at it carefully, I have finished all the subcutaneous, Mycetoma foot, rhino, chromosporothrix, ये कर दिए. Superficial, subcutaneous के ऊपर तो skin आता है. Do you want to do an ultra quick recap? Because I know you know all those TME, PSC, mnemonics. I didn't want to waste any time on it. But one quick revision of 30 seconds do you want to do? And this will be entirely your job and not mine. I'm not going to contribute anything to it. I give this to you that you will look at it and you will now start the revision. These are all the superficial. Okay, yeah, I think now it's visible. The superficial means what? Ke sirf skin wala. Very good. So this is what you have to revise. These are all that's why I told you this slide is going to be cluttered pro max, because it's got half of the chapter in half a slide. So now these are all the superficial ones. You know all these TME, right? What is TME? TME stands for Trichophyton, Microsporum, Epidermophyton. And what did I teach you? TME for Telegram, and PSC for my Telegram channel, that is Preeti Sharma channel, PSC. So that now tells me Trichophyton has what shaped macroconidia? Pencil shaped. Microsporum has what shaped macroconidia? Spindle shaped. And Epidermophyton has what shaped? Club shaped. Ab exam mein, because you have learned TME, PSC, doesn't mean examiner is bound to give you TME, PSC, और वो कुछ नहीं दे सकता. If I would have been the examiner and I would have known that these people have been mugging up TME, PSC like anything, I would change a few things. Instead of writing, I'll say, okay, one of the superficial mycosis is showing me rod-shaped macroconidia. अब थोड़ा mix and match कर लो. Rod looks like what? Rod looks like this. Which is the closest shape does it get to? Rod looks like a pencil. So I will say, okay, they want to say pencil, they want to say trichophyton. If they say this is something to do with fusiform, fusiform basically means something like this. This is closest looking to what? It is closest looking to spindle. So now in the exam, don't be very rigid कि हमने TME, PSC पढ़ा, examiner should, if you write some random, try to mix and match and come to an answer. These were all the macroconidia, PSC. But when I talk about microconidia, can you see it's going in a decreasing order? Maximum chota microconidia are seen in the trichophyton. Few small dots are seen in microsporum, and there are no small microconidia that are present in epidermophyton, so it's going in a descending order. ये सब कहाँ जा रहा है? These are all going superficial in the skin. What else is going superficial in the skin? You cannot get this wrong. The spaghetti and meatball appearance, too much food, and these fried anda fries happening. This is the Malassezia furfur with spaghetti, meatball, and fried egg appearance. You call it Malassezia furfur. Tinea versicolor, if you want to call it clinically, I agree with you, it means the same. So now you realize why this slide is just so cluttered, but I hope you are able to make sense out of it. First half of the slide is everything occurring in the skin. Second half of the slide is everything occurring below the skin, that is MRCS, that is subcutaneous. उसमें अगली slide में आपका mycetoma भी है, and you have finished it. But now tell me, if I give you just change the entire story, this question has been asked in a different format but in previous year exams. And as I read this question, it gives me one learning point that never gets stuck on the first 2-3 lines. पढ़ते जाओ, because when you have a lengthy question, at some point it will click. There will come a buzzword where you will be able to catch it in that 1 second, and then you will be done. As I kept reading, of course, there was a lot of pulmonary symptom, some geographical location also, but then came the bamboo rats, and I have never read anything other than one fungus for bamboo rats, Penicillium marnefi. And if I read Penicillium marnefi, what is the color of the pigment that I'm looking out for? I'm looking out for red color pigment. Do you remember rat को झाड़ू से मारना है? So झाड़ू से I can see that brush broom appearance, and मार के लाल करना है. So I'm looking out for the red pigment, and hence I said the question looks very scary and lengthy, but when it clicks within a second, and that's the patience you have to keep in the exam. बस lengthy question आया, कुछ समझ नहीं आ रहा, path का है, medicine का है, micro का है, keep reading, because as I told you, the moment it will click, then you will be done. You won't have to read any further. Why did I randomly bring up this question over here? What is the family that I want to start with? Penicillium marnefi that you are saying belongs to the dimorphic fungus. Before I start, out of this cluttered slide, is there any fungus over here which can also be a dimorphic fungus? The only fungus which is subcutaneous and also dimorphic is the Sporotrichosis. Now again, another cluttered slide coming your way. One flashcard for all the dimorphic fungus. First you will tell me what is a dimorphic fungus. तभी penicillium का MCQ करा था. दो morphology, dimorphic, and we know that story. Yeast, heat, mold, cold. We have yeast, heat, mold, cold. Yes, very good. So yeast matlab at heat 37 degree, and mold is what? Mold cold. Cold matlab it is going to occur at a lower temperature, 22-25 degrees. So just remember yeast, heat, mold, cold. And then we have body heat probably changes shape. I'm not written it as a full form, hoping that you have read it so many times earlier. Body heat probably changes shape. What you will tell me, all these photos एक बार zoom in करो and let me know. Starting with blastomyces. दूसरा नाम भी बताते जाना, because that America का location is very important in the question that you will get. Sometimes that helps you get the diagnosis rather than the real photos. When I say blastomycosis, it is North America. North America का history होगा ही होगा, or they call it Gilchrist or Chicago disease. And the way you write blastomyces, you will say, okay, it's with a B, so it looks like a figure of 8 appearance, which is without zooming in, I can see. आजकल नहीं लिखते. They know you have learnt it blastomyces figure of 8. They write it as something else. They say this is to do with, see, if you say this is blastomyces, it's about divide कैसे कर रहा है. This is a broad based budding. It is a broad division that is happening. So they will write blastomyces shows you broad based budding rather than figure of 8 appearance. Body heat, how can you forget? Hi darling, see you in the cave. Remember this. Hi for histoplasma. Hi for which part of America? Ohio. Hi darling. So darling disease. See you in the cave. So cave disease. Is this sounding very romantic? Yes. Is it romantic at all? Not at all. Because cave में क्या मिलेगा? Bird का dropping या bat का dropping. So basically bird shit, bat shit. So it's not at all romantic. So hi darling, see you in the cave. But the cave is going to have a lot of shit in it. How does histoplasma look like? Histoplasma looks like either this chota dot That is the yeast form. This is the yeast form. Or you have this picture which you have studied. If you want me to draw it, this has come earlier in the exam. Tuberculate macroconidia. Tuberculate, remember this was TB ka cousin brother. Histoplasma ka sab kuch goes like TB. Which necrosis of TB? Caseous necrosis. तो इसका भी caseous necrosis. TB का same cough, sputum. We know TB का history. Same TB वाला history. But then what is the name of the macroconidia? That is also TB wala, tuberculate macroconidia. Okay, why did I call it reticuloendotheliosis? That's another very big name given. Reticuloendotheliosis क्या होता है? That's a very lengthy name given for something very stupid, macrophage. Where who will come and eat all this fungus? Always the foodie one is macrophage. So reticuloendothelial cell is nothing but a macrophage. They called it that as well. Okay, Penicillium marnefi, you're not forgetting the bamboo rat story. So bamboo rat hoga, that is the reservoir where this occurs. Rat को झाड़ू से मारना है. So what appearance does this show you? Broom appearance, मार के लाल करना है. What is the pigment? Red color pigment. Paracoccidioidomycosis, no points for guessing. Mickey Mouse appearance, no points for guessing. This looks like a pilot wheel or a mariner wheel. What is the other name? South American blastomycosis. So blastomycosis was North American and paracoccidio is South American. ये तो obvious है. It is looking Mickey Mouse and pilot wheel. Coming to coccidioidomycosis, this is the dabbas that it's going to show you. Barrel-shaped arthrospores, and we had studied it as ABCD. Do you remember? We said coccidioidomycosis का दूसरा नाम desert rheumatism. Their favorite desert is either an Arizona desert, something from US will come. तो Arizona का desert होगा, California का desert या valley होगा. तो some desert will be there, and rheumatism, obviously some joint involvement will be there. So desert rheumatism and barrel shaped arthrospores. Coming to everyone's favorite, 10 times PYQ in every exam, Sporothrix chencai. The other name rose gardener. Some thorn prick, rose garden में चल रहे थे, rose उठा रहे थे. Some rose related stuff will be there. After that, the thorn prick might have happened here, but the fungus is traveling along which channels? Highlight it as much as you can. Same photo you must have seen na, in all your GTs. कि अच्छा the thorn prick happened here, but look at how the lesions are, as if it's traveling through the lymphatic channels. सब कुछ rose होगा. It is happening because of rose prick. It is showing you also, it's looking like rose na. Does this look like rosettes? Yes, rosettes are seen. What else? What is this big body? Star jaisa lag raha hai, ma'am. I will call it asteroid body. And then there is a dot in the center, that is a cigar body. So all these words that I've written, you will get it in the PDF. So this round thing over here is the cigar body. This big star over here is the asteroid body. This looking over here is going to be rosettes. ये कैसे spread हो रहा है? Lymphatic spread हो रहा है. Everything is rose. And hence I told you that Sporothrix is the only one जो dimorphic भी है. And can you see it is happening in the subcutaneous plane? So it is occurring in both. It's an extensive table. You might feel that why did we just do it in one breath without taking any MCQ or any break? Because at least if it's a balanced paper also, na, in a balanced paper you get 2 MCQs from the same table. That's the definition of a balanced paper. That tells you the importance of dimorphic fungus overall. So last day fungus में कुछ पढ़ के जाना है. This table has to be it, whether it is NEET, INI or FMG. It's always and always going to be important. Let me move forward, take you to another INI PYQ. Very simple, and I'm sure you'll get it. Test the hai, you need to identify. That's it. Simple. You know the test, you give me the answer. Which Candida? I know you were expecting Candida albicans, but वो तो है ही नहीं इसके अंदर. So which other one which acts exactly like albicans is double. Double says I will copy albicans. जो भी albicans करता है, doubliniensis says I will double it. I will copy it. So the test that is shown over here is this is a Candida and a germ tube is coming out of it. That is germ tube test. ऐसा नहीं लिखेंगे. They will tell you the fancy name of it. Reynolds Broad phenomena. दोनों दिखाते हैं Candida albicans and doubliniensis. So can I say albicans is like the elder brother, and then double says I am the younger brother. I will copy whatever my older brother is doing. But then if you have to differentiate between them, so older brother is, I will write OG in front of it. Older brother, तो अब कुछ अगर family पे there is some kind of a problem, the elder brother will be standing. The elder brother will be able to face it. So if I say I have increased the temperature above 45 degrees, or I have kept a very difficult environment like hypertonic saline, who will survive? So you will say now ma'am the older brother will survive. Albicans, the OG, that is going to survive in all of these tough situations, and the younger brother was only copycat tha, wo aise fun mein kar raha tha, but when the situation got tough, the younger brother said, I'm not interested in all this, I don't want to grow at a high temperature, I don't want to survive in hypertonic saline. He puts all the responsibility on the elder brother and runs away. That is how you differentiate. So indirectly I am saying both of them show you germ tube test, but how do you differentiate? On the basis of these two parameters, again for INI. अब कैंडिडा पढ़ा तो सारा कैंडिडा एक साथ कर लो. Do you want to do a 30-second recap of all these photos of candida? You will answer it for me, and when I'll be giving you this unannotated PDF, which annotated so you will get within 15-20 minutes of this session, unannotated you will get approximately after 1 hour or so, because I will be removing all these labelings, only giving you these image things, so that now you don't have all these hints written and you can do it or revise it on your own. So I will be doing that. That will take 1 hour for me to prepare after the session to erase all this, but you will get it. So unannotated ke liye thoda 1.5 hour ka patience, but annotated you will get within 15 minutes of the session. Let's start. Candida ka jaldi se let's do a quick recap. Whenever they say chota chota, that's budding, but what is this long threads of candida? In the exam, if they don't give you images, this one word is the giveaway. Candida chahe eyes ka ho, mouth ka ho, cervix ka ho, ya kahin ka bhi ho, if they write the word pseudo hyphae, you are done. That is where candida is locked. Now coming to the SDA pe bhi candida ka kya hai? Creamy pasty yeasty colonies. Remember we did candida as everything type. So there's what is the thing on SDA? Creamy pasty yeasty, something that I taught you in the last class in pap smear, so I have not put it up over here. Something with on pap smear पढ़ रखा है. Kebab, shish kebab appearance. Then coming to that wala colorful wala agar, that is chrome agar. Then coming to which spore? Again wala spore, chlamydospore. On which agar do you see chlamydospore? Corn meal agar. Will they write it like this? No, they are also Shah Rukh Khan fans. They love this wala mnemonic. They will not. They will say there is double walled spore, because that is how chlamydospore looks like. Andar wala wall, bahar wala wall. They will say there is a double walled spore that is growing on corn meal agar. Now identify. So chlamydospore nahi likhenge. They will write double walled spore. You can see more photos of it. It is having two walls. That is a chlamydospore on corn meal agar. Okay, all these candidas are done. The OG elder brother, how will he grow? That is also done. Moving on to the next question, more of a pharma correlation. 55-year-old male having a history of COPD presents to the emergency department with fever, cough and worsening shortness of breath. वैसे अगर सिर्फ यहाँ पर if I stop the question and I look at COPD, तो COPD में वैसे तो most common cause of infection in COPD patients is Haemophilus influenza, right? And the second most common cause of infection is Moraxella catarrhalis. I thought initially when this question came, I thought या तो ये Haemophilus influenza है या ये Moraxella catarrhalis है, because COPD का history था, bacteria लग रहा था, fever cough भी था, I thought bacteria, but then they said the colonies have a yellow-green color which doesn't go with bacterias, and then they said HIV positive, maybe I thought immunocompromised, but here this is not HIV. Why is the immunity gone down? Because the person is on some long-term steroid, so that is another history given. I start thinking they have started antifungal, so now I'm not thinking of bacteria, I'm thinking of fungal, and what is coming to my mind with yellow-green colonies, it is aspergillus. Aspergillus ke liye what is, because nowadays with especially any kind of immunocompromise like steroid or HIV, aspergillus tends to be invasive. So which azole do I give? I give a very, very potent azole, that is voriconazole is given. So a quick recap of everything to do about aspergillus. 3 type का aspergillus होता है. We know that fumigatus, flavus and niger. No points for guessing that niger will give a black color, and no one's asking you that also. They will either ask you fumigatus and flavus. Fumigatus will remind you of fumes. तो fumes and smoke साथ में जाएगा. What color? Smoky green color. Flavus will remind you of flowers, तो flowers के साथ वो flowers के साथ pretty colors, yellow green, and they said yellow green color. So this is aspergillus flavus basically that they have put up over here. How do all these aspergillus look like? A for which branching? Acute angle 45 degree का branching होगा, and then SPE for what? They are septate hyphae. So you will zoom in, you will notice all of them have lines inside, and those lines are known as septate. तो अगर ये photo दिया, it's aspergillus. If they write yellow green, then also it is aspergillus. If they write There are septate hyphae with acute angle branching, that is also Aspergillus. Aspergillus ke liye tell me that one test which I taught you in the very first slide, and that was एक था ना Aspergillus galactomannan test. So remember these two questions for INI-CET. Aspergillus का test, galactomannan test, Aspergillus treatment, voriconazole. If you've done Aspergillus, please compare it with what? Compare it with mucor. We can never go forward without doing that. If Aspergillus is acute angle branching, mucor is ulta, 90 degree or obtuse, like I can see over here, 90 degree. If Aspergillus is septate, mucor is going to be aseptate. Mucor by the news articles were called as black fungus. It is not black fungus. Black fungus होता तो नाइगर को बोलते, but why did the news channels and common public end up calling mucor as the black fungus? Because the lesion that mucor was causing was very blackish, so they started calling it black fungus. Otherwise mucor has nothing to do. Yes, necrosis की वजह से black लग रहा था. It has nothing to do with, it doesn't make any black color pigment or anything like that. It's a wrong name. It should not be called black fungus. If I move forward, I will never skip this when I'm dealing with fungus. Always the last question has to be this. It's a silver stain that they have done in a sputum sample. Image dekha, you don't read. This is like that one image which you get and then you're like, I'm sorted. This is the crushed ping pong ball appearance. You are dealing with pneumocystis carinii pneumonia. Is it seen with immunocompromised individuals, HIV individuals? Yes, when the CD4 count is less than 200. Very good. So is it seen? ये तो ठीक लग रहा है. Does it occur with CD4 count less than 400? I mean less than 200 should be the ideal thing written. Is it diagnosed on X-ray imaging? Yes, but is that, I mean it can be tentatively diagnosed, but do I want to select it? मुझे पूछा गया है select the true statement and I can only select one. Ampicillin drug of choice, no. The single best statement that I can select over here is this, that it is seen in HIV, the safest statement to correct, because other ones are not technically, it is not 100% diagnosed. I mean X-ray can show me TB also, X-ray can show so many pneumonias, it will not be definitive. So the single best statement that I have is this. Quickly revise PCP 4 times. You know how the treatment and everything comes in PCP. PCP means pneumocystis carinii pneumonia. PCP means which cells will be seen, lot of plasma cells, so I called it plasma cell pneumonia. Consa appearance, crushed ping pong ball appearance. You can see those ping pong balls and then you can see how they are also crushed in between. And what is the drug of choice? It is going to be cotrimoxazole, but in severe cases what do I give? We give pentamidine. Okay, so this I think is settled. Yes. Shall we move forward, because now is where I think we have completed almost over 1 hour 10 minutes of studies. Okay, 4 minutes was chit chat starting ka. So yes, we have also finished two very important. We are running 10 minutes late today, by the way. We finished 30 slides, but nonetheless, general and mycology ka jitna we had to touch upon. So you'll understand that the slide number is not making sense today, because in that one slide we have condensed so much of information. So it's like one hour of lecture that we have put into one slide. So thoda time lagega. But yes, all said and done, we have done what we had thought of. What I'm starting with next is a little different from what I've taught till date. Usually I say pehle pura bacteria padhenge, and that is just becoming so lengthy and so difficult to revise. So I have actually taken up the two diseases that come maximally in the exam. So your next 1 hour will finish all of that. Number one, food poisoning, and this is something I've taken from first aid. So don't get into that FOMO ke hame first aid padna and all of that. Nahin, I have done that job for you. You don't have to study. You just have to give me answers. You know everything, but you know everything in different chapters. I want all of you to bring all that diarrhea, vomiting into one chapter now. Whether it is a bacteria or a virus or a parasite, jitna bhi diarrhea, vomiting ka food poisoning hai, all of that is going to come under one page. So we will finish this entire with questions, with images, with whatever points I want to tell you. Similarly, then I will take you to one such table of meningitis. So दो बहुत important integrations we are going to finish off, and let's aim that we do all of that in 1 hour, because that will easily take up 30 more slides of our life. So let me start. As soon as I say the two most famous food poisoning, you'll see I've written those buzzwords for you. And exactly, अगर आप first aid अभी time नहीं है, कभी बाद में देखोगे, this is exactly how they've made 2 pages over there, but we have got 2 pages into 1 page. That is what we've done. तो Chinese food के साथ तो immediately when you see these two things, what should you be asking me? Incubation period बताओ मैम. After eating Chinese food or any dairy product, I will say the incubation period is less than 6 hours. I mean, this mnemonic today becomes the most relevant mnemonic. We are somehow so appropriately timed with today's news that Bacillus cereus, what is the culture media for Bacillus cereus, was our very, very famous meme mnemonic, that is Mypa Pemba. Remember, we learned it from that serious politician and who said rumba rumba humba humba. So then the media is going to be Mypa Pemba. But then how did I learn it serious ke sath? Chinese fried rice, that is the history. Incubation period will always be less than 6 hours. If they say some dairy product, तो क्या सोचोगे? Same incubation period less than 6 hours. Dairy product, I mean something to do with milk or maybe meat. Milk is mayonnaise sandwiches or creamy pineapple pastry. Some milk product is there. I will be thinking of Staph aureus. तो यहाँ पर तो I identified. Do you think it will be such a question कि अच्छा milk product था बताओ? No, they will say how will you do the testing? What are all the tests of Staph aureus? That is why I said this table, these tables will take 30 minutes. Whatever bacteria you are reading, हम उसका diagnosis साथ साथ उसकी photos, we will keep finishing it. And this is actually something, by the way, that I have included in the integrated essentials this time. For you guys, you don't have that much of time before INI-CET to go through all of integrated videos on the app. Hence, I have got these tables over here for you. Coming all the way back, Staphylococcus ka bunch of grapes appearance we know. Why I call it Staphylococcus aureus? Because aureus tells me कि अच्छा AU for gold, so it has a golden color pigment. What is this bubbly test for Staphylococcus aureus? Amazing catalase. But because you were testing main selective media, बता दो कौन सा है? The selective media is mannitol salt agar. Why is it a selective media? Because you have added salt. But what is it telling you? Selective है, but mannitol salt agar tells me कि mannitol fermentation हो रहा है. When mannitol is fermented, what color am I getting? I am getting a yellow color. When was it not fermented? तो originally क्या color था? Originally the indicator is phenol red. Remember, we had studied very good. We remember Staph aureus के लिए samosa, mannitol salt agar, and samosa, let's try and draw. Samosa is best served with red chutney. So you will always remember that the indicator is going to be phenol red, and when mannitol is fermented, you will get a yellow color. So this is all the questions that you can get. A question bacha which you will answer for me. Here a 25-year-old male presents with complaints of fever and vomiting, and there are pastries from a restaurant 5 hours ago. Incubation period less than 6 hours. Pastries हमें मानना पड़ेगा, he had some of those pineapple creamy or black forest creamy pastries. Assume a lot of things. So then they said food poisoning hai. Which enterotoxin cannot be responsible for this type of food poisoning? Because see, Staph aureus to hai, enterotoxin will always cause food poisoning. All enterotoxins cause food poisoning only. But enterotoxin F causes something very fatal. It doesn't cause food poisoning. Enterotoxin F food poisoning nahi karata. It causes something very fatal called toxic shock syndrome, and you know the history will be of a female. She will have a history of retained tampons, and now she's showing vitals will get disrupted. She's going into a feature of shock, so toxic shock syndrome. Can I? Very good. All of you are doing self-revision also. Is this called as toxic shock syndrome? Toxin. Yes, it is. So all enterotoxins cause for food poisoning, but F wala hi food poisoning nahi karata. It causes something very fatal called toxic shock syndrome. And I think we are done. Let's move on to the next. Ek diarrhea. E. coli ka diarrhea. What was the question that came in the previous INI-CET? That is also pasted over here. Then we'll revise all the E. coli ka diarrhea. So identify the organism. This was the famous attachment effacement lesion, and that is what enteropathogenic E. coli. So I know E. coli is the most common cause of urinary tract infection. वो तो सब जानते हैं. E. coli का diarrhea is what INI people like to ask you more. So these are all the E. colis and all the diarrhea wale E. colis, which again is a 30-second recap for all of you. This was what attachment effacement lesion. If you ever wondered कि क्या है ये attachment effacement lesion, so these are the villi of the intestine. I mean diarrhea, तो intestine की बात कर रहे हैं, villi. And this is the E. coli that has come and attached on it. So that is why I called it attachment effacement lesion. Attachment will always be more with kids, with bachas. So I will be thinking of something to do with peds wala diarrhea. Infantile diarrhea. So which is the E. coli that causes pediatric infantile diarrhea? That is enteropathogenic E. coli. So pathogenic for peds and peds के साथ attachment. Done. Enterotoxigenic E. coli, T for T. History of traveling. Traveler's diarrhea. Easy. Enteroinvasive. Invade kara to bleeding hoga. What is bloody diarrhea known as? It is known as dysentery. Then it is also very invasive, as in you don't test it with all these tests in the lab. You test it with a very invasive animal test. कौन सा animal test? So we had learnt it as Serini test, so that we remember that, oh, this is a very invasive kind of a test. It's an animal test. Yes, so NEET test, animal test is done for which E. coli? It is done for invasive E. coli. Very good. This is a next, I mean, I couldn't get so many MCQs, otherwise the PDF would have become some 500 pages. So everywhere that I'm marking PYQ is an INI PYQ for this LRR. Enterohemorrhagic E. coli causes what? Hemolytic uremic syndrome. History क्या आएगी? Hemolytic and uremic. I mean hemolytic होगा और uremic होगा. That is the history, as easy as it can get. Hemolytic is what? Microangiopathic hemolytic anemia. Hemolytic anemia. Uremia will mean कि अच्छा some renal failure, kidney का story तो ये तो पता है. Hemolytic and uremic. Tell me the third component. A decrease in platelet count. Yes, thrombocytopenia. So many of you say rat, mat कुछ ऐसे याद करते हो, but I think I mean, it's quite ironical that I am saying mnemonic mat karo. But mat karo because वो नाम से पता लग रहा है ना. Our favorite mnemonics are the ones that we can do from the name itself. Nothing better than that. So hemolytic and uremic is self-explanatory. The only thing that I have to learn is a decrease in the platelet count. Now there are two questions that came actually. ये तो clinical history होगा. You will guess EHEC. Which strain of EHEC? Many of you told me. Very good. It is O157H7. Question number 1. Question number 2. Is it grown on MacConkey? But special type of MacConkey. SMAC for sorbitol MacConkey. Is it sorbitol fermenter? Answer is no. It is SMAC negative. Sorbitol fermentation is negative. ये हैं दो question for enterohemorrhagic E. coli. Then comes another PYQ. Enteroaggregative E. coli. They will aggregate like bricks. So they are called as stacked brick appearance on Hep2 cell lines. And इतना ज़्यादा brick की तरह it will stack, it will aggregate. So the diarrhea will go on for more than how many days? Persistent diarrhea, medicine definition, more than 14 days. सारे E. coli के diarrheas are done. But then I also remember that E. coli was, ma'am, ये तो sorbitol fermentation तो बाद में आया. Ideally, this E. coli that you're talking about is what fermenter? Which sugar does it ferment? Sucrose, glucose, lactose. So now what I'm going to show you will obviously be extensive, but INI के बहुत सारे questions cover करेगा. As soon as you say E. coli is going to be a lactose fermenter. Even Klebsiella is a lactose fermenter. The way we write lactose, we had studied that E. coli and Klebsiella are lactose fermenters, and then the entire world can be non-lactose fermenters. How did you test for lactose fermentation? By these two agar. Only thing that you have to tell me, 3 questions. दोनों का नाम बता दो. When lactose is fermented, what color do you get? And originally indicator, what was the original color? Just 3 questions and you're sorted. So when I say the first one, that is going to be the MacConkey agar. The second one is going to be Cled agar. Which one of them is considered better? So I'll write a chota Cled is considered to be better. This has been 2017-18 ka AIMS question used to be this. Now they've kind of forgotten it ever since INI came up. But still we should know old PYQs also. Cled is better for knowing lactose fermentation than MacConkey. Question 1 is done. Question 2, what color do you get? Then for MacConkey, I can see a pink color, and for Cled, I can see a yellow color. So this is simple. For MacConkey, I can see lactose fermentation gives a pink color, and Cled is going to give a yellow color. But what is the original indicator? For MacConkey, do you remember, although aajkal they don't ask you the full form, but do you remember MacConkey is learnt as plant, pretty pink plant. What is the indicator for MacConkey? It is neutral red. And what is the indicator for Cled? वो तो दिख ही रहा है, something to do with blue, so that is going to be bromothymol blue. So that brings me to अभी पढ़ा था Staphylococcus aureus का mannitol salt agar. Mannitol salt agar का indicator क्या था, मैम? Samosa with lal chutney, so you will think of phenol red. In MacConkey, it's the pretty pink plant, so you will think of neutral red. And in Cled, what will you think of? You will think of bromothymol blue. Whenever anything is fermented, color is always what? Yellow. Because जब समोसा में mannitol fermentation हुआ था, what color did you get? Yellow. When Cled में lactose is fermented, what color you are getting? Yellow. आगे जाके I will talk about sucrose fermentation. Always fermentation gives a yellow color, but MacConkey is a pretty pink plant. So in MacConkey, when lactose is fermented, you will get a pink color. सिर्फ MacConkey में pink, बाकी सब जगह fermentation equals to yellow color. Coming back, which is motile, which is non-motile, we all know this. Anywhere the word illa will come, तो वो बन जाएगा non-motile. तो illa means no ना, so Klebsiella, no motility. Shigella, illa, no motility. Salmonella can be motile, but then there are two salmonellas like Salmonella gallinarum, Salmonella pullorum. तो कुछ ऐसे salmonella है because it has illa ना, so these rare वाले salmonellas are non-motile. Anywhere the illa word will come, तो एक no motility वाला feature is going to come. That is how we had learnt it. अब बचा ये IMVIC. You don't have to learn the IMVIC of all. You just have to learn IMVIC are 4 tests. Will they ask you the full form? No, they will not. I have written the full form only for getting some vague idea what is happening. They will write 4 test tubes. IMVIC. Every time they give you, you have to label it yourself. लिखा नहीं होगा. Just imagine कि हाँ 4 test tubes हैं, तो it has to be IMVIC. When do I say indole is positive, methyl red is positive, VP is positive? जहाँ जहाँ red color आएगा वहाँ वहाँ positive, and citrate is blue color positive. बस red, 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 blue. Sing with me. IMVIC is what? Red, 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 blue. So you tell me, is it red over here? हाँ, ऊपर red है, यहाँ पर red है. VP में I don't see any red. And in the last test tube, it should be blue, which is not blue. It is looking greenish. So what is it? Plus, plus, minus, minus. That is E. coli. Next, over here, do you see red? I don't. Do you see red? I don't. Do you see red? I do. And do you see blue? I do. Minus, minus, plus, plus is Klebsiella. Can you repeat with me in a single 3 sentences में ये पूरा table खत्म करो. When do you say IMVIC testing? Do you know how to read it? You will say it should be red, 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 blue. That is when it's positive. Red, 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 blue. Line number 1. Line number 2, what is E. coli? Plus, plus, minus, minus. What is Klebsiella? Ulta. Minus, minus, plus, plus. Others, you don't have to study. Let's take a hold on that. But coming back, ये सब हमने क्यों पढ़ा? Because we were studying all E. colis which are done. Can you move on to the next diarrheas? Not even asking you this. Rice water stool वाला कौन सा diarrhea होता है? Vibrio cholera होता है. And if there is some kind of a seafood, like maybe to do with prawns or some kind of a shellfish, तो कौन सा Vibrio सोचोगे? You will think of Vibrio parahemolyticus. These 2 Vibrios are there. I think the motility, you know, Vibrio cholera के साथ तो right now I told you that very fast shooting star motility, and Vibrio parahemolyticus was a part of that PVC's mnemonic. So this was showing you वो गोल गोल वाला swarming motility. Motilities are sorted. You know that the recent most question was on Vibrio parahemolyticus, so I'll start from this. Parahemolyticus, prawn, seafood, shellfish, something like that. And which phenomena does it show you? Kanagawa phenomena on Vagatsuma agar. Both very fancy names. Firstly, what is Vagatsuma agar? It is nothing but a simple blood agar, right? And on top of that blood agar, I have added a little bit of salt. So thoda Chinese, Japanese type of naam banana hai, right? That is how we are trying to get into it, because we are going more in terms of seafood. So we make an agar which is little salty blood agar, in simple words. That is Vagatsuma agar. And on Vagatsuma agar, what kind of phenomena does it show you? Kanagawa phenomena. Why did you add salt? Because all these Vibrios, they are what kind of organisms? They are salt loving organisms. Halophilic Vibrio है, तभी I am adding salt. This was the recent question. अब वापस चलते हैं towards the OG, the one that is not salt loving, the rice water stools वाला, Vibrio cholera. These are all the, okay, I shouldn't have shown this to you. These are all the questions that you're going to get. So identify one photo, because they have been like the all-time favorite MCQs of INI NEET. What is the shape of it? It is a comma shape organism. And which motility does it show you? Shooting star. Here comes the next, sucrose fermentation. जब भी कोई fermentation होगा, कौन सा color? Yellow color. All fermentations yellow color, except for the McConkey agar was the pretty pink plant. What is this test? No points for guessing. It is the string test. So I think Vibrio की 3 photos याद रहेगी, but what I'm forgetting actually is the next question. Here you will have a very classical buzzword. 30-year-old traveler returning from coastal region in India presents with rice water stools and severe dehydration. Rice water hai, so much of water loss, has to be dehydration. That is why the best therapy is always going to be giving rehydration. I mean, hydration maintain kar lo, vitals maintain kar lo. For Vibrio cholera, supportive therapy is more important than giving antibacterial drugs. Stool microscopy, darting motility, shooting star, darting, fast wala. TCBS, obviously TCBS में sucrose fermentation, always yellow color. What describes the molecular mechanism responsible for this kind of a diarrhea? Basically, they were asking me, most of you are saying B, is it cyclic GMP बढ़ता है? Okay, is it cyclic GMP? Read carefully. You don't have to just see it is I know the starting of it is not making any sense. Maybe you thought, oh, ADP ribosylation of EF2 ये तो diphtheria and all में होता था, which I will come to while. They didn't say ADP ribosylation of EF2. They said of the G protein leading to persistent activation of adenylate cyclase, which is nothing but cyclic AMP, and that is the mechanism of action. So I'll do a quick recap. I always say if you want to learn choleritis, Codzot. That is how simple it is. Cot refers to what? Cot refers to cholera toxin. Cholera toxin has two parts. This I have not written. You will write with me. Cholera toxin has two parts, A and B. B क्या करेगा? B आके bind करेगा. Can you tell me it binds to what? It binds to GM1 ganglioside. And A क्या करेगा? A action करेगा. What action? It increases cyclic AMP. Can you revise with me all the bacteria that increase cyclic AMP and GMP? जल्दी से कर ले. GMP, AMP. Cyclic AMP कैसे याद किया था? मैम, you had learnt it with cyclic AMP. That is what we were supposed to write. So, cyclic AMP, number one, is increased in cholera, which I have marked over here. Cyclic AMP is increased in that bioterrorism wala anthrax, which is coming shortly. Then M ka obviously little bit had to be changed. So that was E. coli. I realized E. coli can do increase in cyclic AMP and GMP. So then what was the way of learning it? A labile person will always be in the air, hawabazi, and a stable person will always be very grounded. That is what you should aim to be. So a labile in the air, labile toxin will increase cyclic AMP. Stable on the ground, so stable toxin of E. coli will increase cyclic GMP. We know that. And finally, what is with P. pertussis, the whooping cough? Bordetella pertussis, that is also a question coming up. So I think this is settled. Cot का तो मुझे पूरा समझ आ गया. What is this zot? Because that has also been a question of the previous years. What is this? I hope you know the full form. ये AIMS में पूछा था. Zona occludens toxin. Zona occludens, cell-cell junction. So when this bacteria wants to grow, Vibrio wants to go from one cell to another, zona occludens toxin. बस exam में cot zot से story हो जाता है. Cholera toxin, zona occludens toxin. We are settled. Are we done with the Vibrio story? Can we move on to the next set? Exactly copy pasted from first aid. This is the table which is going to make you solve everything for food poisoning. अब इसके बाद कोई vomiting diarrhea आपको नहीं तंग करेगा. That is a big chunk of the exam, you will realize. So many questions come on vomiting, diarrhea, food poisoning. When they have a kind of a food poisoning which is very similar to an appendicitis. In fact, उसका नाम भी है pseudo appendicitis. You just need to know the name of the bacteria and you're good to go. Pseudo appendicitis because of the right iliac fossa pain. Which Yersinia? Yersinia pestis? Of course not. Yersinia pestis तो plague कराता है मैम. This has to be the food poisoning वाला Yersinia ना. So that is going to be Yersinia enterocolitica, and I'll write for your later on reference. This is also referred to as pseudo appendicitis. Yes, because of the pain. Nothing more in this. And this is everyone's favorite. There is a very long-term history of antibiotics that have been given. Maybe antibiotics were given for pneumonia or typhoid or something else. And now the patient has landed up with watery diarrhea. So what are you thinking of? Clostridium difficile, Consi disease, PMEC, pseudomembranous enterocolitis. Can we see the pseudomembrane? Over here I can on the mucosa. And what is this dirty material? It is actually all the dead material, like a lava. It has burst because itna zyada antibiotics chala for such a long period of time. The entire gut flora got deranged. Patient got infected with difficile. All the intestinal contents got damaged. They burst like a lava. So what did you call it? Volcano-like eruption. Can you tell me two questions? Tell me the culture media over here for Clostridium difficile, that is CCFA. CCY, दो तीन तो शॉर्ट फॉर्म है. एक वो माइपा पेम्बा था. माइपा पेम्बा, यू आर नेवर फॉरगेटिंग, वाज फॉर बैसिलस सीरियस, सीरियस पॉलिटिशियन. वन इज CCFA, CCY, which is going to be for Clostridium difficile. And the treatment, I believe I have asked you earlier also, and you know this, it is going to be vancomycin, and there is a new drug which you all have to know, fidaxomicin. This again, no longer new, we've been discussing it since 2 years. तो अब हो गया time. Fidaxomicin, but usually till now it is being used more for the milder cases that fidaxomicin is being used for. This is also done. आगे चले, I can see something more. Step ladder fever. I'm not going to ask you that step ladder pathology wala was step ladder pattern in apoptosis. This is step ladder fever. The diarrhea is going to be like small peas. So pea soup diarrhea. And Faggot sign. Faggot sign is what? The patient has fever, and fever ke sath usually the pulse rate should go up. There should be tachycardia, but this is Faggot sign where there is going to be bradycardia. Excellent. Faggot sign can be seen in a lot of conditions. I will tell you gradually. Leptospira में भी दिखता है, Brucella में भी दिखता है, but यहाँ पे correlate करो ना, faggot sign with step ladder fever and pea soup diarrhea has to be salmonella, basically typhoid. And अगर salmonella typhoid का भाई which causes bloody diarrhea, sisters remember salmonella shigella, so that bloody diarrhea wala sister is going to be shigella. Should we do a classification of how to deal with the patient of this? Someone comes to you with untreated typhoid in the 3rd week showing a positive test. So 3rd week, I know week 1, 2, 3, 4, what are you going to do? We will have to write the Basu mnemonic, which I will write for you. I mean, you know it. Can we skip writing it? Week 1 में क्या करते हो? Blood culture. Week 2 में antibody Vidal test. Week 3 में stool culture. Week 4 में urine culture. So where has the patient come? Patient has come in the 3rd week. So what do I want to do in the 3rd week? I want to do a stool culture. Okay, now tell me, blood culture and bone marrow aspirate, could that have been the same thing? Yes, because blood culture में I'm taking a blood sample, doing a culture on it. Bone marrow aspirate करके भी तो I'm taking a blood sample only and doing a culture in it. Obviously this is more invasive and we don't do it, but practically that means the same thing. ले तो दोनों में blood ही रहे हो. Just to give you an orientation, but yes, if antibody testing would have been done, it would have been done in week 2 and that is known as the Vidal test. But I want to ask you, blood culture, stool culture and urine culture, done on which culture media? इतने सारे culture, which culture media? These are the culture media that you need to know. As soon as I use the word enrichment, they mean broth. Broth का मतलब होता है कुछ liquid. And now this is the story of the Salmonella Shigella sisters. Whether they say Salmonella or they say Shigella, दोनों का culture media is the same. दोनों का enrichment media is a broth, selenite F broth, tetrathionate broth. दोनों का selective media should have deoxycholate. Deoxycholate makes it selected. So I have learned DCA and XLD, where D is what I have to emphasize on. Now if they will both grow on this, Salmonella and Shigella will both grow on these broths, on these deoxycholate. How do I differentiate? Excellent, the Wilson and Blair media. So Wilson and Blair media is giving black colonies, but which bacteria grows and which doesn't? Salmonella grow karega, Shigella grow karega. So Wilson was that boy who finally made our sisters fight. That is what we had learnt it. So who has he gone with? Who has he won over? He has won the trophy of typhi. He has won the trophy of typhi. Very, very good. So that is going to be Salmonella typhi. That is giving the black color colonies. Shigella will not grow on it. This is the PYQ. This is a PYQ of FMG exam, but we know na FMG INI का थोड़ा आजकल कुछ अलग ही collab बना हुआ है. They try to copy each other's topics. So this is also settled. Let's see if I can go on to the next. What have I done with Salmonella, Shigella हो गया. Now I say food poisoning, especially of a group of friends who have gone for a camping and over there they did a barbecue party. They had some undercooked poultry. वो वाला history आया. Camping के साथ undercooked poultry के साथ Campylobacter is what is coming to our mind. We call it Campylobacter jejunina. तो वो जून के महीने में grow करता है. Tends to grow at a very high temperature of 42 degrees. We know that. But I'm not scared of the food poisoning. That is okay. वो तो ठीक हो जाएगा. I am scared of a complication that it can cause. That is Guillain-Barré syndrome. It causes GBS. That is what we are concerned with. So remember this. आजकल, I'm not saying always, but GBS के साथ अगर bacterial infection दे रहे हैं, they are giving Campylobacter, and virus में they are liking to ask you about Zika virus जो वो Aedes mosquito से होता है. So this is just what examiner is trending with nowadays. But anyway, coming back, Campylobacter के लिए undercooked poultry, camping की history होगी, 42 degree, but which culture media? Campy, तो culture media का नाम Campybap culture media, and that they will not ask you because it is pretty obvious over here. They will ask you the other culture media. So this is what you have to mug up with me. The Budslur media and the Skyros media. Campybap aa gaya to you're just a very lucky person. But they will ask you Budslur and Skyro media for Campylobacter. Okay, not done. So at least I've given you an ending. Okay, where is it going to end? But very soon. We are now coming a little bit into pathology. What if that food poisoning is a diarrhea where there is malabsorption? Malabsorption means all the proteins, vitamins, fat, everything is going out into the diarrhea. तो fatty diarrhea हो गया. Very good. Fatty diarrhea में या तो ये photo आएगा या ये photo आएगा. Now you will tell me, what is this picture? First start from here. What is this picture of fatty diarrhea? They won't write fatty diarrhea. They will say very sticky, frothy diarrhea. It is, and they will give you a very yuck kind of a history. They will say it is sticking to the pan. Patient is saying flush nahi ho raha. So that sticky diarrhea is the fatty diarrhea. And we will think of, okay, this to GRD आई है तो मुझे पता है. I'm not asking you. I asked you this. Correct. Pass positive macrophages in the lamina propria. What are you thinking of? Trophirema vipli. They will show you these foam cells. Foam cells will be pass positive macrophages. Every word I told you now. Trophirema vipli क्या है? Bacteria है ना? It's a gram positive bacteria. If you want, I'll write it over here. It's a gram positive bacteria. तो कैसे stain करा? Pass से stain करा. Which cells eat them up? Macrophages. Which layer of the intestine? Lamina propria. Every word is important. If not Trophirema vipli for steatorrhea, then we know this Dadaji wala story. Dadaji is always roaming around in the duodenum. Dadaji का हो giardial amblia. Which motility of giardial amblia? गिरता हुआ leaf, falling leaf motility. Okay, Dadaji is in the duodenum. Dadaji is always roaming around because old people love to roam around. So where will he be found? He will be found roaming around in the lumen. If he is present in the stool sample, very good. Otherwise, how will you catch Dadaji? You will catch him with a dhaga, with a string. So that is known as the string test or the entero test. And what is the treatment? The treatment is metronidazole or tenidazole. In fact, do you remember how many, you're saying falling leaf motility, girta hua leaf. So it's the trophozoite and I can see the trophozoite over here. Can you recall how many nuclei and how many flagella did it have? Because trophozoite is looking like Dadaji. Any human being will have 2 eyes. So it's 2 nuclei, which is obvious. But how many flagella? Because we called him Chinese Dadaji. You had made him. You made him with those, how many hair? 4 flagella. Are you sure? No, देखो, someone said 4 nuclei. You are calling him Dadaji. You are calling him a human being. And then eyes, you are making 4 eyes. Doesn't make any sense. So how many eyes? 2 eyes. So 2 nuclei. How many flagella? Not 4. Very good. 4 pairs of flagella. So total कितना बना? 8. You will get such very, very dumb questions and you will make ultra dumb mistakes in them. 4 flagella or 8 flagella? Answer should be 4 pairs, na? So answer should be 8 flagella. Okay, let me just quickly scan through a PYQ that came related to a 25-year-old male. Fever hai, loose motions, nausea. Told you food poisoning hoga history mein. Foul smelling, fatty stools. Now your mind starts going कि अच्छा या तो pass positive macrophages जैसा कुछ लिखा है, Trophirema vipli है, not there in the options. Do I have some kind of wet mount showing motile protozoa? अब motile with steatorrhea, I think of giardial amblia. And then again, why motile? Because of 4 pairs of flagella. एक दादाजी का girlfriend also I can see over here, same family. Trichomonas. Trichomonas of course was causing what? That strawberry cervix, वो तो पढ़ लिया. Trichomonas के पास कितने flagella? Trichomonas के पास 5 flagella. 4 plus 1. Remember that 4 hair आगे, 1 ponytail पीछे. Never get confused. Dadaji has 4 pairs of flagella, total 8. Trichomonas has 4 plus 1, total 5 flagella. These flagella numbers, mugging up numbers, we have to revise. आगे चलते हैं. Almost settled. This you will never ever get wrong. HIV positive patient with diarrhea. Is it bringing you to some table? I hope yes. You are almost nearing the most dreaded, which has, you have not even realized, but you have not read chapter wise. You have read case wise. You have read patient wise. And so much of bacteriology that you have covered, which is a little more interesting. But why did you, ma'am, not cover this way in the rapid revision videos? Because then you would have not had any clue about कौन सा gram positive, कौन सा gram negative और चल क्या रहा है. This is the best LRR revision you can do. This can never be the first go-to read that you're doing this way. So now tell me, HIV positive patient with diarrhea, very good. Coccidian parasites, and you know the table that I'm coming to. You solve this table, then you will solve one question. That's how it will work. Let me start. So as I say, you write it in the alphabetical order. You remember this? HIV positive patient with diarrhea, Coccidian parasite. Will I be doing a general ZN stain or will I be doing the cold Kinyon stain, which we have already discussed? So why did we write it in an alphabetical order? Because Cryptosporidium is 4 to 6 microns. फिर double करो तो Cyclospora is 8 to 12 microns. And then double and triple, so Isospora is 24 to 36 microns, which is great, amazing. I also really like how everyone is going so headstrong and kitna अच्छे से you are still keeping up with the pace, because in micro I usually see people losing out on interest by the time they come to this. Basically it's very mentally exhausting, but hats off, fingers crossed. I hope you continue this way till the end of it. By the way, just to give you an orientation, we are on the 44th slide. Okay, I'm not keeping a track of time, I'm just telling you where we've reached. Anyway, so coming back, we are done with the size, then we come to the shape. तो जहाँ जहाँ जो नाम है, Cryptosporidium is round in shape, Cyclospora is round in shape, सिर्फ Isospora जो है वो that is going to be long. So that shows me ना, Cryptosporidium round in shape, Cyclospora round in shape, Isospora is going to be long. Now coming to the autofluorescence, the Spora brothers are autofluorescence. Okay, are all of them acid fast? Of course, cold, Zn stain, all of them are acid fast. But cyclical कौन सा है? कभी yes, कभी no. Cyclospora is sometimes acid fast, sometimes not acid fast. Cycle पे क्या खरीदने गए? Very very random thing, but cycle पे raspberry खरीदने गए. So whenever they will want to give me a history, and I think this could be the question this time, raspberry consumption leading to cyclospora. That is what you will think of. raspberry से और कुछ नहीं हो रहा, ठीक है, यही हो रहा है, साइक्लोस्पोरा वाला इन्फेक्शन हो रहा है. साइकिल पे हम raspberry लेने गए, sometimes acid fast, sometimes not. Spora brothers are autofluorescent. Spora brothers are treated with cotrimoxazole. And how is cryptocurrency with Nitambani? Cryptosporidium is treated with nitazoxanide. So this is also done. If I ask you a question that ये life cycle किसका है out of all the three, why am I so confident that this is the life cycle of Cryptosporidium? Do I have to know the life cycle? No. The only thing that you have to know, HIV positive patient होगा, उसे हो रहा है diarrhea. They say, what is this a life cycle of? I am dead sure it is Cryptosporidium. Crypto means hidden. This will go and hide. Can you see it has made a small little tunnel? It is hiding inside the tunnel. This came in the 2019 AIMS exam where these microorganisms are chota dots are hiding. And that place, that tunnel is known as a parasitiforous vacuole. Previous year question in theory it has been asked. कि कौन ऐसा छोटा सा टनल बना के छुप रहा है? Parasitiforous vacuole is seen with what? Cryptosporidium. But I don't think they will ask you this. They will give you a life cycle instead. And you will have to spot कि अच्छा HIV positive patient with diarrhea, वही coccidian वाला story, and it is hiding in that tunnel. So this is Cryptosporidium. After giving this, they will say what is the drug of choice, and now your answer will be nitazoxanide. Try solving this question. Which of the following statement regarding the organism is inaccurate? The patient who received a kidney transplant 3 months ago, kidney transplant means immunocompromised, immunosuppressive therapy चल रहा होगा, and now there is diarrhea. So same, if they don't give HIV positive patient with diarrhea, HIV का only hint was immunity going down. So over here also immunity is going down. Plus I can see a lot of these acid fast, round, all of them are there. It looks like Cryptosporidium. Does Cryptosporidium show auto-infection? Yes, there is a mnemonic called CHEST which we will study in a while. कौन से organisms auto-infection show करते हैं? That is correct. Is it 4 to 6 microns? That is correct. We have so many Cryptosporidium. One is Cryptosporidium hominis होता है, फिर एक Cryptosporidium parvum होता है. Out of them, hominis is said to be the most common if I look at the worldwide situation. अगर मुझे ये सब नहीं भी पता था, even if I guessed this was Cryptosporidium, is it treated with cotrimoxazole? Sometimes you don't have to know everything, na? Sometimes you just need to know what you need to know, and then that will guide you through the exam and make a way for you if you hold on to it. हमें सिर्फ इतना पता था it is treated with nitazoxanide, and I could still get my answer on the basis of that. Hence I say don't be in that aim that I should know all 4 options. वो कभी भी नहीं पता होगा. Even if I teach you for 1 more year ना, you will never know all the 4 options in the exam. You will have to know what you are supposed to know and then fit it in the paper somehow, like we did in this question. Let's move forward. Are we almost towards the end? Yes. The diarrhea is where there will be ulcers. जल्दी से एक word बता दो. Flask shaped ulcer किस में दिखता है? Entamoeba histolytica. Then या तो longitudinal ulcer या transverse ulcer. One is TB, one is typhoid. टाई कैसे? टाइफॉइड, टाई लॉन्ग पहनते हैं नेक में, तो टाइफॉइड longitudinal ulcer, and TB is going to show you transverse ulcer. If they don't give me written, they will give me images. Where do you see this flask shaped ulcer? It is seen in amoeba. Where do you see these longitudinal wala ulcer? That is seen with typhoid. Where do you see these transverse ulcers? They are seen with TB. Theory होगा या ये होगा, that is either ways. So now so many of these I've done, but one zone I have not entered into, which you will enter into now on your own. You don't need a table for it. You know it. I'm just doing a completion. There's an enterotoxin, diarrhea, vomiting in a 6-month-old child who has been experiencing these symptoms for food poisoning है, diarrhea है 3 दिन से, not much. So now you know that diarrhea in an infant, the most common cause that I will be thinking of will be a rotavirus, because abhi tak whatever food poisoning I taught you was either a bacteria or it was a parasite. Now I'm telling you the food poisoning, or basically a diarrhea, most common cause, which is a virus, which they ask you. रोटावायरस, viruses, by the way, rotavirus का family भी पता होना चाहिए, because we know rotavirus but we don't know which family, and many a times in the paper Reoviridae is written, which is the same as rotavirus. Now they ask you, what is it? It's an RNA virus, and usually all RNA viruses, RNA तो single stranded होता है, but ये diarrhea वाला RNA virus was an exception. The diarrhea wala RNA virus is a double-stranded RNA virus. Number one exception. Number two, rotavirus is like a rotating wheel. So what is its shape? It is rotating. It is basically a wheel-shaped virus. Why black and white? कौन सा microscope? Electron microscope. What is the virulence factor or toxin? This is the ratta question. By the way, it is non-structural protein 4. They don't ask you the full form. It is NSP4. You all know कि एक vaccine होता है, but they don't ask you that Rotatec, Rotarix. They ask you the side effect of that vaccine, which is intussusception, which I believe everyone anyway knows from pediatrics. So I'm not going to go more into it. But this NSP4, this is something that they will ask you. Finally, you have finished all the food poisonings that you had to do, and you have reached the 50-second slide also, which is very close to your target. We are going well, but now we are going to do, it took us approximately over 30 minutes to do this, but we are now going to spend another 30 minutes. That is everything to do with brain. या तो meningitis हो रहा होगा, या encephalitis हो रहा होगा, or something happening maybe at the spinal cord level, maybe at the myelin level. That will now finish off all the other bacteria, viruses and parasites that I had to do. So I just picked up 2 diseases today. And then that I realized that in 2 diseases I could actually cover more than half of the syllabus in a faster way in comparison to going chapter by chapter, which was making it very, very lengthy. Total कितना slides हैं? We are 120. So almost we finished half, and हमारा 4-hour target जो है वो easily हो जाएगा. These tables are very condensed, so they will take time. एक बार meningitis, encephalitis is done. After that you will see question, then it will go very fast. So the next 30 minutes will be again dense. After that is going to be वो वाली slides. I told you ना, middle में आएगा एक 1.5 hour. This is that. If you cross this, the last 1 hour you will be chilling and sitting, and you will not have much of a problem. Let's get going. I know it's toxic. It will be toxic. It's micro. You were not expecting it to be very easy and easy breezy. No? You were expecting it to be toxic. So now, sorry for showing you this, but this is everything about CNS infections, from bacteria, virus, parasite, fungus, maybe idhar udhar ka others also that you have. But whenever this meningitis wali story will start, they will always want to tell you this Kernig sign. They will want to tell you the Brudzinski sign. So this I'm just giving you a little bit of medicine ka orientation ke theek hai, Brudzinski sign, Kernig sign, neck rigidity, कुछ तो ऐसा होगा. That will give me a hint towards meningitis. And then I'll start, let me start one by one, what to hide from you. ये सारी चीज़ें हैं जो in a way हो सकता है, and that finishes off most of your syllabus, as you can see over here. Right? So you will thank me later. You might curse me right now, but one day after 2-3 days when you revise this PDF, you will thank me कि इससे revision हमारा almost पूरा हो गया and पता भी नहीं लगा. It's a very condensed version. So let me start with the adults, then I can go to a little bit in children, and that's how we can do it one by one. ज़्यादा कुछ नहीं. Let's start with adults, and you know Streptococcus pneumoniae तो कराता है. कौन पूछेगा? वो नहीं पूछेंगे. Community acquired pneumonia and all is obvious. But Streptococcus pneumoniae causes meningitis, and I'll keep reminding you we are dealing with meningitis because that finishes the syllabus for us. अब pneumonia भी meningitis कराता है, और Neisseria meningitis भी meningitis कराता है, and this one line in the exam will finish it for you. Both of them are lens shaped, so they will say lanceolate. Both of them will have a capsule, but the difference is Streptococcus, all cocci are gram positive. So Streptococcus pneumoniae will be gram positive, as you can see over here, purple color. And Neisseria was an exception. It is gram negative. So they will write gram negative lens shaped organism causing meningitis, Neisseria. Gram positive lens shaped organism causing meningitis is Streptococcus pneumoniae. Let me read everything about Streptococcus pneumoniae. Gram positive पढ़ लिया, lens shape पढ़ लिया, it has a capsule. What is the test you told me? Quelling reaction. सारे capsules का कौन सा test होता है? कोई भी capsule ले लो, except for one which I will come to. All capsules are Quelling reaction. Now coming to what is this colony over here? This is the classical carom coin colony that we have studied. Can you tell me the testing which I should be knowing which will be positive? Did someone write bio positive? Bio positive क्या होता है? By the way, this is for your PDF. I have given you high power photos of everything for your PDF so that you don't get, too confused kitne chote mein kaise pata lagega. So you've got all the things written again with high power photos, but those bio test positive is what? Bile solubility, yes. Inulin fermentation, yes. Optogen sensitivity, yes. So it will, this is what will be written in the paper. Meningitis ka case hoga, gram positive lens shaped organism. Either they will say, how will you do the testing for the capsule? Okay, Quell-Lung reaction. What is the culture characteristic, carom coin colonies? Or what are the biochemical test? Bio positive, bile, inulin, optogen. Kuch bhi likha ho, everything, yes, yes, yes. This was gram positive. What about gram negative cocci? Can you tell me? Neisseria meningitidis में कौन से sugars ferment होते हैं in Neisseria meningitidis? You know it is gram negative, lens shape, वो सब तो हमने कर लिया. It has M also, it has G also, so it is going to ferment both. It will ferment maltose also, it will ferment glucose also. Why am I comparing this? Because there is a Neisseria gonorrhoeae. Obviously उसमें कुछ meningitis नहीं होता, that is to a sexually transmitted disease. But Neisseria gonorrhoeae में only one thing is fermented, and that is going to be ग्लूकोज. अब नाइसीरिया मेनिंजाइटिस हो या गोनोरिया हो, दोनों का ट्रांसपोर्ट मीडिया सेम, दोनों का कल्चर मीडिया सेम. क्विकली रिवाइज. नाइस 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 इज ए माइस. ए माइस मीन्स इट इज गोइंग टू बी द एमीज और द स्ट्यूअर्ट मीडिया दैट वी आर गोइंग टू हैव. तो दोनों का, चाहे नाइसीरिया मेनिंजाइटिस हो या गोनोरिया हो, माइस नाइस, दैट इज हाउ वी लर्न इट. दोनों का कल्चर मीडिया is the modified Thayer-Martin media that we are going to have. So repeating, modified Thayer-Martin media. Again for both, whether STD की सोचो, यहाँ पे कुछ STD का urethral discharge का story है या यहाँ पे CSF का story है, culture media please same रखना, and that is settled. Coming to the next, how can you forget? Ultimately you will realize ये capsule वाली सारी चीज़ें are going to the brain. This has a capsule, this has a capsule, Haemophilus influenza also has a capsule, and that has only one test which they will trouble you for. What is that test that you have? It is satellitism. I've got you a higher power of satellitism over here. What is satellitism? Center में क्या करते हैं? Please let me know. This is for your revision. Center में we are going to put a Staph aureus, and Haemophilus influenza will grow only around Staph aureus. Why is that so? Because Haemophilus influenza needs which two factors? I'll write it in both places. It needs both factor 5 and factor 10. Many of you called it Pfeiffer bacillus, which is amazing. Adha revision I have done, half you will do, and then this will become a full course PDF ultimately. Very good. It is Pfeiffer's bacillus, factor 5, factor 10. This is also meningitis. So meningitis के साथ satellitism, H influenza. Now let's look at children. ये तो अभी तक by the way whatever was there was more in adults. बच्चों में Streptococcus agalacti, gala time in camp. I hope you're never forgetting it is camp test positive. One high power of this camp test also जल्दी से revise कर लेते हैं. इसमें भी what do I put in the center? It is going to be Staph aureus. And then what is perpendicular is gala time in camp. तो basically मैम जब भी आपको कुछ लगाना होता है it is always Staph aureus. Satellitism में क्या लगाया? Staph aureus. Camp test में क्या लगाया? Staph aureus. When in doubt go for the OG, that is Staph aureus, and that will do all tests for us. Now coming to what? Perpendicular, agalacti, gala time in camp. I will never forget this, settled. Can E. coli also? बच्चों में see E. coli एक तो most common cause of UTI, I know. Diarrhea वाला तो पूरा table only I have done, I know. E. coli in children can cause. So I will write, I will make छोटा छोटा babies in front of this. बच्चों में Streptococcus agalacti, बच्चों में E. coli. I am not teaching you because I have studied everything about lactose, Imvic, E. coli तो पढ़ चुके हैं. आगे चलते हैं. Listeria monocytogenes causes meningitis. What will they give me in the exam? They will give me which motility to identify Listeria monocytogenes? That tumbling motility, I know it. And finally TB meningitis तो you know only ना. TB के लिए कौन सा? This most घिसा पिटा thing I'm asking you, but I have to complete. TB के लिए कौन सा stain करेंगे? ZN stain करेंगे मैम. But आजकल what is the test that they are doing for TB? They are doing the CB-NAT testing. तो जल्दी से TB की भी photos, all photos finish off. ZN stain, can I put a tick mark? Because I think we know. This is the gene expert testing. Do we know what exactly is gene expert? Cartridge based nucleic acid amplification test, ये तो नहीं पूछेंगे. They know you are aware that gene expert is CB-NAT. They will ask you the TAT. TAT is turnaround time. In how much time do you get the report? If you give a sample at 9 in the morning, you will get it by 11:30. So basically the turnaround time is 2 hours. 2 घंटे में report मिल जाता है. And the sensitivity is 131 organisms per ml of sputum sample or CSF sample or wherever the TB has occurred. So 131 organism is the sensitivity, and the TAT is 2 hours. But age-old technique is what will always be the LJ media. But LJ media mein TB, two questions. How long does TB take to grow on LJ media? It is going to be 6 to 8 weeks. And what kind of 6 to 8 weeks is a hell lot. That is why I came up with Gene Expert, which takes only 2 hours. Whereas LJ media report was coming after almost 1.5 to 2 months. So that is why LJ media is not something where I can wait for 2 months before I start treatment. And what kind of colonies do I get on TB? Rough, buff, tough colonies. It's more of, yeah, okay, rough, buff, tough colony. How much turnaround time have we completed right now? We have also completed 2 hours, which is amazing. Okay, let's go back. Have we done? And now you realize so many of the meningitis done, and in that duration, we have also done so many bacterias rather than doing chapter wise. Abhi nahi khatam ho. Let's go into the same meningitis encephalitis, but a little different question wise. कॉन्टैक्ट लेंस कॉर्नियल अल्सर्स हो रहे हैं, कंजंक्टिवाइटिस हो रहा है, सडनली मेनिंजाइटिस में ये क्या आ गया? व्हाई आर वी टॉकिंग मोर अबाउट कॉन्टैक्ट लेंसेज एंड कॉर्नियल अल्सर्स एंड कंजंक्टिवाइटिस? देन दे डिड कॉर्नियल स्क्रैपिंग्स एंड दे सॉ डबल वॉल्ड cysts. Yes, that is acanthamoeba, because acanthamoeba and the next one also, acanthamoeba nigraria, they're actually brain-eating amoeba. They go into the brain. Apart from that, acanthamoeba can also be associated with contact lens users. So I will first show you that quick thing. Do you remember nigraria, acanthamoeba and balamutia? These are 3 which love to go to the brain and they eat the brain. In one word, can you tell me how will you be going ahead with this? Right, tell me, nigraria का क्या story था? नाला नहाना, नाक neural. What is नाला नहाना? So someone taking dirty water bath, swimming in a dirty water, swimming in a pond. Examiner doesn't write this. Examiner just says patient has gone to the village. Now patient has gone to the village, so you assume. So like the patient was from South India, so you had to assume that he's forever swimming and he will have rhinosporidium. Same way, patient has gone to the village, so you assume that he does not have any clean water over there, dirty water. You assume nigraria. Nigraria, the dirty water will go through the nose, naak. From the nose, it will go to the neural, and in the neural, it will cause primary amoebic meningoencephalitis. That is why I am reading it over here. That is nigraria. The other one is going to be acanthamoeba, which always occurs where the history is HIV positive, and that causes granulomatous amoebic encephalitis. I have a simple question. When I say nigraria causing primary amoebic encephalitis, primary to pehli baar, so that is going to be very acute, and they might say patient is dying within 5 days, 7 days, but jaldi everything is happening. Acanthamoeba causes granulomatous. Granuloma to chronic inflammation hota hai, ma'am. This is going to go on for a longer time, so the history is going to be very chronic and very coarse. Okay, now coming to what else can acanthamoeba cause? It can cause contact lens keratitis, which was there in the question over here. How does acanthamoeba look like under the microscope? It has a trophozoite and it has a cyst. Acantho word का क्या मतलब होता है? Spikes. That is why I can see spikes in the trophozoite. And how does the cyst look like? I can see it is double walled, and that double walled is also very zigzag, ऐसे wrinkled, जो यहाँ लिखा था, that is wrinkled. So remember, if I ask you 3-4 days back when we were doing red blood cell chapter, I taught you something called acanthocyte. The RBCs were showing acantho, which always tells me acantho matlab spike. Acanthocytes were seen in A beta lipoproteinemia. Acanthamoeba is also showing me spikes, and it is causing what? Granulomatous amoebic encephalitis. Now I take the same acanthocyte, but instead of showing you spikes, I say now imagine karna padega. You have to imagine that this is looking somewhat like a fish. A fish-shaped trophozoite is seen. The same disease, granulomatous amoebic encephalitis, but now instead of spikes, they say fish-shaped trophozoite. They are dealing with balamutia, and that's the only question that changes it. Please remember, the change of fish ke saath bala is what you are going to mark. Perfect. Now what is the next brain problem that I'm left with? As soon as I say these two things, tinea solium ke saath, do you want me to write anything? Yes, ma'am, neurocysticercosis, and you want me to make that starry sky appearance in radiology. You know, neurocystic ka starry sky appearance hota hai. Have we finished all starry sky appearances? Because in pathology, we studied it in Burkitt's lymphoma. In pathology, we also studied it in PSG, and now we are saying that in radiology, you see it in neurocysticercosis. Ek aur cheez khatam. Now coming to Toxoplasma gondii, how can you forget the cat? And that is exactly, I mean, everything is written over here. But जैसे cat बनाया, this is the question that came in the previous year. They say they will not give you any meningitis, encephalitis, brain, कुछ भी नहीं देंगे. They will just give you a life cycle, and that life cycle will have a cat. Either the question is identify the life cycle which you have. Question number 3-4 questions, pet questions आते हैं. या तो identify Toxoplasma cat. Question, cat say how is it reaching us? So the cat is passing shit. Cat is basically defecating. So cat ka new shit is dangerous for us or old shit is dangerous. So they don't write new shit and old shit. They write fresh feces or old feces. Always remember in life also, don't hang on to shit. Old shit will always be toxic. है ना, तो ओल्ड शिट को नहीं पकड़ के रखना. दैट इज व्हाट हैपेंस व्हेन द कैट हैड पास्ड फ्रेश फीसेस. दैट वाज नॉट डेंजरस टू अस बिकॉज इन दैट फ्रेश फीसेस द oocyst इज देयर. oocyst हमें कुछ नहीं करेगा. लेट इट बिकम ओल्ड शिट एंड ओल्ड शिट ऑलवेज बिकम्स टॉक्सिक बिकॉज दैट इज व्हेन दैट sporulation will occur. It will now become a sporulated oocyst that will come in our food and water and then cause a problem to us. So it is going to be the old shit or the sporulated oocyst. NEET PG का question था. Which form of toxoplasma is infective to us? Option A was oocyst. Option B was sporulated oocyst. Answer is sporulated oocyst. So what is the life lesson you learned from micro LRR today? Never hang on to shit in life. Old shit will always become toxic. Next question. I said it goes to the brain and forget adults. बच्चों का सोचो. Mother to child, torch infection, toxoplasma. बच्चों में which kind of calcification? All calcifications you'll revise. Cerebral calcification at what it causes. पूरा brain parenchyma में calcification. If I would have said periventricular calcification, कौन सा वायरस होता? cytomegalovirus. If I would have said grey matter white matter junction पे calcification हो रहा है, that would have been Zika virus. All calcifications done. Last question, what is the gold standard for Toxoplasma gondii? That is going to be the Sabin-Feldman test. Feldman will remind me of feline. Feline matlab cat. So that is also going hand in hand. All these parasites are done for us. Let's try some other question now. बहुत bacteria हो गए, बहुत parasites हो गए. आगे चलते हैं. Still in the brain. And as you're doing meningitis, encephalitis, you're realizing that your syllabus is also covering touchwood. So getting 35-year-old HIV positive, AIDS patient, under treatment, neck stiffness and fever. I told you ना, या तो Kernick sign, Brudzinski sign, neck rigidity, ऐसा ही कुछ starting होगा. Now there is nausea, confusion, sensitivity to light. The Mayer's mucicarmin staining, I think, shows Cryptococcus, which is mentioned. Okay, what is the primary site of infection? They could have actually given this as a one-liner, but they wasted our time. Question to itna hi hai. Primary site. I know Cryptococcus causes meningitis, and that is why it's like a reflex that I want to mark CNS. But before it reached the brain, my question is how it entered our body. So Cryptococcus actually comes through the lungs. How? And this is that one slide which will finish off. Cryptococcus is what? It's a fungus. I didn't teach you in the mycology chapter because I wanted to teach it over here with meningitis. I am talking about Cryptococcus neoformans. HIV positive की history है. How did it come? It is in the soil around, or the soil basically contains pigeon या bird droppings. वो soil हमने क्या करा? Inhale करा. Inhale करा means it first went to the lungs, and hence lungs is the primary site that is there. From the lungs it has now traveled to the brain, and that is why it is causing meningitis. तो वो तो बाद की बात है. It has caused meningitis. I will take a CSF sample. In that CSF sample, what is the staining that I will do? We know the negative India ink and nigrosin stain. If the patient dies and I have to do a biopsy, Marawa patient, sorry for those words, but Marawa patient में what stain will you use? Marawa patient you will use mucicarmin, and CSF होगा तो you will use the negative India ink nigrosin, two things. What is the culture media? Why is it looking brownish? So bird seed niger agar. Ultimately I realized that bird की ही droppings I was inhaling, and bird seed niger agar is giving me that. Comes the real question. PYQs, what is the confirmatory test? What is the treatment? Recent PYQs. Confirmatory test is, I will give you all options. You will have to see the question and decide कि क्या दिया. If they say ELISA antibodies CSF में measure कर सकते हो, best answer. If this is not there in the options, you will mark lateral flow assay. If lateral flow assay भी नहीं है, you will mark latex agglutination test. This is in the order of best to less best. So you will mark as per that. ELISA antibodies best नहीं है तो lateral flow assay, नहीं है तो latex agglutination test. Finally treatment, recent ये तो last year ही आया था, pharma micro correlation. What will you give as the initial treatment, and then what will you give in the maintenance phase? In the initial treatment we will be giving liposomal amphotericin B and flucytosine. Option A यही था, and that was the answer because that is the initial treatment. And in the maintenance, what is it followed by? It is followed by fluconazole. तो अगर complete treatment पूछा जाता, this is the answer. Initial treatment पूछा था last time, so it is liposomal amphotericin B plus flucytosine. One more meningitis is settled for us. Let me ask you, why only meningitis? And before that, एक और चीज, ये क्या है? Cryptococcus neoformans. Do we know of any other Cryptococcus also? Do we know of Cryptococcus gattii? Gattii tree से आता है. This is the soil again, but this is not the soil with the bird droppings. This is the soil which is present around the eucalyptus tree. तो Cryptococcus gattii tree से याद रखना. That's just one miscellaneous INI thing that you have to know. Now, why only you are talking about meningitis? What is this life cycle? Can it cause? They will give you a history of encephalitis. They will give you a history of encephalitis. If you've been watching carefully, this is some machhar and this has 2 cycles. हम भी है कहीं, but we are like the accidental kind of host. The main life cycle, very good, Japanese encephalitis. So this is what? This is known as the ardid birds. आर्डीड बर्ड्स और क्यूलेक्स के बीच में कौन सा साइकिल? नेचुरल साइकिल. जापानीज एंसेफेलाइटिस का, वेरी गुड. एंड एम्प्लीफिकेशन, हु इज द एम्पलीफायर? दैट्स द पिग. सो इफ इट्स बिटवीन क्यूलेक्स एंड पिग, दैट इज द एम्प्लीफिकेशन साइकिल. Japanese encephalitis, usually the history is a 5 to 15-year-old person, more towards the 15-year-old range, and 5 to 15 days का incubation period. So 15 is what I have learned. 15 days का incubation period, 15 years का patient होगा. Now if I come back to this, I will notice all this I have studied. Vector क्या है? Which मच्छर? Culex. What is the reservoir? The natural reservoir, ardid birds. What is the amplifier? It is going to be pig. पढ़ लिया. Tell me the vaccine. 2 vaccines, पहले कौन सी थी, अब कौन सी है? PSM, क्विक अल्ट्रा क्विक रिकैप. PSM में मैम पहले पढ़ा था एक लाइव अटेन्यूएटेड, LA लाइव अटेन्यूएटेड वैक्सीन है, SA 1414-2. बट नाउ वी गॉट अ न्यू वैक्सीन ना कॉल्ड जेनवैक वैक्सीन, विच इज द Japanese encephalitis vaccine, which is a killed vaccine, not live attenuated. वो SA वाला LA था. Now we have a killed vaccine which uses the Kolar strain. Perfect. This is done. So Japanese encephalitis may have nothing more to do. Now if I show you this kind of history, for example, for Nipah virus का correlation हमेशा bat के साथ आएगा. And I have a question. Whenever, this is a NEET PG 2024 thing. Whenever they say bat, please देखना only bat or they have written fruit bat, because that changes the entire thing. If they write a fruit bat, like you have a bat and you have a fruit tree, usually date palm. So if you have fruit bat, you are dealing with Nipah virus, and Nipah virus of course causes encephalitis. It has a mortality of 60 to 70%. That is the reason it goes to the brain. तभी तो mortality is 60 to 70%. That is fruit bat. But if they only mention bat से animals या हमारे तक आ रहा है, then you are thinking of what? You are thinking of Ebola virus. Ebola virus does not have more of encephalitis या brain वाले features. Ebola virus has more of systemic features like myalgias, maybe little respiratory involvement, fever. Nipah virus है वो brain वाला, which is going to be fruit bat. Ebola virus is just a bat. Which is the most dangerous Ebola virus? Can you finish off? Zehar wala Ebola is the most dangerous. That is Zaire Ebola virus. Do we have a drug that we have prepared, because we are very scared that these Ebola and all will rise up and will kill all of us? So we have already prepared a monoclonal antibody. So we have injection of monoclonal antibody for Ebola virus. कौन सा वाला Ebola virus? Obviously the most deadly one. We made it for Zaire Ebola virus only. Similarly, we have a vaccine. Vaccine also has been made for which Ebola virus? It has been made for the Zaire Ebola virus. If we know something is dangerous, the drug is made against it, the vaccine is made against it. Bat आया तो Ebola virus, fruit bat आया brain में जा रहा है तो that is going to be Nipah virus. So this is also done. आगे पढ़ते हैं. Measles से brain क्यों correlate हो रहा है? मीजल्स तो अच्छा है मैम. मीजल्स तो हम इतना प्यार से पढ़ते हैं ना, 3 C's, कॉप्लिक स्पॉट्स, देन रैश. बट नाउ बिफोर आई, इनफैक्ट लेट मी जस्ट टीच यू. फीवर तो यू नो ना मीजल्स में. एंड व्हाट आर द 3 C's? दिस आई वोंट राइट. कफ, कोराइजा, conjunctivitis. तो कफ, खांसी, coryza is runny nose, and conjunctivitis red eyes. Fever and 3 C's I know. Buccal mucosa spots I know, coptic spots. The rash starts from where? It starts from behind the ear, and then like water trickling down your body, it is going to go everywhere down. Measles का giant cell in pathology, Warthin-Finkelday giant cell. All this about measles I know, but many years later it can cause brain involvement. Some 7 to 10 years later, subacute sclerosing pan encephalitis. That is why I put it over here. And this is then going to, within 2 to 3 years, result in death of the patient. So happens very, very late, but then when it happens, it's going to kill the patient. Coming to, not even wanting to discuss this, rabies to brain में जाता है या brain में जाके जल्दी से tell me the real questions that will come. Tell me the bodies that it makes. The bodies that it makes is going to be Negri bodies. Which part of the brain does it make? Cerebellum and hippocampus. I hope I'm going fast on this, but you know it. Tell me the special stain for Negri bodies which they can ask you, and that is going to be the Cellar stain. But ma'am, brain ki biopsy to you will do when the person has died. If we know it is a 100% fatal condition, patient will always end up dying, but till the time the patient has not died, there's no demise, you can't take the brain out, right? So then what is the best place from where you can take a sample? You will take the hair follicle from the nape of the neck, and what kind of testing will you do? You will do direct immunofluorescence. DIF likhein ya DFAT likhein, it's the same thing. Basically you are wanting to do direct immunofluorescence. You take the hair follicle from the nape of the neck. तो दो चीज़ें, लिविंग है तो नेप ऑफ नेक से हेयर फॉलिकल लो, DIF करो, डेड है तो ब्रेन मिल ही जाएगा. देन यू विल डू नेग्री बॉडीज. नेग्री बॉडीज में व्हाट विल यू स्टेन, पुट अ स्टेन ऑफ? दैट इज सेलर स्टेन. एनी वायरस दैट आई हैव मिस्ड आउट? Why have I written HSV1? Why have I not written HSV2? Because I'm dealing with brain. I know HSV1 is always above the waist. HSV2 was below the waist. Below the waist वो genital चला जाता. This is brain. I'm hoping everyone's brain is above the waist. So then above the waist is going to be HSV1, and every HSV, वैसे तो above the waist, brain तो बहुत दूर है. More than that, what does it cause? It causes all oral lesions. Plus it also causes brain involvement. So what smear do we do for any kind of HSV? HSV1, HSV2, it is going to be Zank smear. Zank smear पे ये 3 M's दिखते हैं ना, तो finish that also. Very good. Multinucleation, molding and margination. I can see lots of nuclei fitting into each other. Multinucleation, molding and margination. So finally, so many viruses also you have finished. If I randomly give you this life cycle, there's no need to read anything. कुछ negri bodies and all मत ढूंढो. Dog bite के साथ what are you going to mark? You are going to mark rabies. I have small little homework for you, which anyway you were going to do. PSM से please vaccine regime पढ़ लेना. Rabies and dog bite has always been not just for exam, but in the news so much spoken about that किसी ने randomly भी न्यूज़ पढ़ा होगा एग्जामिनर में, तो at the back of his mind he will have rabies as a question to give to you. So whatever was there here I've taught you, but that vaccine you have to study. Finally done with this, but let me go back. Have I almost completed? You will realize bacteria, viruses, parasites, fungus, maybe a little bit of this is left, and I will just show you one life cycle. You will identify and you will let me know. तो इसमें से they will give you the neuromuscular junction. You will have to mark कौन सा tetanus है, कौन सा botulism है, and I think we know what happens in tetanus. Relaxation चला जाता है, GABA and glycine goes away. That is why the patient enters into a lot of spasms. Whereas in botulism comes from bottled food, canned food. बच्चा था उसे birth पे honey दे दिया bottle में से, तो botulism हो गया. Botulism will inhibit what? Acetylcholine. तो as a result of which all the muscles are going to become floppy. And what is actually a problem in that happens in botulism? Ma'am, वो हम कह रहे हैं acetylcholine is not coming out, but the real defect happens at the level of the snare proteins. ये कौन सा photos हैं? ये tetanus का photo है. We know this. I'm going fast on this. We all know it. Rhizus sardonicus, opisthotonous position. Then many of you had told me earlier कि Clostridium tetani वो swarming mnemonic में आता था. We know it. Over there, you guys had only told me कि अच्छा it looks like a drumstick. Whatever you have told me, I have anyway written, so nothing new that I'm telling you. But you should be knowing that where exactly are they putting a mark. If GABA glycine gone, tetanus, acetylcholine gone, botulism, and finally this is also done. So this finishes off a major chunk. Where are we? We are going very strong out here. Now what we are going to do, ये तो हमने 90% we have finished. There are some things which are overall not fitting. Everything doesn't cause diarrhea and meningitis na. तो बाकी की चीज़ें, mechanisms of actions, all of those we are going to do. And we have reached the 70th slide, so that is good enough. We will finish before 4 hours, at least that is my promise to you. Now we can not have too much of information in one slide. अब हमारा थोड़ा सा जल्दी जल्दी वाला start हो जाएगा. So thanks for being so cooperative till now. I hope you continue. Cystic fibrosis का patient है, chronic lung infection है, and as soon as I see some greenish color coming in front of me, there's only one bacteria I can think of, especially with cystic fibrosis. It has to be Pseudomonas. Can I increase the speed now? Because till here I was teaching something which I have not taught in that way. So I wanted to be very calm, composed about it. Are we okay with me trying to be a little 1.25, 1.5x speed? Anyway, you are used to 2x, 3x. तो कर सकते हैं. Yes, at any given point of time you feel कि नहीं मैम out of control हो चुका है, you can always tell me to come back to 1x, but I'll just try to speed up a little before you become totally down and out and toxic. Okay, चलो Pseudomonas, fine. Gram negative है, I know that. You have to tell me the mechanism of action. Most of you have marked EF2. Basically, there are 4 bacteria which decrease the protein synthesis. How do we go ahead with this? Decreasing protein synthesis, DPSS. Quickly revise for me. D for what? Diphtheria toxin. P for Pseudomonas. S and S for Shiga and Shiga-like toxin. Now tell me, how do they decrease the protein synthesis? So D and P, they decrease by ADP ribosylation of EF2. How do Shiga and Shiga decrease? They are going to decrease the 60S ribosome. अब यहाँ पे Pseudomonas था, that is why I said EF2. Can you tell me what is the culture media for this Pseudomonas? That's exactly the next question that I have. But the clinical history is different. Pain, itching, difficulty in hearing, and yellowish green discharge. Blue, green aate hi think of Pseudomonas. Then they are saying sample was sent, and what is the selective media? Cetrimide. Let me show you a picture. That is why I said everything has to be green. The nail, any secretion, everything becomes green. The color of the pigment is only blue-green, and that is known as pyocyanin. Cyanosis will always remind me of blue-green, right? And that is the culture media for it, called cetrimide agar. Pseudomonas के सारे questions खत्म. Mechanism done, EF2 वाला, cetrimide done, blue-green pyocyanin done. But tell me all these. Campylobacter is a culture media. ये तो अभी पढ़ा था. That was for Campylobacter jejuni. Can you tell me this Bordet Gengu media is a culture media for Bordetella pertussis, the whooping cough? Common sense again. Then what is this ash down media? Everything coming down to ashes. Ma'am, everything will come down to ashes when there is a bomb blast. Vietnam time bomb will result in that kind of ash down appearance, and that is caused by Burkholderia pseudomeli. So all these culture media also revised. If I get back, Pseudomonas हमने पढ़ लिया. Shigella and all I have discussed as a diarrhea earlier. I have not done anything about diphtheria. So what I'm going to do is a 1-minute flashcard of everything to do with diphtheria, because without that I will not be satisfied that I've completed your syllabus. Everything about diphtheria, start labeling. This 1 minute is totally yours. How does diphtheria present? Number one, it has a pseudomembrane. That is why patient has difficulty in breathing. Secondly, this so many lymph nodes makes it a bull's neck. It's always this child of bull's neck that they give you. This child is a celebrity out here. What is that appearance that you have? It's the classical Chinese letter or cuneiform appearance. What are the granules? Their age-old question. Volutin granules. ये कौन सा वाला stain दिया है volutin granules के लिए? Albert stain. I will not write the full form. You will tell me what all does Albert stain have. It's a very NEET PG question. Number one, it has toluidine blue. Number two, iodine. And number three, malachite green. Toluidine blue is what has given those volutin granules a color. Then iodine to theek hai, and then malachite green has what is given the bacteria the green color. All these stains are done. Tell me the culture media. First tell me the enriched culture media. Enriched, remember, had 8 alphabet. That was Loeffler serum slope, because that also has 8 alphabets, and the time taken to grow is also going to be 8 hours. So for early diagnosis I was using Loeffler serum slope. But selective media kaun sa hai? Potassium tellurite agar, which is going to take 48 hours for its growth. Now coming to the two tests. Which is the test for diphtheria toxin? For knowing the toxigenicity, for knowing the toxin, I said LX gel precipitation test. Can you tell me one metal with which toxin is related? It is inversely related to iron, which means if iron will increase, the toxin production will decrease. If iron will decrease, the toxin production will increase. So diphtheria toxin ke 3 question. Number one, mechanism of action. It decreases the protein synthesis. Number two, what is the test for the toxin? LX gel precipitation test. Number three, it is inversely related to iron. What is the test for susceptibility, to know whether I am immune or not? Susceptibility ke liye Schick test. Schick test is a type of which hypersensitivity reaction? It's a type 3 hypersensitivity reaction. Okay, so this is also done. I can move forward. वो वाला पूरा, you finished all the mechanisms. Cyclic AMP, GMP पहले पढ़ लिया था. Decreasing protein synthesis done now. All mechanisms are sorted. The next question is a 55-year-old male patient with a blackish lesion on the arm after animal hide handling. Animal skin ki handling. I will only think of Bacillus anthracis. always. Which dye for Bacillus anthracis? It is polychrome methylene blue, because which reaction are we doing? Mcfadden reaction. So now tell me that otherwise, वैसे जितने भी capsules I have taught you, they are always made up of polysaccharide, and which reaction do you do? Quellung test. Like right now you did that Streptococcus pneumoniae. So ma'am, all capsules are polysaccharide, we do the Quellung test, but Bacillus anthracis is an exception, because here the capsule is polypeptide. Here we do the Mcfadden reaction, in which stain do we use? We use the polychrome methylene blue. Can you give me a quick recap? India ink staining कहाँ use कर रहे थे for cryptococcal meningitis? Supravital stain कहाँ use करते हो? Maybe go back a little in pathology and you do it for a stain called reticulocytes के लिए supravital stain was used. And PAS, तो we had discussed last time, it is used for so many things. If PAS is used for glycogen, is it PAS positive, diastase sensitive or diastase resistant? This is from your last class. Anything with glycogen is diastase sensitive. Everything else on this planet is going to be diastase resistant. Okay, this is also done. One thing I want you to revise, because this anthrax is a bioterrorism category A agent, very, very deadly, comes from animals. I know this is a very extensive slide, but iske revision se any PSM or micro question will come your way. I've tried, this is by the way a story that I've added in this time's rapid revision videos, how to learn that all of these are features of Bacillus anthracis. So over here you will think of it's a bioterrorism agent, na? So this is how I have made this one ghost. She's an Ekta Kapoor serial ghost, so she's obviously dressed up even when she is a ghost. And next, they are always going to show you a ghost hanging upside down from the tree. That's the maximum VFX they can show you. That ghost will be having a danda, a stick in the hand, beating people. That's a typical Ekta Kapoor ghost that they show us in the TV serials. Why did I say the ghost is having Medusa head appearance? Number one, the ghost is having this stick, so it looks like a bamboo stick appearance or the boxcar appearance. The ghost is actually dressed up like all characters of Ekta Kapoor serial, so that is known as the string of pearls appearance. The ghost is also hanging upside down from the tree, so it is going to show me the inverted fir tree appearance. Then the ghost will always be seen at night when there are stars. They will never show ghosts in the day. They will always show you when there is night time, so that is known as the comet tail appearance. Always beating glasses, so for frosted glass appearance, beating the glasses, to beaten egg appearance. All these words which fit well into the Ekta Kapoor story is going to make sense over here. Now I have just one little question. Inverted fir tree appearance is seen with Bacillus anthracis. Where is the fir tree? I hope it's visible at that font. Fir tree appearance is seen with, seedha wala tree is seen with Tetani, and ulta wala tree is seen with Bacillus anthracis. So yeah, that is done. Now I ask you, what was this? This was that animal skin contact mein aaya na? So this is that eschar. Sometimes it is written as a malignant eschar. It's the same thing, malignant only because it's looking very black. That's about it. And these are all the features of anthrax which they can ask you. Revise the bioterrorism agents ones from PSM, also category A, B, C. They are very, very important. Let's move forward. Going on to this question out here, which is very important. Patient tests positive for VDRL but has no clinical symptoms of syphilis, something which we encounter on a day-to-day basis, because if we give VDRL positive, person comes back to me saying that I have no genital ulcers, etc., no STD history, what is this? So then a follow-up TPHA is negative. Now they are saying what is the correct interpretation? VDRL is positive, TPHA is negative. What are you thinking of over here? Okay, many of you are saying it is a case of latent syphilis. But latent syphilis था तो फिर VDRL भी क्यों आया? Then nothing should have come positive as per you. Yes, this could be a case of, see, you need to understand that VDRL is a non-specific test for syphilis. VDRL can come positive so many times in COVID patients. VDRL I saw in the first wave of COVID, so many people were coming VDRL positive. It's not that everyone was having syphilis. It was the COVID antibodies which were giving VDRL. Sometimes pregnant women end up giving VDRL positive because of antibodies. We go for specific test, and over here I can see the specific test has clearly said that it is not syphilis. This means this VDRL was a false positive. This is a biological false positive that we have thought of over here. This is one question that I want to tell you, and this is everything about syphilis that you should be knowing. Primary, secondary, tertiary syphilis ka clinical पढ़ लो, then you should know microscopy, then you should know tests, and that's one flashcard. 1 minute which you are going to tell me. Syphilis mein everything is painless, syphiless. So the genital ulcer painless, the lymph node painless, everything painless. After primary syphilis, genital ulcer, we go to secondary syphilis. Secondary में सब कुछ 2. Some of you told me in the previous class, Lata has syphilis, चलेगा. You learn Lata has syphilis, condylometalata. So I have learnt it as condylometulatu, which occurs at the muco-Q2 junction. All of this only because I want to learn that it is secondary syphilis. Then the 2 hands and the 2 feet are going to have rash. So the 2 hands and the 2 feet have rash. That is secondary syphilis again. Why not condyloma acuminatum? Because condyloma acuminatum is a wart which I will read later with HPV. This is condylometalata. Lata has syphilis. Coming to the tertiary syphilis, when the organs are affected like the brain and the heart. And in the heart, we can see this is the aorta, which looks nothing like the aorta. It looks like the bark of a tree. So tree bark aorta is going to be seen in tertiary, which is great. Now coming to the organism, Treponema pallidum, कौन सा microscopy, dark field. Yes, dark field पे spirochete दिखता है ना, तो that is what you are seeing. You are not as rich as having a dark field microscope. You don't have it in your lab. What do? You use the routine light microscope. But then to see spirochete, you will have to put the black color stain, which is known as the silver stain if you are using a light microscope. Now coming to non-specific tests, जो VDRL and RPR पढ़ते हो, they are non-specific. If they come out to be positive, you will always have to follow it up with the specific tests, and all the specific tests will have something as Treponema pallidum in the name. उनके नाम में ही है Treponema pallidum. That is why they are specific. So now they will ask you which out of them is the most sensitive and most specific. Most sensitive is FTA absorption test and most specific is TPI. All are specific but TPI is the most specific. Now come back to the question. VDRL पॉजिटिव था बट वो तो नॉन स्पेसिफिक है. जो रियल टेस्ट है Treponema pallidum वाला वो नेगेटिव आ गया. दिस मीन्स VDRL जो था दैट वाज अ फॉल्स पॉजिटिव. I have one more question over here for all of you. Based on the clinical findings given below, genital ulcer की बात करी तो that one table is coming your way. They have said there is an image 1 and then there is an image 2 and there is a diagnosis of lymphogranuloma venereum that is made. Also it is associated with Fitzhugh-Curtis syndrome as a complication. Which other disease can lead to a similar complication? Okay guys, wake up. I haven't asked you lymphogranuloma venereum कौन करा रहा है, that all of you are like, oh ये तो chlamydia trachomatis करा रहा है. ये question है ही नहीं. I am saying which other disease can lead to a similar complication of Fitzhugh-Curtis syndrome? Who other than this can cause? Neisseria gonorrhea. Did you wake up with that? The question was not कि oh, who is causing lymphogranuloma venereum. I am not going to be that dumb in this session, right? So now wake up, and that tells me that हाँ बात तो क्या करी? बात तो करी of chlamydia trachomatis. L1, L2, L3 causes lymphogranuloma venereum. What kind of a genital ulcer is there? Painless genital ulcer. But what kind of a lymph node? It's looking only so painful. You call it buboes, and in between them you have a groove going. That is nothing but the inguinal ligament. All that is okay. But one of the complications that it causes is Fitzhugh-Curtis syndrome, which all of you are right is perihepatitis. यहाँ तक तो ठीक था. Now the question is, other than chlamydia trachomatis, who else causes perihepatitis? Is Neisseria gonorrhoeae, that STD. So these are the question. This is the question that I had asked you. ऐसी गलतियाँ please exam में मत करना. Because whenever you are, see what were you were you were tired, but you will be in the exam, you will have a 2.5 hour plus exam to sit there also, right? And second, you were overconfident. Abhi to overconfidence में you are laughing it out, but in the exam when you're like how easy, this is option A, trachomatis, LGV, थोड़ा सा ध्यान से कम. What did I say? Labile in the air, stable on the ground. Abhi you can be labile in the air, but exam day पर क्या बनना है? Stable on the ground, be very grounded. You don't know everything, you can make silly mistakes, you are a human being, right? You are a student altogether, so you had to read carefully, and that is exactly what you did. Now I know you won't do this mistake. That is Neisseria gonorrhoeae. तो genital ulcers एक बार जल्दी से 30-second revision from your end. Either a genital ulcer is painful or a genital ulcer is painless. Painful में दो ही options हैं. Crying with pain, I've left space, means you will tell me some pointers and finish off this also. So it's going to take 1 minute total, but you will tell me everything about it. Painful genital ulcer, crying with pain, तो कौन से आगार में grow करोगे? मैम crying person को थोड़ा chocolate दे दो. तो which agar will you grow it in? You will grow it in a chocolate agar. Hemophilus ducrei needs factor 5 or factor 10. Ducrei 10, it needs factor 10. That is why I'm growing it on a chocolate agar. 10 चाहिए. And along with that, You will also add something more so that he stops crying. So you will add some isobutylix also. Then it is a, it's a genital ulcer. We need protection. तो protection है, तभी हमने क्या करा? We said safety pin appearance है. साथ में कौन सा appearance? Like they are standing, all these safety pins, let's assume they are standing one behind the other like an assembly. सुबह assembly होता था ना school में, like a school line they are standing. That is known as school of fish appearance. Okay, then other genital ulcer which is painful, अगर virus पूछा, below the waist, that is HSV2, and this is again going to be कौन सा smear करेंगे? The favorite Zank smear. क्या appearance दिखेगा? The multinucleation, molding, margination, we know that. तो painful में Ducrey and HSV2, everything else is painless. Painless में syphilis, everything painless. Genital ulcer painless, lymph node painless, ये तो हमने पूरा फोटो देख लिया. Lymphogranuloma venereum, genital ulcer is painless, but the lymph node is very very painful. That red color buboes वाला वो भी देख लिया. The third one left is Klebsiella granulomatous. What is it known as? Donovenosis. कौन सा appearance दिखाता है? Again safety pin appearance. And what is the ulcer? This has a very characteristic buzzword, beefy red. तो अब ध्यान से सुनो, तीनों का ही painless genital ulcer. Along with that, if I say beefy red है तो donovenosis. If I say नहीं lymph node तो painful है, you will say LGV. If I say everything is painless, you will say that is syphilis, and then you will mark your tests accordingly. Okay, can I move forward? While I was doing the spirochetes, this is one life cycle again. You've seen this so many times. I know you know the answer. This is a classical Leptospira. How did you identify Leptospira? By the RRR. Ma'am, number one, rat urine will go and contaminate what? Rainy water. Rainy water कौन use कर लेगा? The rice field our farmers will end up using. That is Leptospira. And which is the next R that you have to know? It is going to show you the Dinger's ring, as you can see over here on the EMJH media. So rat urine, rainy water, rice field worker, Dinger's ring. कैसा दिखता है? लपेटा हुआ spiral. The spiral looks as if it is hooked on to both ends. And what is the antibody testing that you do? MAT, microscopic agglutination test. The last slide, the moment I reach there, you will know अच्छा वो last slide है. When I reach the agglutination tests as the last line of today's class, I will tell you 3 agglutination tests, but तब तक के लिए microscopic agglutination test is going to be the one for Leptospira. Very very good. Where are we going to next? This is just a one liner, just a break in between के कुछ off record हो जाएगा. Which bacteria is the MW vaccine extracted as mentioned below? From which bacteria? What is MW vaccine? MW is an immunomodulator vaccine which is used for leprosy. This is an immunomodulator vaccine. Leprosy के लिए बना था, but किससे बना था? From which bacteria was it made? It is made from Indicus prani. Lepra के बारे में can you quickly tell me? Vaccine तो I have understood. How much of 1, 2, 3, 4, 5? How much percent H2SO4 do I use? 5% H2SO4 I use in the ZN stain. What is that known as? That is called as fight for acostain. Please leprosy के लिए थोड़ा सा like one homework I gave you earlier for rabies का PSM integration you will do. Leprosy का derma, वो Ridley Jopling classification please पढ़ लेना साथ में. Do read about the lepra reactions. Do read about how lepra reactions and hypersensitivity is linked. And if I just ask you, let me, because I think I don't know if your derma LRR is done or not, but होगा तो. Lepra reaction type 1 and lepra reaction type 2. Can you quickly tell me what are their hypersensitivity reactions? Lepra reaction, अच्छा 1 का 4 and 2 का 3, because we always follow what? We follow the rule of 5 ना, तो 1 plus 4 5, 2 plus 3 5, so जो भी पूछा total 5 बना के आना. Very very good. ठीक है, तो ये just you will study. Do we have any culture media for leprosy? No, we don't. We do that 9 एक animal होता है with those 9 bands, 9 banded armadillo या फिर mice also you can use. That is you do animal inoculation. This was just a break that I wanted to give. The next question that you have over here is you're going to match these tests with their things. What all do I already know? I think I already know Zank smear and herpes का MMM पता है. Sabin Feldman test and Feline का toxoplasma भी पढ़ लिया, तो जो बाकी दो बचे, that is what I'll be revising. For what do I use Paul Bunnell test? Paul Bunnell test is a heterophile agglutination test that we do for infectious mononucleosis. Other than Paul Bunnell test और कौन सा test है for the infectious mononucleosis, which is also a heterophile agglutination test? It is perfect. It is monospot test. And what is this? Weil-Felix reaction. Weil-Felix reaction is for what? It is rickettsial disease. Acha, this is also heterophile agglutination. This is also heterophile agglutination. Ye bhi last line of today's, I mean right now it's not the line, don't run away, but I will come to a slide where all of this is summarized. Why are both of them heterophile? Because you are testing something but you are using something. For example, Weil-Felix test, you are wanting to find which antibodies in the patient. I'm wanting to find rickettsial antibodies in the blood of the patient. But which antigens am I using in my lab? I am using Proteus antigens. Antibody rickettsia की है, antigen किसी और का. Antigen I'm using Proteus का कौन सा? OX2, OX19 and OXK. Very good, all of you have already told me. That is why it is a heterophile agglutination test. So Weil-Felix for rickettsial, Paul Bunnell and monospot for infectious mononucleosis. Coming to the next, which again is something which we cannot mess out on. This is what you have to know, but this is the tough part. But I've tried one chart and this will finish it for you. 25-year-old female presents to the outpatient clinic with burning micturition. We finally come to UTI. Okay, temperature increased, pulse bataya hai, BP slightly on the higher end, then respiratory 16 beats per minute and breaths per minute, and then there is a urine sample that was sent for culture. Here is where the real question starts. Abhi tak it was all UTI. Usually my mind starts going towards E. coli Klebsiella wala family, but as soon as they said catalase positive and coagulase negative, I start thinking of cons, coagulase negative staph, that is cons. Which staph can cause UTI? Which cons wala staph? So I'll tell you a way of solving such questions. जब भी ये catalase coagulase वाला story will come to your mind, pick up one enzyme and finish it, because there are 2 chapters, बस उसी में से answer है, कहीं और नहीं जाएगा. As soon as they say catalase, chapter 1 क्या होता है? Staphylococcus. Chapter 2 is Streptococcus. This time I've gone totally opposite. I always start with staph strepto because that's with a fresh mind, you know it so well. This time I've kept it right for the end of bacteriology. Now remember, catalase positive आते you say staph. Catalase negative, chapter 2 Streptococcus. तो यहाँ पे catalase positive बोला, इतना समझ आ गई, it has to be from Staphylococcus. After that you look at the next one, that is going to be coagulase. Either it is coagulase positive or coagulase negative. The usual Staph aureus is coagulase positive. Can I say Staph aureus is catalase positive also, coagulase positive also, सब कुछ positive होता है, that is Staph aureus. Whereas if coagulase is negative, that is cons known as Staph epidermidis and Staph saprophyticus. This actually must be Staph saprophyticus because that is the one causing urinary tract infection. Staph epidermidis causes prosthetic valve endocarditis, which they would have given as a history otherwise. So repeat with me. Question 1, catalase देखा, पॉजिटिव है तो चैप्टर 1, नेगेटिव है तो चैप्टर 2. अगर स्टैफ है तो कोएगुलेज देखा, वो भी पॉजिटिव है तो देन ऑरियस, नेगेटिव है तो इट इज कॉन्स, एंड दैट इज व्हाट आई मार्क्ड ओवर हियर बिकॉज इट वाज catalase positive, coagulase negative. Let's move on to that. If by chance, let's solve a question and then I'll come to that. There's a 10-year-old child with hematuria, hypertension and periorbital edema following a skin infection. Now what is this sounding like? Skin infection like impetigo is because of streptococcal, and this looks like cola color urine, so post streptococcal glomerulonephritis. They are saying which serological marker will you use? I know, थोड़ा ध्यान से पढ़ लो. आई नो एज सुन एज आई से स्ट्रेप्टोकोकल यू थिंक ऑफ एंटी स्ट्रेप्टोलाइजिन, ओ टाइटर ही तो करते हैं, दैट इज व्हाट वी डू. बट इन PSGN इज इट ऑलवेज ASO टाइटर्स विच आर मोर यूजफुल फॉर अस? डू यू वांट टू टेक अ गेस ऑन इट वंस मोर? ASO टाइटर्स कर सकते हो, बट इज दैट मोर beneficial? Or in PSGN anti-DNase B titers are more beneficial? So listen to this carefully. Whenever, which streptococcus are you thinking of? Streptococcus pyogenes. What do you call it? You call it GABs. We all know this, na? Group A beta hemolytic streptococcus. So I didn't tell you the obvious things. I'm telling you something where you'll mess up. Whenever I think of streptococcus like a sore throat or whatever, I always go for anti-streptolizin O titers. Even like rheumatic heart disease ke bhi criteria mein, Jones criteria mein, they have mentioned ASO. But then remember 2 diseases. Number 1, thinking of skin infections like pyoderma, and second PSGN. इनमें which streptococcal antibody is more beneficial for the diagnosis? It is anti-DNase B antibody which is more beneficial rather than ASO titers, and hence I have marked that. Is this point okay? बाकी तो आपको पता ही है, group A beta hemolytic streptococcus and also nothing new that I'm telling you over here. Another question that we have, and for those who are asking how many slides more, we have reached 92. So we are before time only. We finished our 90th mark, right? We were supposed to finish it at 3 hours plus. तो हमने पहले ही खत्म कर दिया. So we are going well, but yeah, patience. That's all that you need. But इसके बाद और जल्दी चलेगा. Trust me on that because you've got a lot of eggs and all. Bacteriology खत्म मतलब the tough part is done. We have crossed the 90th slide. ठीक है. Coming here, which of the following virulence factors of Neisseria meningitidis is responsible for the massive capillary leak, DIC? Basically, patient is going into meningococcemia. Till now I said Neisseria meningitidis was everything with meningitis. Now it's going into a kind of a DIC situation. So now look at all of this. Does Neisseria meningitidis have a capsule? Yes, it does. But is that responsible for meningococcemia? No, it is lipo-oligosaccharide. And listen to me carefully. Neisseria क्या है? Gram negative ना? Didn't I tell you gram negative के cell wall में the first thing that we studied was gram positive का cell wall as peptidoglycan, gram negative का cell wall as lipopolysaccharide. But Neisseria is that which instead of lipopolysaccharide has lipo-oligosaccharide. Another thing which is important for INI-CET. So all gram negative organisms have lipopolysaccharide, but Neisseria dono, Neisseria meningitidis also, Neisseria gonorrhea also, they have lipo-oligosaccharide. तो सब कुछ Neisseria का अलग है मैम. All of them have pili for attachment, but Neisseria says I will have type 4 pili which is going to help in locomotion. All have lipopolysaccharide, but Neisseria says I will have lipo-oligosaccharide. So now you've done all the exceptions of Neisseria. Culture media, you know, transport के लिए mice, mice media, और growth के लिए modified Thayer-Martin media. I think we have studied that, so we can easily move forward, and we move on to the exact next thing that I believe you already know. You are not reading, I know, and you know we've changed all of a sudden where we are reaching towards. We finished the bacteria that we had to, thankfully, but somewhere a bacteria will keep coming back. But अभी थोड़ा आगे चलते हैं. 35-year-old soldier. There is a painful erosive lesion, cutaneous manifestation after returning from a desert area. So earlobe पे है. Then there are macrophages which have got on a biopsy with A mastigot. We can only think of, I know you were expecting Leishmania donovani ka classical वो काला आजार वाला history, but I didn't give the hepatosplenomegaly history. I gave you the cutaneous one. What is this A mastigot? These are the LD bodies. Why do the LD bodies have two dots, bada dot, chota dot? Why is like? Because bada dot is the nucleus and the chotu dot is going to be the kinetoplast, and together nucleus plus kinetoplast is known as LD body. LD body क्या होता है? It is A mastigot. So for Leishmania donovani I have fixed number of questions. How does infection occur? Which form? तो pro वाला हमेशा आगे रहता है. Infection occurs through promastigot. What is the form that you are seeing under the microscope? I am seeing A mastigot form. And what is the culture media that you will use? I use the triple N culture media. On triple N culture media, again, which form grows? Promastigot grows. So everywhere pro. Pro matlab first na. So pro is everywhere. Who causes infection of Leishmania donovani? Pro causes infection. Who grows on culture media? Pro grows on culture media. A mastigot bichara sirf ek jagah. That is when you will see LD bodies. That is A mastigot. Otherwise everywhere it is promastigot. I don't even want to ask you that the vector is going to be sandfly. Vector की बात करी तो ये बता दो. There is one question on vector, one clinical image shown in both of these. You will answer two questions on the basis of this. What sign did you make it? I hope you made it the Romanas sign, because it is in this that you see that there is one eye unilateral periorbital edema that is there. And now you know the classical, the Jhakas life. I'm not going to ask you that story. I think some stories remain with you, like that Dadaji story I didn't repeat because you studied it. Same with the Jhakas life story also, you know. Jhakas refers to Chagas disease. It is a rich South American couple who's living the Jhakas life, so South American sleeping sickness. They are going on cruise, so the parasite is Trypanosoma cruzi. They are driving Mercedes-Benz and G-Wagon kind of cars, so the drug of choice is benzonidazole. And this is this kind of a life. They are living their honeymoon phase. So that is caused by the triatomine reduvid bug, which is also known as the kissing bug. यहाँ तक तो I think we remember. अच्छा, where would I have marked the CC fly? CC fly also sleeping sickness, but that not that rich wala sleeping sickness, garib wala sleeping sickness. African sleeping sickness के लिए we had the CC fly that is caused by Trypanosoma brucei. But abhi ke liye, coming back to the rich Jhakas life, they have put up another question that the child has this Romanas sign after returning from South America. So South American fit ho raha hai. What is seen in the chronic stage? This is all seen in the starting stage. Chronic stage mein, do you remember someone leading such a rich life? We had said bade log badi baatein, so all the organs start becoming big, like there is dilated cardiomyopathy, there is mega esophagus, and before bade log badi baatein we give that taunting sound of So what is the culture media? That is triple N culture media. So now triple N culture media is for Leishmania donovani, and it is also for Trypanosoma cruzi, which we have mentioned over here. So now I will expect कि mega esophagus में वो कौन सा disease coming to your mind that can come as a correlation with surgery is achalasia cardia. I'm very bad at drawing, but I hope this looks like the bird beak sign of achalasia cardia, which you should be knowing. So they will say achalasia cardia, bird beak sign. कौन से parasite के साथ link करोगे? You will link it with Trypanosoma cruzi. Okay. Coming on to the next question that you have over here. A little different from usually what I ask you. Usually I give you image based questions. Here I've given you a direct question of theory, then I'll teach you the images. Traveler returning from Africa, cyclical fevers every 48 hours, and there are Schaffner's dots seen. Malaria samajh mein aa gaya because Schaffner's dots is malaria. The parasite is responsible for relapses because of which stage? Hypnozoid. So basically what happens, malaria kai baar jaake goes into the liver, gets hypnotized in the liver, called as hypnozoids, basically sleeps off, and then it will suddenly wake up one fine day and it will result in a relapse. वो तो ठीक है, hypnozoid से relapse होता है. But why did I think of Schaffner's dots? Which malaria did you think of? Did you think of Vivax, falciparum? So quickly tell me all these dots and the malaria. Number one, shuffling. Viva में shuffling होता है questions का, so that is going to be Plasmodium vivax. Next, Morer's cleft is seen in Plasmodium falciparum because if you read it opposite, it sounds like Morer's clefts. Z, man dots are seen in Plasmodium malariae, man dots in malariae. And James dots के लिए क्या बचा? It is seen in Plasmodium ovale. Now, do I need to know some questions of images with it? Yes, there are 2 slides on images that we'll have to do. Pehla wala, look at, I've divided it into 3 parts so that all your images are on one slide. Let's get going. If you see one dot, everything 1, there's one ring and one dot. So that is the trophozoite of what? That is Plasmodium vivax. Vivax mein everything is 1. There is one ring and there is one dot. That's the trophozoite form. Then how is the schizont? It has those chota parasites in it. And how is the shape of the gametocyte? That is also oval. Vivax mein one ring, one dot, oval. सब कुछ ऐसा ही sound करेगा. मैक्रोगेमिटोसाइड, माइक्रोगेमिटोसाइड. मैक्रो किसको बोले? मैक्रो फीमेल्स को ज़्यादा इंपॉर्टेंस, तो मैक्रोगेमिटोसाइड इज सेट फॉर फीमेल्स एंड माइक्रो इज सेट फॉर males. ये था Plasmodium vivax. Let's put a line over here because now I start with Plasmodium falciparum. If vivax had one ring, one dot, falciparum is going to have many rings and many dots. So many rings and so many dots that one ring said, I am angry, I'm not getting any space. It goes and sits at the margin. What is that dot? What is that ring known as? Gussa ho gaya, it has got angry. What is that? Acole form because there's no space left. Then I have not put any schizont. Do you see schizont? Ma'am, schizont hota hai, but is the schizont present in the peripheral smear? No, the schizont is actually gone and sitting where? It's sitting in the prime location, that is the brain. Tabhi to falciparum causes cerebral malaria. And cerebral malaria means which granuloma does it cause? It causes Dirk granuloma. दिमाग में डर्क ग्रैन्युलोमा. गेमिटोसाइट का क्या शेप होता है? बनाना शेप. टेल मी विच इज मेल, विच इज फीमेल. फीमेल का जो क्रोमैटिन है वेरी नाइसली ऑर्गेनाइज्ड, नाइस एंड क्लीन एंड टाइडी, दैट इज फीमेल. मेल का क्रोमैटिन देखो सब इधर उधर फैला हुआ, अनटाइडी, that is going to be male, just like how male female are. So we have learnt it that way only. Coming to the next question, ये तो था Plasmodium falciparum. ये वाला कौन सा Plasmodium है? Where I don't see a ring, I don't see ring, but I see Pichkava ring. I mean, it's a band. It was supposed to be a ring, but someone just squeezed it. It's looking like a band. That is Mala band. Plasmodium malaria, Mala is going to be seeing or showing a band trophozoite, not a ring but a Pichkava ring. That is a band. What is this? If you can see, I'll zoom in. Yeah, there are rings, but they are now making a cross. There are 4 rings. Is this a malaria? No, this is not a malaria. This is a Babesia. Babesia shows you 4 rings. Those 4 rings have made a cross called the Maltese cross appearance. All photos. So Babesia malaria same as it. Clinically same. Fever with chills, इसमें भी rings, but difference क्या है? Over here in Babesia you see a tetrad of rings or Maltese cross appearance that you notice. Okay, can we move forward and go on to what is known to everyone? I can give them as bonus slides, but if you spend 1 minute with me, maybe we can finish off. What I've got for the next 4-5 slides are all the eggs and उनके adult वाले worms. Because eggs I know you will identify, I won't spend time on it, but adult worms is where you'll have a problem in INI-CET. So that is what you are going to identify with me. So let's keep this as our baseline and we will come back to this question. Jaldi se ek bar sare eggs identify karte hain. Let's keep a 2-minute target. Let's see if we can do this in 2 minutes. Quite impossible. We've got so many slides. Let's see if we can do an ultra quick revision of all of these. Let's start. Number 1, what is the first egg? The egg which has anything 6 hooklets inside it is going to be the cystod egg. Apart from that, what is it going to add? It is going to have polar knobs. It is going to have these ganda granules which are known as the yolk granules. All cystodes have this except H. diminuta. H. diminuta says I will not have the polar knobs, and H. diminuta says I will not have the dirty yolk granules. What else? What is that egg which is going to have a lid? Very good with the speed, guys. Lid kaun sa hai protection ke liye? That is operculated egg. Which are all the eggs which have operculations? STD protection, from STD protection ke liye lid lagaya. That's how we learnt it. So Spirometra, trematodes and Diphyllobothrium latum. Do all trematodes have operculated eggs? Mostly yes, but is there an exception jiska S wala eggs hai? So spinous eggs are seen with schistosoma. These are the 3 schistosomas that you have. Agar lateral wala spine dikha to leta hua, sota hua, man. Lateral spine is seen in schistosoma mansoni. Then terminal spine is seen in schistosoma hematobium. And jo spine or photo dono hi nahi dikh raha. The spineless wala, the spine has gone rudimentary spine, and that is going to be schistosoma japonicum. All these are done. One set of eggs are over. Let's move on to the other set of eggs where I have decided egg ke sath adult worm. Egg ke sath adult worm clinical साथ साथ खत्म करना है. Then I'll make you do the questions. What is this round egg दिख रहा है ma'am? And if you look at the cross section of this body, that is also round. So now egg तो you will identify. This is round worm, that is Ascaris. For the adult worm, you have to go in a 2-step fashion. पहले तो identify कौन सा वाला worm. Then go on to male है या female है. तो पहले how did you identify that this is a round वाला worm? Because you looked at the cross section of the body and it is looking round. It's not flat, it's a round worm. Then you have to look at male female. एक तो तरीका है that the female I can see is larger, but in the exam you can't zoom in, it might be difficult. Then the other way is male, you will, I always say it sounds very bad when I say this, but don't take it in the literal meaning. आपको मेल के बैक साइड पे फोकस करना है, ठीक है? दैट इज व्हाट यू सपोज टू डू. समथिंग विल बी हैपनिंग ऑन द बैक एंड ऑफ द मेल. सो ओवर हियर यू विल सी सम कॉइलिंग. सो जहाँ भी बैक एंड ऑफ द मेल इज हैविंग सम हैपनिंग एक्टिविटी, दैट इज गोइंग टू बी द मेल वर्म, एंड द फीमेल इज गोइंग टू बी लॉन्गर एंड लार्जर. दैट इज हाउ यू आइडेंटिफाई. सो दिस इज मेल, दिस इज फीमेल, and this is the round wale eggs. Why 2? One is fertilized, one is non-fertilized. Fertilized says I will say yes to everything, and non-fertilized says mere to naam mein no hai, I will say no to everything. So if I ask you who has the coat, fertilized has the coat. Who has a space on both ends, fertilized has a space. Who will float, fertilized will float. So fertilized says yes, 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 non-fertilized says no, no, no. Coming to the next one, ये कौन सा egg बनाया? Barrel shaped egg. I believe all of you made it. Trichuris, trichura, you call it barrel, you call it dholak, you call it whatever, drum, blue drum, जो भी बुलाना चाहते हो, you call it. But now why is this Trichuris, trichura whipworm? इसका let's identify the worm. Will you be able to identify? Whip मतलब hunter. Yes, first as soon as I see a hunter, I'm like अच्छा ये Trichuris, trichura. Then you like male कौन सा है? Male के back side पे कुछ तो something तो happening is going on activity. This must be coiled, so this must be the male. The other one becomes female. How easy as that? And this now sounds even worse than what I said. कि अब ये hunter है, hunter कहाँ पे मारना है? You are supposed to hit the hunter on the rectum. So you can see these tiny white hunters on the rectum. This is known as the coconut cake rectum. That's a very classical. So you will get any history of a rectal prolapse or a rectal bleeding, coconut cake rectum, so hunter on the rectum, you will think of whipworm. The next one that we have is going to be the segmented, OO wala segmented egg, that is going to be hookworm, ankylostoma. इसमें भी same way you will see अच्छा male female में एक तो female is larger, male के back end पे I can see something like an umbrella. The male is like all ready to mate with the female. So the male has kept a big umbrella like opening at the end that, oh, let me go catch the female. That is how I identify ankylostoma. Coming to examiner's favorite. As soon as you see D-shape eggs are seen in enterobius. Pinworm होता है, बहुत पतला सा worm होता है. How do I identify? देखो male female तो कर ही लिया. Obviously this is happening activity at the posterior end, so this is a male. How is this enterobius ka male female? How did you identify enterobius? You will look at, don't just keep focusing on the back. Also focus on the face. So this is what you focus on the face, and you will see these two things. That is going to be cervical ala. If you start seeing cervical ala, that is enterobius. Uske baad you will see acha backside mein happening kahan hai. This is it. So this is going to be the male and that is going to be the female. Do you remember that this clinically results in what? Perianal pruritus. Patient को diarrhea नहीं हो रहा, patient को itching हो रहा है. तो itching के लिए what will I do? I will take a sample from the perianal region either with an NIH swab, or if it's a child I will stick a scotch tape over here. So that is known as scotch tape method. Another egg is done. Now finally the last one जहाँ egg होता ही नहीं. What is this? This is Strongyloids stercoralis, because this is ovoviviparous. Ma'am, the egg comes out, but egg में से एकदम से the egg bursts and the larva comes out. Which larva comes out? Rhabditiform larva. So egg का photo नहीं आता, the larva, baby comes out. Baby का photo आता है. How do you identify the baby? Because the esophagus has a double notch over here known as the double bulbed esophagus. The life cycle of strongyloids has suddenly become very important because it shows you something called parthenogenesis. Parthenogenesis का simple words में I have learnt it, single parent. This is the best example of how women are so strong. Can you see this woman all alone has given birth to babies? There is no male. Male होता है, exist करता है. See, there is a male in the life cycle also, but over here the male decided to ghost her. So male has gone, so the female says to hell with you, I will do fertilization on my own. Basically, the female is capable of asexual reproduction. She says, I will become a strong single parent and I will give birth to babies and the larva will come out of it and everything will happen. So if you're with me, very good. If you're without me, then also I'll manage. That is parthenogenesis, the story of how women are very strong over here. They don't need the male. Male is just an add-on bonus in their life. Okay, so single parent, single strong mother. That is what you learn. Very good. If I move on to the next one over here, let's see if you can solve a few questions. There's a patient with long-standing rheumatoid arthritis on immunosuppressants, now having pneumonia and skin tracks. So as soon as skin likha jayega, there are only three things I can think of. Skin tracks, they've written larva currents, the larva. The stool examination shows rhabditiform larva. Anyway, rhabditiform larva, I know of only one, that is Strongyloids stercoralis, but still skin penetration will be because of three things and I'll tell you how to differentiate. Ya to they will write skin se schistosoma. Schistosoma ke saath they will have to show me those spinous eggs. Or they will say ankylostoma. Ankylostoma is hookworm. They will have to show me the segmented egg. Or they will show strongyloids. In strongyloids, they will have to show me that larva with the double bulbed esophagus. So that is how they will tell me. So schistosoma, ankylostoma and strongyloids will come through the skin, and that is why I marked it. Why did I not mark ankylostoma? Because that will not show me this rhabditiform larva, and anything else. Ascaris mein to skin penetration hota hi nahi, so ruling out becomes easy. Let's move on to the next question out here. 30-year-old woman, there's cough, sputum, that too blood tinged, and abdominal pain. So I can see a pulmonary history and I can see a GIT history. दो organs involved हो रहे हैं. And the buzzword over here is raw crab. See, I just told you seafood के साथ अगर prawn, crab, seafood होता, which vibrio would you have thought of? Vibrio parahemolyticus. But will vibrio also cause all these pulmonary symptoms? Plus vibrio is nowhere in the options, so let's not think about it. Abhi ke liye they have something mentioned as operculated eggs. You had studied operculated eggs are seen in STD. Spirometra पे तो question आएगा नहीं. This is not Diphyllobothrium latum. This is a trematode which is Paragonymous westermani. Why? Because para से याद किया था cara. जब भी crabs, cray ऐसा कुछ आएगा, you will be thinking of Paragonymous. So what are these? All these mentioned? These are all trematodes. Can you give me an ultra quick recap of all the hosts of trematodes? But before that, all trematodes are treated with which drug? That's a previous year question of pharmacology. All trematodes are treated with praziquantel except Fasciola hepatica, which is treated with triclabendazole. Very, very good. All are treated with praziquantel except Fasciola hepatica, which is with triclabendazole. Very famous question that you have for the previous year pharma papers. Now let's come. All the trematodes, the definitive host, hum bada sa human being we will make, that is the definitive host. What about the first intermediate host in all of them? It is going to be the snail, so that is also same. It's the second intermediate host where the story changes. Schistosoma ka to koi bhi nahi hota, it doesn't have one. Para ka it is going to be cara, so either crayfish or crab. Clonorchis and Opisthochus, we had learnt it as clonorfish and Opisthochus, so fish is going to be the one. Then we have Fasciola hepatica and Fasciolopsis buscae. For both of them, it is going to be the fresh aquatic plants, which are the second intermediate host. So like over here, they give me crab, it became so easy. But which out of these is going to be pulmonary fluke. Paragonymous Westermanni is the pulmonary fluke. Pulmonary था तभी यहाँ पर other than GIT patient had blood tinged sputum and the eggs were coming out in the sputum also because it is a pulmonary fluke. Yes, 3 hours done. Very, very good. We are on 100 and no, we will be done in 3.5, not 4. You've been very kind, very nice. अच्छा अब ये host कर दिया तो this I was planning to give you as bonus slide. Thank you for reminding me that I'm going faster than usual. So you will tell me this slide also, no, not a bonus. Rematodes कर लिए तो cystodes भी बता दो. Cystodes का भी drug of choice सब जगह क्या है? It is going to be praziquantel. So for everyone who was thinking कि मैम को नहीं याद दिलाते जल्दी जल्दी खत्म हो जाएगा, curse the student who reminded me कि 3 hours are done and I'm going faster than what I had thought. So no, but I won't torture you. If we can finish in 3.5, nothing better than that. So chalo, all the cystodes are also treated with praziquantel, but yes, there will be some exceptions which I will ask you in a while. But first tell me all the hosts. सबका डेफिनेटिव होस्ट मोस्टली ह्यूमन ही है, एक्सेप्ट फॉर आई थिंक यू नो एकाइनोकोकस ग्रैन्युलोसिस वेयर डॉग टेपवर्म होता है, तो वहाँ तो लाइफ साइकिल अकर्स बिटवीन डॉग एंड शीप. हम तो बेचारे आर जस्ट accidental host. Hydatid cyst na, echinococcus granulosis, so that is separate. Baki sabka it is definitive host. H nana, to remember I told you be like H nana, you don't need anything single source pe stick karna hai, one host, everything one, and then you will be very, very successful. This is the most common cystode. H. diminuta on the other hand can also have a life cycle with beetle and rat. That is why it is also known as rat tapeworm. Sirf rat tapeworm bhi yaad karoge to rat for H. diminuta is good. D. latum. Do you want to call it Diphysiobothrium latum? Diphysiobothrium tells me this life cycle will have two fish. Chotu fish, big fish. Examiner is not like us. He will not say the life cycle is between human, chotu fish and big fish. He will say the life cycle is between human. Chota fish in the aquatic in the aquatic zone is known as cyclops. Cyclops is eaten by the bada wala, proper wala fish, and then that fish is of course again eaten by us. So now the next two questions are, Diphysiobothrium latum is associated with which anemia? Megaloblastic, we know this, B12 deficiency. Dusra, when we end up eating this fish, which form of D latum are we eating? L1, L2, L3, which larva are we eating? It is the L3 larva जिसका नाम पूछते हैं. Very good, many of you have already written it. Plerocercoid larva is what we are going to consume, and that is what causes infection to us. B12 deficiency, plerocercoid, दो fish, बस यही है D latum का story. D latum shows you which kind of an egg. STD, operculated egg. I hope this looks like one. Please forgive me for very random bad drawings that I make at times. But yeah, that operculated lid wala egg, STD, D latum shows you that operculated. Okay, next, Taenia solium, the one that causes neurocysticercosis. Solium is going to be through pig. Saginata is going to be through cattle. I think we already know this. Neurocysticercosis, solium se hota hai, that is going to be starry sky appearance. We already know that as well. Let's move on to one more set of photos, and all these, before I go to that, all these eggs that you did, usko INI-CET only, not for NEET and FMG, only for INI-CET. How do you see those eggs? So now there are two techniques before asking you. एक है formal ether sedimentation technique, एक है saturated salt solution flotation technique. I'm not interested in formal डाल रहे हैं, ether डाल रहे हैं, salt डाल रहे हैं. I don't care much at this point of time of the syllabus especially. I am just going to see, are the eggs going to sediment or are the eggs going to float? So for example, here they labeled it as the formal ether sedimentation technique and said A, B, C, D में से eggs कहाँ पे मिलेंगे? So it is pretty obvious that in the sedimentation technique, I will get the eggs over here. If they would have said this is the saturated salt solution flotation technique, where would you have found the eggs? The eggs would have been found in the floating wala zone, that is the topmost region. So the chemical that they are adding is none of my concern, especially right now. Whether the eggs will sediment or float, I think I will be able to mark my answer on the basis of what is mentioned. So this was just a random offhand question, and that gets me to the last set of images that you have to know. Instead of giving you MCQs and you will be very, very tired, I thought I'll give you a flashcard and we'll wrap it up. They will be talking about filariasis. इससे parasitology भी खत्म हो जाएगा. That is why I said we'll be done in 3.5 hours, because after this in virology, I will be focusing on two things. One is the hepatitis, which all of you had requested me for, and the second, of course, will be few questions of HPV and all here and there that we should be studying. So we'll be done. We'll clock it in within 3.5. Okay, yes, quickly. So last 20 minutes means the best run that you can, it's like a sprint that you have to do. Which are the sheathed L, B, W? सबसे पहला Wuchereria bancrofti. Will you see any nuclei? No, Wush so means I do not see any nuclei at the tip. Brugia malai, I see 2 nuclei. By 2 nuclei at the tip, they will tell you. And Loa loa, I will see a line of nuclei present at the tip. That is clear. All of them are sheathed filaria. What are the clinical questions that I can get? Wuchereria ka to they will give you elephantiasis, the leg will be swollen and genital involvement will be there, to hydrocele hoga. Brugia malai mein genital involvement nahi hota. It is like Wuchereria, but there is no genital involvement, so there will not be any hydrocele component mentioned. And Loa loa ko kya bolte hain? It is a name. If you know the name, you know which organ is affected. It is the African eye worm. So they will show you that, or they will say that the worm is actually, I mean, they won't give you a picture of the eye because then to obvious ho jayega na, eye worm. They will say that the patient is actually himself able to see a worm in the eye, or the doctor is able to spot a worm in the eye. So it's precisely called as African eye worm, and that is what you will think of when it comes to Loa loa. So LBW is all sheathed. The unsheathed one that they write is onchocerca. This is also something in the eyes it causes. Does it cause river blindness? And river blindness का drug of choice क्या होता है? River blindness के लिए क्या देते हैं? River blindness के लिए we are going to give ivermectin. So that is also a pharma question that you have. So if you are done with all of this, I don't think one last question. Medicine का है but बता दो. Medicine में they ask me a lot about antigens. Can you tell me which antigen do we have for one specific antigen that you can tell me for filaria? Have you read OG4C3 antigen? I have learned it as OGAG antigen because that's easier to learn rather than numbers. So OGAG antigen. Right in the end, I will ask you some other antigens also. Dengue ka antigen, Kala Azar ka antigen. That is going to be right at the end. We will come to that. Abhi ke liye remember the antigen for filaria is OGAG, OG4C3 antigen. Perfect. Let's go on to an ultra easy question. Thoda breather milega na. You know this. HPV ka vaccine, the entire world is talking about it. HPV, whenever it goes and it attacks which epithelium of our body? Squamous epithelium. This has been a previous year question. They will give you a random squamous epithelium ka photo. Skin ka ho sakta hai, mouth का हो सकता है, cervix का हो सकता है, any squamous epithelium photo, and they will say which is the virus attacking this. Always think of HPV. This is the entire diagram of HPV that you should be knowing. We know HPV is a DNA virus. It has all of these. One by one you will tell me what is everything doing. The vaccine is made up of L1. Amazing. So L1 capsid makes the vaccine. What is E2? E2 is like the controller, the principal which tells the HPV to behave. Obviously HPV does not behave, but sometimes one principle has to be there, na? So that teacher is E2. E2 is the controller. E4, E5 are responsible for what? HPV. Last class in pathology you were telling me it makes coelocytes. What is coelocytes? It's a dark nucleus called racenoid nucleus and a white area around it which is known as perinuclear halo. Then who causes cancer? That is E6 and E7. E6 goes and deactivates my policeman, that is P53. E7 goes and deactivates the governor, that is RB gene. That is how both of them result in cancers. कहीं का भी cancer होगा, it will always be squamous cell carcinoma. चाहे mouth का हो, larynx का हो, esophagus का हो, cervix, penile, anal canal, anywhere it causes cancer. It's not only genital cancers. It can cause any cancer which is squamous cell carcinoma. And we know, to wrap it up, HPV can be low risk and high risk. Low risk में छोटा वाला number 6 and 11, they cause condyloma acuminatum. Condylomata lata was syphilis wala. Condyloma acuminatum are the warts of 6 and 11. And high risk one, you might feel what a dumb question, 16 and 18, but yeah, INI-CET का question था, name the high risk strains. 16 and 18 होते हैं, which are the ones which cause squamous cell carcinoma. Moving on to the next question, again a very dumb one, but things that I have to complete because they are important. Aplastic crisis in patients with any hemolytic anemia. They could write hereditary spherocytosis, sickle cell, thalassemia or anything, but now the entire bone marrow says I am not working. Aplastic crisis, excellent. It is parvovirus, to be precise, parvovirus B19. Does this remind you of that Aishwarya Rai story? Because she is the only one left alone. This is the only single-stranded DNA virus. This is also the one which is the smallest. That is why she is crying. This I told you in pathology also. Ro ke she has become red. Her cheeks have become red. That is known as slapped cheek appearance, and to slap someone you need 5 fingers. That is why it's known as the 5th disease. These are very vague names. The real name of this is erythema for red color and infection, erythema infectiosum. Slapping must have happened with hands, so the hands and feet also become red. That is known as the gloves and socks, and the joints also get affected, so there is arthritis, arthralgia. Agar bone marrow पूरा effect हो गया, that is known as aplastic crisis. अगर सिर्फ red blood cell effect हुआ तो pure red cell aplasia. If it goes from mother to child, the child will have hydrops fetalis. So I realize it can result in everything, from the child after birth to the child before birth to an adult in whose entire bone marrow is affected. And then I think I will draw something. It causes some projections in the red blood cells which I taught you. I hope this looks like a dog. Do you remember in pathology with parvovirus B19 I showed you dog ear projections? ये बिल्कुल last की तरफ कुछ slides हमने देखी थी in the LRR few days ago. Dog ear projections of parvovirus. Then you also told me which antigen of the red blood cell does it attack? Parvovirus attacks the P antigen of the red blood cells and then causes these dog ear projections. So that is what you are integrating. I think we are settled with parvovirus, but ये बाकी सब क्या क्या लिखा है? Tell me one word about each. Adenovirus causes what? Adenovirus causes diarrhea. I'll be very precise. Adenovirus causes infantile diarrhea. And which strain of adenovirus causes it? 8, 7, 40. So we had learned adenovirus 40, 41 because 40 will remind us of potty, and that is how infantile diarrhea of adenovirus is caused by 40, 41. अगला क्वेश्चन, ये पॉक्स वायरस कोई नहीं पूछ रहा आपसे, वो स्मॉल पॉक्स वो तो इरेडिकेट हो गया. Cowpox, cows में होता है, not interested. They will ask you the molluscum pox. This is the picture of the molluscum pox that they are going to ask you. In dermatology, what lesions? बीच में center में hole होता है, umbilicated lesions, and which bodies are seen? HP bodies. What is the special stain for HP bodies? Floxine tartarate stain. This is simple pox virus wala. Pox ka shape, pox is a box, bhari wala box. Why bhari wala box? Because it has a DNA which looks like a dumbbell. It has a dumbbell shaped DNA. So pox is a bhari box. It is a heavy box. It looks like a box with a dumbbell inside it. Very good. If I come back, which other virus am I left with? Adeno का हो गया 40, 41. Okay. Pox का molluscum हो गया, parvovirus का पूरा story हो गया. बचा क्या? Epstein-Barr virus. What is Epstein-Barr virus? It is actually human herpes virus 4. So what you're going to do, EBV तो you will tell me because I've told you Paul Bunnell test and all. A quick recap कर दो 1 minute का. But HHV goes from 1 to 8. Just tell me their quick names. Human herpes virus 1 and 2 is known as HSV 1 and 2. We know HSV is going to be above the waist and HSV 2 is going to be below the waist. So that is why when I was talking about meningitis, it was all HSV 1. When I was talking about genital ulcers, it was HSV 2. Then human herpes virus 3 is herpes zoster virus. Why chickenpox and zoster? I'm not going to ask you. Chickenpox का एक incubation period in pediatrics has been asked a lot. What is it? Previous year question for chickenpox. 14 to 21 days लिखें, 2 to 3 weeks लिखें. That is the incubation period. Then remember the rash is dewdrop on rose petal. Dewdrop on rose petal, we know that. Okay, so HHV 3 tak done. HHV 4 is what I'm talking about. That is Epstein-Barr virus. They will ask you everything. Epstein-Barr virus attacks which cells of our body? B cells or T cells? Question number 1, B cells. It enters through which receptor? It enters through CD21CR2 receptors. After entering, what are the 3 antigens that it makes? I have learned 1 to 10 for my ease in life. 1 to 10 is LMP1, EBNA2 and interleukin 10. These are the 3 things it makes. 1, 2, 10. After that, what all diseases does it cause? एक तो main fever वाला disease, infectious mononucleosis, because वो close contact से होता है, kissing disease and all the lymph nodes are enlarged, so glandular fever. So बच्चा होगा 5 to 15-year-old kids who are playing together in school, one of them has it, so all of them end up having, all of them have fever, all of them have big lymph nodes. That is the fever and all, manageable. What all else does it cause which is not manageable? Can you tell me the most common cancer? That is gastric cancer. Second most common cancer कौन सा बन चुका है? Nasopharyngeal carcinoma. Very good. Then lymphoma, it can cause both Hodgkin's and non-Hodgkin. तो कुछ भी लिखे, Burkitt's हो, any Hodgkin, any non-Hodgkin's it can cause. Sarcoma, this is an INI-CET question. Which is the only sarcoma that it causes? It is leiomyosarcoma that it can cause. अब मुझे बताओ for the diagnosis. Did I tell you right now that you can do Paul Bunnell test and monospot test? Are they regular agglutination tests or heterophile agglutination tests? I think we know this. But उससे पहले in the blood, which cells can you see? The cells which have this ballet skirt appearance, ballerina skirt appearance, what are they called as? They are called as Downey cells. ballet skirt. I'll just draw this over here. You know the ballerina skirt appearance. That is all about HHV4. Acha, what is HHV5? HHV5 is cytomegalovirus. What will you read in this? You know वो aula appearance. कितनी बार और पढ़ोगे? You know it. HHV6 and 7, 6 से 6 disease. Parvovirus क्या करा रहा था? 5th disease, क्योंकि वो 5 slap cheeks. 6 वाला है 6th disease. 6 disease में हमें क्या देखने को मिलता है? Roseola infantum, because rose like ऐसे rash होता है, and mouth में कौन से spots होते हैं? These are going to be the Nagayama spots. Finally, HHV8, so I think I have already taught you in pathology. We've written this: Kaposi sarcoma, primary fusion lymphoma, and what is this lollipop follicle wala thing? That is the question in path that I taught you. It was very good, Castleman disease. So I think with this one question, we have just gone overboard and done all. Let me ask you a question which I have not asked you earlier. Which of the following is a pararetrovirus? Now that's something which I don't remember teaching you in any format. If you've read it, if you know it, that's amazing. But if you don't, then welcome to INI-CET. Which of the following is a pararetrovirus? If I just asked you retrovirus, retro में तो मैम हमें पता है एक तो HIV होता है, and HIV के ही फैमिली में होता है HTLV 1 and 2. So then you took a safe guess कि अगर HIV पूछती मैम तो she would have said retrovirus. मैम didn't write, मैम said pararetrovirus. तो आंसर में HTLV होगा. But the real answer is hepatitis B virus, and oh my god, that's such a shocker, isn't it? And that's why I said, if you were not supposed to know this, if the examiner can give you one googly question, then why can't I? I'm also your examiner at the end of the day. Why did I call this? What the hell does it mean that it is a retrovirus? Because I know that retrovirus तो ये सारे RNA viruses होते थे ना. RNA को पहले वो reverse transcriptase से DNA बनाना पड़ता था and all of that. But hepatitis B तो is anyway a DNA virus, ma'am, and all DNA viruses की तरह this is also double stranded. But then the only googly question today, एक बाकी तो you were doing silly mistakes. I didn't give any googly question. This was the one which I want to add because, as I said, welcome to INI. So listen, and now we're going into hepatitis B, which obviously is almost, we are reaching towards the end. So this is where you need to wake up. Please note, I told you that all the DNA viruses, I'll repeat this line, all DNA viruses are double-stranded except for parvovirus, which is single-stranded. This we remember. But do you know hepatitis B, जिसे आप मानते हो double-stranded, this is how it looks like. Is it a complete double strand? I mean, एक तो पूरा DNA दिख रहा है, one full DNA I can see. One DNA I notice is kind of आधा अधूरा, partial. It is kind of broken. So can I say hepatitis B is a partial double-stranded DNA virus? Means when it comes in our body, first it has to complete its अपना, पहले तो अपना काम पूरा करेगा, then it will come and cause infection to me. So first it becomes a covalently circular linked DNA. So CCC DNA is what you call it. पहले वो अपना completion करता है. After completing itself, it makes or it causes infection to all of us. So just imagine it first, उससे पहले अपना DNA बनाना है. Can I say it's kind of using an RNA to make its अपना DNA? It's a kind of a retrovirus, but not a retrovirus. So that is why I call it a pararetrovirus. Very good. So it has to make a circular closed covalent DNA. You don't need to know the full form, but a closed circular covalent DNA उसे बनाना है, तभी उसको बोला pararetrovirus. If retrovirus would have been asked, ABC all were answers. But if pararetrovirus was asked, partial वाला DNA को complete करेगा, तभी तो the life cycle will happen. Maybe they just give you this much of a life cycle and they say this is a DNA virus which is partial. First it is making a CCC DNA, then it is carrying out the life cycle. Will you mark hepatitis B? Yes, you will. Is that added to your memory? You don't have time to revise now because we have very limited time. Will you mark HBV in this situation? Now if HBV question comes, the next thing comes to your mind is the life cycle, or going to be how the symptomatology is done or how the serology is done. So what are the antigens that you have? Ma'am, एक तो होता है surface antigen. जो antigen उसका antibody. So if I am doing surface antigen testing, I will do surface antibody testing. Then the next to rise is pre-core antigen. E antigen का testing करोगे तो ma'am please do E antibody का testing. Should I do core antigen का testing in the blood? No, that doesn't come in the blood. Only its antibody comes in the blood. So total how many testings will they write in the exam? Total blood mein I can do only 5 things. Core antigen is in my body, but it will not come out in the blood because wo core mein hai na, it is sitting in the virus. It will never come out into the blood. So now the first to rise, you can see nothing to mug up over here. The first to rise is the surface antigen. It will rise, and like everything, it will fall. If it will fall, then after some time its antibodies will come. So it will be followed by its antibody. There is no rocket science here. After the surface antigen, which is the next antigen to rise, right after it, देखो यहाँ पर surface antigen आया, उसके थोड़े दिन बाद pre-core antigen came. After that we have the pre-core antigen. जब तक antigen है, very good. After the antigen, what will come? Its antibody will come. What does this tell me? It tells me infectivity. Infectivity, which means if I say pre-core antigen is positive, you'll say, oh, the patient is very infective. If I say the antigen has gone and ab antibody aa chuka, you'll say, okay, this means the infectivity has gone down. So till the time the antigen is there, the infectivity is high. Once the antibody comes, the infectivity is going to be low. Then core antigen, वो तो आएगा ही नहीं. Where does the core antibody come? I'll correct this over here. Where does the antibody come? The antibody is going to come over here in the window period. Remember when the surface antigen was dropping and the surface antibody had to come, there was a gap in between. This is known as the window period, and this is where which kind of HBC comes? Marker of window period, IgM. पहले तो IgM आएगा ना, धीरे धीरे it will change to IgG. That is why you can see a total वाला line also. Total means IgM and IgG together. But starting में तो IgM will come. So now what I'm going to do is first you will fill in the table and then you will tell me the pathology वाली photos also. पहले table से start करते हैं. So whenever in the exam you are stuck in this, always what will help you and rescue you is SEMA sexy. ठीक है, SEMA sexy will help you. Because if they say that the surface antigen is positive, then they say the E antigen or pre-core antigen is positive. अगले में भी देखो, the surface antigen is positive and the pre-core antigen is positive. तो दोनों सेम लग रहा है. हेपेटाइटिस बी तो है, but acute or chronic. So look at the C वाला antibody. If it is IgM type of antibody, I will think of acute hepatitis. If it is IgG type of antibody, I will think of chronic hepatitis. Which antibody are you focusing on? On the core antibody, because core का antigen तो है नहीं, तो I will have to focus on its antibody. Surface antigen, pre-core antigen and core antibody के basis पर I will give the diagnosis of acute or chronic. In both of these, can you tell me is it high infectivity or low infectivity? Of course, in both the situations, because E antigen is present, it is going to be high infectivity. Now consider a situation, all these antigens have gone. Surface antigen negative, pre-core antigen negative, core antigen तो आता ही नहीं. All antigens are negative and all antibodies are positive. This means the person has entered into the recovery stage. That is why all antibodies positive. But if only surface antibody positive, that too equal to more than 10 international units, this means vaccine लगा था. This is a sign of immunity. So obviously we have been vaccinated. कौन से dose? 016. So if you have got 016, then you should have made these antibodies. Surface antibody level, if you get tested today, should be more than how much? 10 international units. Then you will know that I am immune and I have been vaccinated. Finally, what is the marker of the window period? It is IgM type of anti-HBC, which is said to be the marker of the window period. Is that okay with everyone? Which tells me to the last thing, that ये तो आपने पढ़ाया ma'am for microbiology, but then you had told us we will do some pathology photos also. So this has come over here as the pathology findings. क्या क्या दिख रहा है? These are the 3 photos which you will get when it comes to hepatitis. पहले तो hepatitis में what have I done? I've done a liver biopsy. Is that making any sense? Because hepatitis is a viral infection. हम viral infection में liver में needle डाल के biopsy कर रहे हैं. Biopsy I do for cancers. I should have done it for liver cancer. So now the rule is, if you would have been dealing with acute hepatitis, which are the 2 acute hepatitis? Hepatitis A and E. ये तो gastroenteritis कराते हैं. This is just diarrhea, food poisoning and all, jaundice. इसमें I don't do any biopsy because this is just food poisoning. This will go off, not a problem. I am concerned in biopsy for chronic hepatitis. Why? Because chronic में तो आगे जाके, don't you think there will be cirrhosis or hepatocellular carcinoma? There is a risk. So I need to follow up chronic hepatitis. That is where I will do biopsy. Whenever you will see the report, this is where all of you have a lot of problems. So थोड़ा ध्यान से सुन लेना. Whenever you will see a report of a chronic hepatitis, you will see these 3 things written. Either they will write Councilman bodies. What are Councilman bodies? They are apoptotic bodies which can be seen in hepatitis. Or they will write ground glass hepatocytes. If you look at this hepatocyte, it is pink because everything is pink, but there is a difference. I want you to compare. If you just compare any hepatocyte over here in the photo next to it versus the hepatocyte here, this pink is looking like washed out, as if glass liya, ground glass. You took glass and you crushed it. So you cannot even see through it, and it's not even opaque. It's got cracks in between. So that kind of a pinkish is ground glass. That indicates surface antigen. Surface antigen ka dusra naam Australia antigen. And what is the special stain for surface antigen? Orcine shikata stain. And that is what shows you the ground glass hepatocyte, which is what surface antigen of what hepatitis B के बारे में बता रहा है. So whenever ground glass hepatocytes are mentioned, start thinking of hepatitis B, versus whenever this fatty liver wala scene is mentioned. Along with that, lymphoid aggregates are there, fatty liver and lymphoid, क्योंकि lymphoid chronic hepatitis में lymphocytes होते हैं ना. You will start thinking of hepatitis C, which brings me to a question: which all hepatitis can cause fatty liver? C and D can cause fatty liver. Question in your Q bank is, which is the hepatitis which never causes fatty liver? And that is hepatitis B. B has nothing to do with fatty liver. It is C and D. तभी out of them, D पर तो you never get a question. You get a question on C only. तभी when you get a question of fatty liver and lymphoid, you will be thinking of hepatitis C. Repeating, first you will think of ground glass hepatocyte, मतलब B की तरफ जाना. Fatty liver and lymphocyte आया तो C की तरफ जाना. Which are the ones for which I want to do a biopsy? Obviously for chronic hepatitis, because that has a risk of cancer. And now once imagine I'm a pathologist, I told you hepatitis B lag raha hai ya hepatitis C lag raha hai. At the end of it, I will write the chronic hepatitis ka staging and grading, because I will tell you the stage, I will tell you the grade, you will know अच्छा low stage पर है, high stage पर है, high grade पर है, so that cancer का risk क्या है. So learn any one. Grading is defined on the basis of inflammation and necrosis. How much of inflammation I am seeing? So learn any one out of these. Grading कैसे करते हैं? By inflammation and necrosis. Staging is done on the basis of looking at fibrosis. Because you know, just imagine if fibrosis is too much, don't you think the patient is going into cirrhosis and maybe into cancer? So that is how I'm doing staging and grading. Staging by fibrosis, grading by inflammation and necrosis. Is that okay with everyone? I think I'm left with one last question and 5 fill in the blanks and you are done for the day. Which organism is indicated by the replication among the following options? ये वाला कौन सा virus लग रहा है? Not much that you can see. Some viral word written, इतना तो zoom in भी नहीं कर पाएंगे exam में, but I can notice some projections coming out. These projections over here, maybe some NA is written. As soon as the projections are HA and NA, what are the things that I think of? Yes, it is going to be influenza. Is influenza and RNA virus it is. But in the exam, ma'am, मुझे ये भी zoom in नहीं होगा ना. What is it that I can see from this magnification, that there is a virus and that virus has lots of RNAs? एक RNA नहीं है, बहुत सारे segments है. Influenza has how many segments of RNA in it? It has 8 segments. So have a look at this picture. It has roughly 8-9 segments of RNA. And it has something called HA called hemagglutinin and NA called neuraminidase. Apart from that, it has M1, M2. तो अगर मुझे इसका drug therapy करना है for influenza, I have NA and I have M2 inhibitors. नाम बता दो. M2 के लिए तो amantadine, rimantadine will always remind me that amantadine and rimantadine will always remind me of M2 inhibitors, whereas NA के लिए we have वही अपना Tamiflu, oseltamivir. Oseltamivir is going to be given from the oral route, whereas Relenza or Zanamivir, इनके तो नाम में ही है Relenza, Zanamivir, these are given through the nasal route, that is inhalation. Oseltamivir oral, Zana and Relenza by nasal. So these are going to be neuraminidase inhibitor, and M2 के लिए कौन से हैं? Amantadine and rimantadine. I'm done for the day. Just 5 questions. You have to fill in the blanks and run away and hope you never have to read this again. Dengue fever mein 5 random questions I've got which are previous year INI-CET questions. So do not forget is what I've labeled it. Dengue fever, I'm not asking you ke machhar and all. No one will ask you. They will ask you, person has come to you with fever, etc. Dengue is suspected. In the first 5 days, what antigen testing do you do? NS1 antigen testing. After the 5th day, you do antibody testing. Antigen कब तक पॉजिटिव आता है? 5 days तक. After that antibody. Question 1. If you have done antigen, then you know NS1 antigen is for what? It is for dengue. Then right now you told me the OGAG antigen was for filaria, which is settled. Can you finish off the other 2? What is this RK39? Rapid Kala Azar. So this is for Leishmania donoveni. And HRP2, it is a malaria, especially which malaria going into the brain. Falciparum का antigen is HRP2 antigen, another previous year question. वापस आओ बैट्स का आई थिंक दिस आई ऑलरेडी टोल्ड यू ना कि अगर सिर्फ बैट हुआ तो थिंक ऑफ इबोला एंड अगर फ्रूट बैट हुआ तो थिंक ऑफ नीपा एंड अदर डू नॉट फॉरगेट क्वेश्चन देन आई थिंक आई हैव ऑलरेडी टॉट यू द हेट्रोफाइल एग्लूटिनेशन टेस्ट कैन यू टेल मी पॉल बनल एंड मोनोस्पॉट टेस्ट किसके लिए था एप्स्टीन बार वायरस के लिए व्हील फेलिक्स टेस्ट किसके लिए था इट वॉज फॉर रिकेट्शिया ऑल दिस ऑल्सो वीव डन तो बचा क्या ओनली एग्लूटिनेशन टेस्ट आर डन लेफ्ट एंड यू नो दिस कैट सैट ऑन अ मैट व्हेन आई से कैट सैट ऑन अ मैट यू हैव learnt it. What is cat in Hindi known as? It is known as my billy. So that is how we had learnt it. Cat is cold agglutination test. My for it is going to be seen in test for mycoplasma. Then we have standard agglutination test. That is a test for brucella. Microscopic agglutination test. That is for leptospira. Why rat urine, rainy water wala leptospira. Uske liye I had taught you microscopic agglutination test. And this is also settled for all of us. I think mostly I am done. I am going to give you some bonus slides which are things you know. Culture media, अगर कोई summary चाहिए या फिर maybe some spotter images which are ultra easy, not too much expected in INI, but if you want to flip through them, those bonus slides will be there, some few extra pointers, but yeah, the main thing that you had to cover is pretty much done over here. Some bodies, maybe owl eye appearance ka photo I didn't show you because I know that you know it, so kya dikhana types, those kind of things are there in the bonus slides, so nothing that you have to have FOMO of. You don't read through it, I would really not have a problem because I know you will be able to solve it, but you have time, maybe 1 night 2 nights before the exam, you're traveling to the exam center, you want to go through something, just scan through the slides and I think that will wrap it up for you. Yeah, so have we finished before time? Okay, I think we have. So honestly, my plan, to be very honest, for micro was not as much as path. But if I would have told you 3 hours, 3.5 hours, then you would have, not had that at the back of your mind that I have to sit for 4 hours. So I told you 4 hours so that I could make you sit for that much of time. And now that we finished early, it's a win situation. If I would have told you 3 and extended to 3.5, you would have been sulking over it. So kind of played with you out there, but I think it worked in our favor. Now let me know any doubts. For anyone who's down, out, exhausted, please leave. Nothing more that I'm going to teach. I'm only going to see through any doubts which are important out here. Rest, abhi the journey doesn't end here. Of course, LRR from my side, done, dusted, 90% of the work is done. But every day on Telegram, either something I will be posting over YouTube or on Telegram, something or the other which will keep on going. So be in touch with me over there over the next 10 days. I've decided from May 5th to 14th, pretty much till wherever date close to the exam, I can help you. I mean, I won't be posting 1 or 2 days before the exam. That just builds up on anxiety unnecessarily. But yeah, at least till 13th or 14th, I'll try my best that every day we are doing something or the other which is not a repetition of LRR. That doesn't make sense, and not very extensive, maybe 5 to 10 minutes of a small video, of a small quiz, something just keeps you on track, keeps the nerves calm, keeps you, if you're too anxious, maybe you can open the group, attempt something, learn something, cry over it ke bhool gaye the, and then cry and get back. That's the entire thought process. Also, FMG, NEET PG students, for you guys, separate LRR hoga. If you've been a part of this, you have learned. If you will be a part of the next one, I will bring new questions over there. Content remains the same. I mean, I cannot change staph and strepto, but I can change how questions are revolving around it. So we'll have new set of questions then. Apart from this LRR, देखो RR micro में see main videos नहीं हो सकता, तो RR is your mainstay. It's a 15-hour. If you've done immunology, then it comes down to 13.5 hours. That too you have to do. I mean, what lesser than 13.5 hours will you do for a subject that gets you 15 to 20 questions? तो वो आपका मेन स्टे है. If you have revised it, then keep revising that again and again. If you are too given up on it kind of a situation, then LRR करो and go through all your previous year questions. That will give you the best, consolidated version for microbiology. Transport media for Salmonella is Sachs buffered glycerol saline. Carrie Blair is for Vibrio cholera. LRR for FMG वो अलग, वो तो अभी पहले INI-CET, same faculty teaching all three. So first we will finish the INI LRR, then we'll be going ahead with FMG LRR. Dr. Manvendra, if you've gone through previous LRR, तो इस बार वाले में ना the food poisoning and meningitis वाला tables वो देख लेना, बाकी you can stick to the previous one, that wouldn't be a problem. My advice is just go through the PDF ones. You know, maybe you'll attempt the MCQs. MCQs more the better, right? MCQ पढ़ लो और वो जो tables मैंने extra add करे हैं, they are not extra information. They are just a different way of bringing things under one roof. तो वो एक बार देख लेना. बाकी you can stick to the previous LRR. Okay, so Dr. Happy Soul, can I include Anaplasma ehrlichia in the upcoming 10 on 10 series, which I'll be doing on Telegram? Because I require photos where I can show you the neutrophil, the monocyte, and how those inclusions are seen inside it, like for Anaplasma, the neutrophils, etc. So I'll bring up those photos. Tannic acid in Leifson and Rue staining is used as a mordant. That is right, Dr. Snehal. That is there in rapid revision. Perfect recall. I'm glad, Dr. Ayushi. Keep up the spirit, keep up the confidence. FMG, guys, you will have an LRR. You will also have a TND, which is RRR on the app. And for students who are enrolled in the Resolve live classes, you are having lab 2, so usme bhi revision hoga. Whichever which way you're planning to do, revision will happen. So you will have a separate session. RK39 for Kala-Azar, no, it cannot be the investigation of choice. RK39 is an antigen CART test. CART test is never, it's a fast test, but CART tests are never gold standard, so it can't be. Bordetella, pseudomyeli नहीं अलग, वो तो अभी हमने बेसिक पढ़ लिया. See, Bordetella pertussis is separate, that causes pertussis or whooping cough, for which I told you cyclic AMP बढ़ता है. दूसरा what you're saying is pseudomyeli, that is Burkholderia pseudomyeli. That is Vietnam time bomb and Ashdown media, that also we have done. Yes, bonus contains the rickettsia table, which INI में तो सिर्फ वो wheel Felix test तक आता है. Not too much going into asking you about the lead, fen, tria, PSM and all, but wheel Felix test is asked, and that I've included over here. Sure, Dr. Ishita, I'll be including that. Noted. Whatever you guys want me to discuss, I can always include that in the 10-10 series. For NEET PG, Dr. Aspiring, if you are starting off right now, तो जो recorded है rapid revision version 11, वो पढ़ो ना. When you're starting off right now, then you know, go for the latest. If you have studied version X earlier, then stick to it. I have put a PDF on Telegram where hardly 15-20 minutes of updates I have changed, very, very minor changes. Just go through those changes. I have given the changes in a PDF with the relevant timestamp on every video on where you can find it. तो ऐसा कुछ massive change नहीं हुआ है. So if you've done version X, you stick to that. If you're starting afresh, then start with the updated version. Dr. Saida, I'll be talking about the attempting part of it. It's INI-CET, lesser seats, so you will have to go as aggressive as you can. But yes, we will be talking a lot about that as in the coming updates. That's why I said, guys, keep in touch for the next 10 days. I'm not going to spam you. Hardly you will get 1 to 2 messages on a daily basis, either a small snippet or some video or some flashcard, or maybe some advice on how and what to attempt. But yeah, I am not going to spam you with too many messages and overload you with too much of information. Hardly would take 5 to 7 minutes of your daily time, but will help you keep on track and maybe ease your nerves a little over the next 10 days. It's Pathology by Dr. Preeti Sharma. That's the name of the Telegram group. Okay. Any other questions that you have? If I've missed, either you can put it here in the comments after the video live ends, or you can put it over Telegram, which way suits you. I will be checking both the Path and Micro LRR comments till May 16th. That is your exam. So if you have any doubts, anything regarding these 2 subjects, you can put it there also. I'll be able to solve it, else on Telegram, whatever suits you. Basically, I've told you both ways, right? Okay. Thank you so much, guys, and study well. This is your go-to thing. ये तो पढ़ना ही है. Beyond this, PYQs, if you are an overachiever and you finish this and you finish the PYQs, then go back to your rapid revision notes and start revising them. But what you must be finishing bare minimum in 10-12 days for 19 subjects has to be the LRR and has to be the PYQs. After that, you do whatever time permits. That is entirely your dedication. But I've told you what bare minimum needs to be done. So thank you so much. It was wonderful. Sorry for being a little toxic over 2 days. 3.5-hour sessions, but hoping with fingers crossed that all your effort and all the dedication that you've shown by sitting through these sessions, I hope that pays off. We can only pray, and I hope all the effort that you have put into the universe, it comes back to you, it gives you the positive result. be optimistic because you don't have an option otherwise, right? So you have to think positive and there is no other way that you're thinking. I'll keep in touch with you and yes, we'll do good, I'm sure. Okay, thank you so much.